Good morning, everybody, and welcome to the Weiner Wellness Virtual Summit. We are starting off another great week of education and savings at the Weiner Wellness Center, and I'm so excited to be here. My name is Tracy Straub. I'm the Vice President of Education and Marketing with Nutritional Frontiers, and with me is our commentary group today. We have Jamie Dorley, CEO and owner of Nutritional Frontiers. Welcome back, Jamie. Dr. Gideon Orbach.
Tracy.
Good morning to you. Dr. Gideon Orbach with the Weiner Wellness Center. And Jeff Niznik back again. So guys, welcome. Thanks for being here.
Well, thank you.
Thank you for having us.
Good morning, everybody. Good morning.
Well, I thought that was great when you began with saying "and great savings," and like my mind immediately flashed to a place like what we're saving is people's health, and just having the opportunity to interact with clientele and new people and people all around the cyberspace world, and let the world know what we're up to and what our mission is and what we're doing here and how they can become involved either personally up close or remotely. So I know when Dr. Tracy said the offering you savings, we were talking about the financial savings of the prices on the nutritional supplementation, but think about the savings, the financial savings that you can have by being healthy instead of trotting down that path of disease and illness. Great way to start a Monday morning.
Absolutely. There's been so many great stories I heard over the weekend at the Weiner Wellness Week on Saturday. We had so many people come in. So we are open. You can come in live. You can join us virtually. You can do a hybrid. Some people are having their orders of products shipped right to their house. So we're doing free shipping. You also do curbside pickup if you want to pick up something sooner rather than later, or you're going to be in the area already. So any which way, we're here to help you. And I was talking to a woman here the other day, and she had a lot of back pain. And she was with a gentleman friend of hers. And I said, well, why don't you schedule with Dr. Orbach? And then finally he chimed in and says, that's what I did. He said, I was suffering from disc pain. And Dr. Orbach told me it's going to be it's going to take some time for me to work on you. And he said the difference on Dr. Orbach versus other chiropractors he had been to was the muscle therapy component. Right. And I said, well, that's a whole thing that makes it so unique is the thoroughness of the adjustment and the evaluation, plus that extra component of the muscle therapy to help loosen that up. So we are accepting new patients and be-backs here. So if you've been here before, come on back. If you have never been in, we recommend you schedule an appointment with any of the healthcare professionals. And what Dr. Orbach did for this gentleman was he did the adjustment, the muscle therapy, put him in with Adam, and then he recommended 2 nutrients. That was it, X-Flame and HA+. X-Flame to cool down the inflammation, and HA+ to help rebuild any cartilage. I think a lot of times people forget that. I remember Dr. Weiner would always say that we're a machine that's constantly rebuilding new tissue, and the building blocks of that determines how strong the new tissue is. No different than rebuilding a kitchen. So you got to continue to provide those nutrients, and that was just another example. So thanks, Dr. Orbach, for saving another person's health because, he was looking at back surgery.
Yeah, that's a great thing that you said is saving people's health. It's really what we do here. We reprogram people's minds from the programming they've got outside of the office here. Quite often, the stuff on TV and what you hear from your Joe Schmo neighbor isn't the right advice on your overall health. You're never drug deficient. Your body needs nutrients to function, and we use nutrients here, and we use chiropractic body work as well. We're saving people's health. This is really what we do. And we all see it all the time. People come in here, they have a lot of issues, and within a short period of time, they're doing a lot better. And it takes some effort. Your body didn't get this way overnight quite often. You say if you did have an auto accident or something, there's usually always other underlying conditions. You're under digested food, you got some knee pain, you got a back pain before this, and you're not going to get well overnight. But you can get well. It's just the message. Your body's always fixing itself, and it's always trying to fix itself. But quite often we're lacking the nutrients, the motivation. We have mechanical issues with our bodies, irritating our nervous system. This is like a one-stop shop. You can come in here, have great savings on products, but also this is a place to save your health. What do you say to that, Jamie?
Absolutely, and that's the exciting part about the Wellness Center is that you have such a great team here helping people out with all different types of issues. So, if you're not sure who you need to schedule with, call the office at 412-922-WELL. That's 412-922-9355. And we'll get you scheduled with the right healthcare professional and get you on your way. If you just want to drop in and ask some questions, we also do nutritional reviews. So if you want to bring your products in, I used that example the other day. A friend of mine brought in about 13 vitamins, and some of them were good and some of them were not so good. So we helped her be able to read the labels and determine what you really needed versus taking every product out there. Because the other part of it, you can't out-product a bad diet and lifestyle, and we have all the education here for that.
That's such an important point that you brought up a moment ago, Jamie, about trying to figure out who the appropriate practitioner is. When a prospective new patient or client or somebody calls to schedule an appointment, the front desk staff, whoever they're speaking with, will ask them a few specific questions about what they have going on, what their symptoms are, what they're experiencing, and then they're like, well, let me call you back in a few minutes. And not a day goes by, not a day, when I'm walking around the clinic or I'm between patients, when Ashley or Phil or Sonia will have a little notepad with a list of symptoms and say, the patient has this, this, and this. Who do you think they should see? And I'm sure Jeff and Dr. Honigman have the same experience where we're trying to make sure that the patient, the prospective patient, the new patient, gets scheduled as quickly as possible with the appropriate practitioner who's best suited to help their collective group of symptoms. And we all share patients too, that I'm constantly, you don't see Adam here doing presentations during Wellness Week, largely because he's too busy, but I share patients with Jeff, and I refer my patients, some to Dr. Honigman and many to Adam, based on what my strengths and weaknesses are as a practitioner and what that person's personal needs may be. I know that I get patients who, it might be the first time that I've seen them, but their chart is already pretty full with notes because they've already seen Jeff or Dr. Honigman, and I'm going to address something else with them. So we communicate very well internally and do a good job of making sure that people get where they belong, where they can have the best advantage to have success. So we're well organized in that regard.
Yeah, so if you need to schedule with a healthcare professional, and who doesn't, right?
Mm-hmm.
We all need to check up, especially with the physical structure of your body.
Mm-hmm.
A lot of people I know from either overuse or underuse, need to be evaluated. And it's a great way to do it by coming here. We have some incredible backgrounds. Dr. Orbach with the physical medicine, chiropractic, and muscle therapy. Jeff Niznik doing the applied kinesiology, and also the NATE. Jeff, can you talk in layman's terms about what that allergy elimination technique is? Because I'm a simple guy, and I want people to really understand the importance and the benefits of doing something like NATE.
Yeah, the body can get programmed. Well, say for instance you're a young kid. Say you're a 1-year-old child, and you get bit by a cat. And you're crying, your eyes are watering, your nose is running. And this program may set up in your mind when you're around cats, your eyes water, your nose runs. Now, you may be a 23-year-old person, a 50-year-old person. Every time you're around cats, this program's running, your eyes are watering, your nose is running. So everything is an energy, and your body's reacting to that energy when you come into contact with it. And allergy elimination technique is about stimulating points on your body while you're holding that energy. Say you're holding a jar full of cat fur, and you stimulate these points in the body, and somehow that switch gets flipped. So you don't have this eye-watering, nose-running type of reaction to it. Somehow your body, in your side of your body, it resets. And it only takes 8 to 10 minutes. It's very comfortable and relaxing to do this. You hold it for a half hour afterwards, that jar, and something in your body flips that switch. You don't have this negative response anymore most of the time. Usually it's just one treatment and that's it. Dr. Weiner learned this a long, long time ago. There was a a medical doctor up north who did allergy shots for 30 years. And he learned this treatment, got Dr. Weiner to bring this Dr. Ned Bujapad to the area. Both of those went through her training, and lo and behold, that's what the guy that did those allergy shots, this is what he did all the time afterwards. He got so busy, actually had to open up a second office to handle all the people. It was that effective from one treatment. That's what I do here. I learned this, I don't know, 25 years ago. It's a simple thing, and it's very effective most of the time.
So just a quick summary on that. So if you have allergies that you're aware of, or even if you don't have allergies, you may have what we call a phase 2 or a sensitivity. This is where Jeff can test you, because it was very helpful for me on 2 levels. One was the food allergies that I eliminated. And the second thing was I actually had a shellfish allergy that was really strong. So even if I was in a restaurant and got exposed to cross-contamination, I could have a reaction, right, which was pretty intense. So when Dr. Weiner did it on me for the shellfish, I don't eat shellfish, but I've never had a cross-contamination issue again from eating out. So there's a couple of levels on this, folks. You may not even be aware that you have sensitivities, and other things are really obvious, like peanut or cat or shellfish or something like that. So that's the great thing here, is that so many different things that people need help with, we can address here. And someone asked me this as well, think of doing everything except for medications and surgery. That's pretty much what you get when you come here.
Yes.
I think you made a good point about the cross-contamination, because we all have our primary allergies, and I know I have to avoid this, I can't eat that. But those second level allergies where, look, I'd really like to go to that restaurant and eat, but they cook everything on the same grill at the same time, and it's so easy to be triggered by a small amount of something that might be a secondary allergy. It can be cross-contamination. And you said to your waitress, I have a strict seafood, gluten, whatever sensitivity, and the waitress passes it on to the kitchen, and maybe your meal is not being cooked with that stuff, but it's sitting on the grill right next to something that you could be allergic to. So just being able to dampen down your existing allergies to go out and eat with the confidence that you're not going to have an outbreak. It makes such a sense for people to come in who, like, I've never considered that I might have allergies before, but I'd like to come in for a routine scan with Jeff and just figure out maybe there's something latent or minimal that I can at least be made aware of, if not even had corrected. So a big part of that is maintenance and examination as well.
And what I see, I do all this kinesiology testing with people, and most people have a poor response to between 50 and 70 foods. They have no idea there's so many things they have such a poor response to. And I believe it's just because we're nutrient deficient. Your liver's suffering, your kidneys are suffering, you don't digest food very well, you don't have all the nutrients to make all the digestive juices that you should make. Because when people come back after 4 weeks, after they've changed their lifestyle a little bit, they've re-nutrified their body, or more sufficiently nutrified their body, more than they had in a long, long time, I test them again, and usually they feel on 7, 8 foods, 6 foods, something like that. People have gone from 91 foods down to 6 in 4 weeks. It's just once your body will respond to the system. If you can avoid the things that are inflaming you, most likely when you eat food you test poorly to, it's inflaming you. And
usually it's things that people eat all the time, right?
Yeah. To me,
when I got mine done, I showed my son. He says, "Well, those are all the foods you eat: tuna, fish, and rice, eggs, oatmeal." It was like the stuff I've been eating for 30 years straight. Your body builds up a tolerance to that, and I think then over the top, what happens is, now you're very sensitive to it, right? You kind of have your fill. The other thing is, we may not be aware of some of the contaminants, toxins, chemicals that they use with the food. So there's a lot of issues there. So folks, if you want to make an appointment, call the office, 412-922-WELL. That's 412-922-9355. We're open every day from 8 a.m. to 5 p.m. Mondays and Wednesdays are open to 7 p.m. We do nights and weekend appointments, and we even do telemedicine now. So if you're interested, come on down. If you'd like to just come in and meet some of the people here, ask some questions, pick up some free literature, We're doing a lot of free samples this week, so you get many different types of samples at no cost just by coming down to the center. And if you purchase anything, it's on deep discounts. We have books on clearance. Those things have been flying like hotcakes. I tell you what, people love that we're able to get some of the best-selling books out there for natural health and healing for $5. So a lot of great opportunities to come on down. We're open all week. We have people here to answer questions. If you'd like to just walk in, you're more than welcome. If you want us to ship anything, you can do so just by giving us a call. It's free shipping. And we also do the curbside pickup. So, guys, let's look at the lineup for today, because this is, without a doubt, incredible lineup. So we're doing the roundtable at noon today. That's a full house there. I don't know if I'm going to be able to get any words in. We got Joe Messino. Him alone can take up the whole hour. We have Dr. Gideon Orbach and Jeff Niznik, I believe. So we're going to be fighting for airtime, but that's going to be a fun roundtable at 12 today. And I'm sure it'll be a little controversial, as always. Joe likes to stir the pot up. Before we get there, Dr. Orbach, you're going to kick it off at 9 o'clock. Jump starting your brain. Let's hear a little bit about that, because that's exciting. I need a little jump start today after the weekend.
Well, my approach to chiropractic care is that we're trying to restore communication between specific body parts and the brain, and you know, we look at the body parts that are injured, or maybe there's painful symptomatology, because that's, of course, that's what brings the patient in the first place. So we want to make a separation between we're here to treat your pain versus we're here to stimulate your nervous system and recalibrate your brain and your body talk to each other. And we'll go into some detail about that very soon.
I think you're back.
Am I still on?
Yeah, we're still going. We're live on the air, so don't stop now.
All right. So I'm not giving away any spoiler alerts, but when we do this workshop in about 15 minutes or so, we're going to talk, like I said, in more detail about brain-body connections. And we're going to talk about a few action steps in the form of low-tech exercise that can be regarded as part of a habit or a routine, part of a prehab program, or even part of a rehab program. So we're going to focus on some simple movements and some deep breathing, and some coordination. And that's really
that's what I love about your presentations, Dr. Orbach, is you provide information and techniques that people can apply right away. And usually most of these are free things you can do: stretching or lifestyle, body mechanics, affirmation, so many great things you provide, and we're always learning from these. So folks, that's a let's say must-see TV at 9 o'clock with Dr. Orbach. It's going to be a tough act to follow, but I'm going to do my best, because I'm going to address the issue at hand with the country. And it's been going on for a year now. I was talking to somebody at the Wellness Week last weekend. I said, I haven't seen you for a year. It's like we almost took a year off in time. So I'm going to address how to build your immune system with not only helping with things like the COVID, but if you're going to get the vaccine, if you're not going to get the vaccine, what about all the other things people are suffering with their immune system? You know, I'm not making any claims here, but you got to fight off viruses, bacteria, colds, flus, all the toxins we're exposed to. And, you know, it's not only to live, but to really to thrive. We want people to have optimal wellness in their life. And the key is to build up that immune system. We live in the Steel City, of course. We're big proponents of defense in this town. And we want to have a strong immune system to help protect you, because I learned a few weeks ago in Dr. Tracy's seminar down in Tampa was that we're exposed to hundreds of viruses, if not thousands, viruses, bacteria, toxins. Our immune system is always working, and how well it works will determine how our body responds. And doesn't mean you're going to guarantee to be safe from everything, but I guarantee one thing: it will reduce your risk. And if you do get exposed to something, it will reduce the intensity. So I'm going to give you some great natural strategies on how to rebuild and continue to make your immune system stronger. And now we need it more than ever, because, you know, COVID is going to come and go, but there's going to be something else right around the corner. And then look at all the other chronic diseases that people are suffering from. So immune health at 10 o'clock today. 11 o'clock, we have a special replay of a highly requested show with Dr. Tracy, Joe, and myself. And then we got the roundtable, and then we got Jeff. 1 o'clock today, Jeff. Let's hear what you're going to be talking about.
Yeah, the title of my topic today is why you're fatigued, lethargic, and have low energy. There could be a zillion different things that's bringing your system down. And I have a very simple method of, scanning a person's body and getting your body to communicate with me, or with the both of us really, what's going on. And you can be tired from eating a food. You can be tired from eating toxins in food. You can get tired from the obesogens and the other chemicals they put in food. You have an overgrowth of fungus in your system, bacteria, virus, and so forth. We're going to get into what these things are, how to ask the body what's going on, and then what you can do about all this. One person can get fatigued from one thing, and 10 other people can have 10 other issues why they're fatigued. So we're going to teach you how to ask the body, communicate, your energy levels and get your health back up. That's about it.
Well, that's great, Jeff, because so many people I know are suffering. And what I usually ask people nowadays when they say they're tired, right? Family members, kids, friends, colleagues, whatever. And I ask them this question, and you guys, I want to get your feedback on this. Are you physically tired or mentally tired? Right? Can you explain the difference, Jeff? Because I think a lot of people that I know are more mentally tired because they haven't done anything physically.
Yeah, isn't that the truth? They haven't done anything physically. I ask people quite often, do you get some exercise? And like, no, I'm too busy. And I'm like, you think you can wedge out maybe just 10 minutes a day, 3 times a week? Get on an exercise bike and pedal for 10 minutes. Just get that cardiovascular system going, and it gets their wheels turning a little bit. Like, you know what? Yeah, I've seen TV this week. If you've seen TV, chances are you can pedal while you're watching TV and try to get that in. And I think people really underscore the importance of moving your body. It's hugely important to stress your body, because your body responds to the stress and it makes you better. If you go sprint to the corner down there, you'll be huffing and puffing. Your body's going to respond to that. And then the next day, if you tried it again, you can sprint maybe 1.5 times further with the same amount of stress to your body, and keep doing that. And before you know, you can sprint to the other end of the block and back. Your body's responding to that, and that's developing your cardiovascular system, helping you detoxify your body. It's doing all these tremendous things for you, and that's something that is completely overlooked in so many people, because they just think, I'm too stressed, I got too much going on. That'll pay benefits mentally as well as physically. Help your body make brain neurotransmitters that gives you balance and calm and control. The physical aspect of the body shouldn't be overlooked. With just by exercise and stressing it pays dividends in both mentally and physically.
That's a great point. Dr. Orbach, when people come in and maybe they're struggling with some physical limitations, how do you encourage them, and what type of recommendations do you give them to be a little more active? What are some things they can do?
Well, the first step when you see if somebody has physical limitations, are these physical limitations, like this is a barrier, and they might need to have severe medical intervention. So let's disqualify that criteria or that category of people right off the bat. And we're going to take healthy people who've just been inactive for whatever period of time. And we break it off into small chunks that I'm thinking in particular with this one woman who I've been treating for she has a shoulder problem. She has some shoulder dysfunction and neck, upper back, shoulder pain. So we've been doing some work, of course, mechanically with her in the form of a treatment. And every time she comes in, or every other time she comes in, I give her a new exercise to do. And I mean, I could go on forever. I mean, I won't run out. She'll run out of interest before I run out of shoulder rehab exercises. But I know she's doing them. I mean, I can see the progress. But I also know that if I would have given her half a dozen exercises on day one, my little recommendation sheet would have got put down on her desk, and the work of the day would have piled up on top of it, and more would have piled on top of it. And maybe a few weeks later, she'd clean out her desk and find my recommendation sheet. No, that expired. Throw it out. So when you give people small chunks, like I like your point, Jeff, about 10 minutes of exercise bike while you're watching TV. I mean, that doesn't sound really daunting. That sounds like a great way to start. And you might actually like it. You might actually like the way you feel when you get off of that exercise bike. 10 minutes can become 20 minutes, 3 times a week can become 5 times a week. And next thing you know, we have a regular exerciser who's hungry for more. But I think the magic really occurs when you start in very small chunks, small actionable steps. You gain compliance, and people see the immediate benefit, and then they want more. So
Yeah, I love that. You know, it could be anything with activity, right? Like yesterday, I worked out in the morning, and then in the afternoon, I took the dog for a walk. It was so nice out, right? And your body, this is a cumulative effect, right, of all the steps
Right.
you take every day and the action. It could be small increments. It doesn't have to be anything super intense. And nowadays with technology, they have upper body bikes. You can pedal with your arms. You know, they have bands. They have trainers. People can swim, walk. I just tell people be consistent. And as I learned from Dr. Tracy is don't work out to punish yourself because what you ate yesterday, right? Work out to make you stronger. And I do it for the mental benefits, and the physical is just a positive side effect. So we're going to wrap it up today at 2 o'clock with the one and only, the manager of the Weiner Wellness Center, Mr. Joe Messino. And his title is What is Q? King Q. So can't wait to hear Joe today. Sure, he's going to go into some really incredible research and education that everyone's going to benefit from. So any parting shots for your fans out there, Jeff?
Yeah, when we talk about exercise, you guys can all attest to this too. There's days it's like you don't want to do it, and then you force yourself to go, and you're grumbling. It's like I don't want to do this, and then you're 2 minutes into the gym, you're like, I'm so grateful I'm here and did this. It's just a whole mind game. You just keep going.
Ask yourself, do you feel better when you're done?
Always.
Yes, you always do.
Always.
Yeah.
Dr. Orbach, so many fans are out there texting about you. Any parting shots? And here she is.
Well,
I'm rounding you guys up.
when I'm running out of motivation or tiring at the end of the day and thinking about coming home to go work out, or if I'm lying in bed, my internal alarm clock goes off before my alarm clock on my phone. And so there are a couple of days a week that I like to work out before work. So when I'm procrastinating or thinking about how warm it is in bed and how cold it is in the living room floor, or how tiring the day was, I give myself a little pep talk and like, you earned this workout. I'm looking at it as a reward. My workout, I'm treating myself to a workout, and it's a whole different mental approach. Like I worked hard today. I want recognition. I know I'll recognize myself. My reward is going to be a workout. So that's just a different way to look at it, I suppose.
Well, that's great. You guys got me fired up. So thanks so much. Thanks, Dr. Tracy. I appreciate the opportunity to be on. And I'll see everyone at 10 o'clock today on how to build your immune system.
So stay tuned, guys, because we are coming right up with Dr. Gideon Orbach. So thank you, guys. Have a great day.
All right. Thanks, everybody.
All right, Doc, we'll take a short break and we'll be back at 10 o'clock, okay?
How about let's make it 9?
Yeah, 9, sorry. I'm ahead of myself. Okay.
That's all right.
Well, good morning, everybody, and welcome back. Thank you for joining us today on the Weiner Wellness Virtual Summit. With me this morning at the correct time that I messed up earlier at 9 o'clock is Dr. Gideon Orbach. He is going to be talking to us about an incredible topic, Jumpstart Your Brain Part 1, what your Chiro can do for you. So good morning, Doctor. Thank you for being here.
Thank you. Good morning, Tracy. It's always a pleasure. This is, I want to start off by saying I remember in our pre-COVID world, all these workshops were in person. And there's a collection of people who really, really like to give me a hard time. And they'd come to the workshops and they'd tone it down a little bit, but they were active participants asking questions and prompting me to occasionally go off on a tangent and making it really more of a conversation than a lecture. And so we have, I believe there's a chat box or there's a place on Facebook or whichever venue you're checking in on to ask questions and to make yourself heard. So I'm going to do the best I can to keep an eye on the chat box if anybody has any questions or if they want a point clarified or they want to involve themselves or even just type in a greeting and say hi. And I check in with Dr. Tracy throughout the workshop to make sure that I'm not missing anything. So I want to make sure that there's a little bit of as much audience participation as we can possibly have through the technology. So this is your open invitation to involve yourself. That being said, my name is Gideon Orbach. I'm closing in. I started practicing chiropractic in 2001. So as this year just began, but as it winds down, it's going to be 20 years for me. The last 13 and a half have been here at the Weiner Wellness Center. I've had the opportunity to practice in other places, including New York City, the metropolitan Washington, D.C. area. I practiced in Western New York in the Southern Tier. And I've also had a chance to practice in Jamaica, the island, not Queens. So I've been around a little bit and I've seen some really interesting things and I've trained under some incredible people. And at this point in my career, I've trained some incredible people. So the practice of chiropractic is still exciting to me. And I look forward to having the chance just to have an informal but structured opportunity to present what I do and explain what I'm about. And that's what we're here for. I believe that this is the lecture 1 that I'm doing this Wellness Week, what your chiropractor can do for you. Just shameless plug, later in the week, I'm going to do part 2, which is what your chiropractor can teach you how to do for yourself. And today what we're going to talk about is the working relationship between the brain and the body and how it can be influenced with chiropractic care, hands-on treatment, and low-tech exercise. Now, before we really get the ball rolling on the presentation and the interaction, the first thing we have to do is we have to have a few definitions so we know that we're talking about the same thing. And the first term I'd like to define is the word health. We're all here for Wellness Week, whether we're live or virtual or pulling up to the parking lot to receive our nutrients at curbside pickup or whatever our status is. We're all in some way, shape, or form here because we want to be healthier. We want to learn strategies and things that we can do for ourselves and things that other people can do for us and how we can take care of ourselves in order to be healthy. So if you have a definition of health, now would be a great time to type it into the box on the comment section. But I'm just going to give you mine. Being healthy means having the ability to recognize, interact with, adapt to, and overcome your environment, both internally and externally. So we're going to recognize, interact, adapt to, and overcome our environments. Our internal environment, that's our chemistry. That's our neurochemistry, all of the neurotransmitters. Those are the chemicals that the brain uses to communicate with the body. They're our digestive juices, the hormones that we make, internal chemistry. Sometimes our internal chemistry can be corrupted by candida or a parasite or something that we want to take a specific nutrient or a specific treatment plan in order to eradicate. Our external environment, well, you guys are my external environment. Me speaking into the computer to talk to you, I'm part of your external environment. What's going on around you? So we certainly want to be able to drive from point A to point B without getting agitated by somebody else's road rage, causing our own. Good adaptation to the external environment. We certainly want to be able to go out to eat and enjoy a nice dinner cooked by somebody else and not get food poisoning from it or not have it trigger an allergic reaction. That's our internal environment, adapting to the chemistry that we put into our body. So far, so good? Okay. The next important word that I want to touch on is pain. Pain, by definition, is an individual, emotional, subjective response to a noxious stimuli. So let's start with a noxious stimuli. What would that be? If you step in a pothole and roll your ankle, that pothole is a pretty noxious stimuli. If you eat food that triggers an allergic reaction, that could be a noxious stimuli. Getting bad news, that could be a noxious stimuli. So pain is individual, emotional, subjective response. So the things that cause me pain and the things that cause you pain and the things that cause the next person in line pain are going to be three different events that we all have a different, what's called a pain tolerance or a pain threshold. So not all of us are going to be agitated the same way by the same stimulus. So it's subjective. And pain is an emotion. So if the doctor or the therapist or whomever ever told you your pain is all in your head, well, where else would it be? Maybe we can have a very good example of somebody who has a specific body part that's been injured and it hurts. So the injury is a noxious stimuli. The pain is a product of how is that noxious stimuli affected body tissue, and how is that body tissue influencing our neurochemistry, and how is our neurochemistry in turn responding by telling us that we're in pain. And that's what I'm specifically interested in, and that's what I do in the clinic all day. So what I'm primarily interested in is intercepting the messages between, say, a shoulder that somebody slept on all night, maybe a back that was twisted or torqued shoveling snow, maybe an ankle that was rolled in a pothole. All of these injured body parts are going to take their turn to send messages into the nervous system throughout the body, up into the spinal cord, and those messages will ascend up the spinal cord into the brain, and the brain will in turn interpret these messages and say, we're in pain now. So what I'm interested in doing is intercepting those messages and manipulating them in such a way that the brain receives a different message. And my main tool to do that is through chiropractic adjustments, but I use, and we're going to talk about that in detail, but I use other tools as well. And one of my favorite tools to use is low-tech exercise. So what we're going to do is we're going to take a quick break from our conversation, and we're going to do a little bit of deep breathing exercise together. And what I want everybody to do is we're going to take the area of our body from the bottom of our chest, the bottom of our sternum, the top of our abdomen, right here, and our belt buckle. And what we want to do is, whether we're standing or we're sitting, it doesn't matter. We want to be as tall as possible in that region of our body. So we're going to lift our chest up and push our belt buckle down. So we're going to be really tall in that specific region. Now, I don't know if you can see me as I'm going to do this on the computer, but as I lean forward and put my head down into a relaxed position, which I really don't want to do, I'm still very tall in that midsection of my body. So this is going to be an important exercise, not just to help us breathe deeply, but to improve our posture. Long. Now our shoulders, what we're going to do is we're going to let them drift backwards. And our shoulder blades, the wings on our upper back that cover our rib cage, they're a diamond shape, they're a triangular shaped bone, And I want you to think about bringing your shoulder blades to the middle with a soft squeeze. We're not going to squeeze them as hard as we can. And we're going to let them drop down so that the bottom of the shoulder blades are going to start to move in the direction toward our belt. Now, once we've achieved that position, if you're sitting, you should feel like the chair is supporting your body, and your upper body got very light all of a sudden, because you're positioning yourself in such a way that you're well balanced, and you're not using muscles and joints and bones and the skeleton and connective tissue to stabilize and support yourself. Rather, your whole torso is now stabilizing itself as a single unit rather than as a collection of parts. So once again, we're going to be very tall in our abdomen, meaning we're taking a lot of distance between our belt buckle and our bottom of our sternum, the top of our abdomen. We're letting our shoulders roll or drift backwards. And once we're in this position, we're going to inhale through our noses. So we're going to bring in all this oxygen without allowing our shoulders to shrug up. We're going to keep our shoulders in that relaxed position. So inhale, and you should feel your chest lifting and your abdomen expanding with all of that delicious oxygen. And we're going to hold it and hold it and hold it some more. And now blow out through your mouths. Let's do that again. Big deep breath in through your nose without relaxing your posture. Keep your body stabilizing itself. And we're going to hold, and we're going to hold, and we're going to hold again, and blow out through your mouths. One more time. Big deep breath in through your nose. And we're holding, and we're hold, and blow out through your mouths. Now, what's going on here? First of all, every single metabolic process in the human body is oxygen dependent. So if we're going to protest something, I don't know, we have a lot of things out there that we could protest. So this is going to be just a random protest to say I'm angry and I think there should be more gluten-free cake available. Some of us are going to go on a hunger strike. Some of us are going to go on a thirst strike. And some of us are just going to hold our breath until we get what we want. Who's going to fold first? The people who can't hold their breath. Nobody can hold their breath past a certain point. Oxygen is one of the most critical ingredients we can possibly put into our body, and we have to feed ourselves that oxygen constantly because every single cell, especially our nervous system, our brain, is dependent on that oxygen. I just saw a question flash across the screen about an exercise for sciatica, and this person's husband is a 600-mile-a-night truck driver who's suffering from sciatic pain, and the answer is yes. I do have exercises for sciatica, and in fact, in a certain sense, we're doing one of them right now with this deep breathing, and I'm going to explain in further detail, and we'll talk more about sciatica in detail at a very upcoming thread. So we talk about that pain being a neurological phenomenon. It's interpreted in your brain as an emotion. So we want to break that cycle of what your brain is interpreting. And if we start to feed the brain more delicious oxygen and we gasp for air less and we do less breathing from here and more from our deep diaphragm muscle, it puts us into what's called a parasympathetic state. If we subdivide our nervous system into two categories, category one is what are we doing voluntarily? If I ask everybody to wave, you can wave, you understand the language, you can do that. If I ask you to dilate your pupils, now we have a problem. We have to have some sort of stimulus. You don't have voluntary control over the muscles that dilate and constrict your pupils. So we're going to call that non-voluntary activity our autonomic nervous system. And then our autonomic nervous system can be subdivided into two categories. One is going to be parasympathetic, and the other is going to be sympathetic. The parasympathetic nervous system is kind of like our wine and dine and relax and just kind of slow down, rest and digest nervous status. Our sympathetic nervous system is our all wound up, ready to fight, ready to flee, ready to fight. We're in a tense situation. Pain exists in that sympathetic state. So when we talk about a long distance truck driver sitting in his small confined cab for a long period of time, 600 miles worth of time, probably creating a friction rub between his body and a seat, irritating free nerve endings, causing sciatic-like pain. Whether we're talking about a weekend warrior athlete straining an ankle or a knee or a shoulder on the basketball court, whether we're talking about somebody who shovels snow 2 or 3 times a year and strains their lower back doing it, all of these cases share one common event, and that is that their bodies are shifting away from a parasympathetic state and into a sympathetic state where we're tightening up, we're winding ourselves into this pain status, this pain phenomenon scenario. Our brains are interpreting the chemistry that's in the chemical messages that are being delivered as you should feel pain. So when we talk about that deep breathing exercise, that's going to actually be the first step towards pain control, regardless of where in the body the person is feeling their pain or their discomfort. So far, so good, Dr. Tracy? Okay.
Oh, great.
So far, so good. Okay. So when we talk about those pain pathways, and we talk about why the pain is in your head, and we talk about that sympathetic nervous system, the way nerves communicate with one another is they form what are called synapses. A synapse is where two nerves don't necessarily come together like a continuous rope, but rather there's a tiny, tiny little gap, and they communicate with each other at the gap. And at the gap, we have chemicals and messengers and neurological transmissions jumping from one nerve to the next nerve. And what happens is nerves of the same diameter or the same size form synapses with each other. So we have nerves that are a certain size that convey painful messages. We have nerves of a different diameter which might convey movement messages. So if I want to lift my arm up to my side, my brain is going to send messages out to my arm to get it to lift, and they're going to travel around my body on a certain diameter size nerve. If I feel pain in my shoulder, it's going to be because nerves of an entirely different diameter are synapsing together, sending the message back to my brain. So the sympathetic nervous system, that wound up, that tight phenomenon, that fight or flight, my body is tense, I'm making my body a very hospitable environment to experience pain. All of that occurs on a specific diameter nerve fiber, and that nerve fiber is almost identical to pain fibers. So the sympathetic nervous system and the pain system form artificial synapses with one another that are called an EFAPS. That EFAPS is a place where we have connections between fight or flight, poor digestion, heart rate starts to escape, and we're having a rapid heartbeat, blood pressure goes up, and pain transmissions all become linked. So once again, for that person who's sitting in the cab of the truck, who's an over-the-road trucker, for that person who shovels snow 2 or 3 times a year and develops back pain from using muscles that are unaccustomed to that activity, to the person who's playing basketball once or twice a season and twists their knee or their ankle. Our mission is to get them out of a sympathetic state, put them into a parasympathetic state, and use hands-on mechanical techniques to help them break their pain cycle. So when we talk about breaking up the pain cycle, and we talk about deep breathing, the next big criteria of exercise that we want to talk about that will help a sciatic patient, a strained back, a strained knee, are balance exercises. If you are struggling to find your balance through exercise, doing something like walking along an imaginary tightrope, maybe that's too easy for you. Walk along the imaginary tightrope with your eyes closed. If it's too hard for you, just stand with your feet one in tandem with one in front of the other, as if you were on a tightrope. When you're working to find your balance, you're coordinating your body, or you're calibrating your body once again to work in a single functional unit, not as a collection of parts. And what that's going to do is, one, it's going to be what's called cerebellar exercise, and two, it's going to help break up that sympathetic state and move us into that wine and dine, relaxed, less pain parasympathetic. So let's talk about cerebellum for a second here. The cerebellum is part of the brain. It's in the back of the brain. And what the cerebellum does is it helps to govern or mediate coordinated movement. So when we're walking, if we put our right foot forward and we swing our left arm at the same time, and then we bring our left foot forward and swing our right arm, that's called a cross crawl, and it's coordinated muscular activity or coordinated body activity. And that's all done through the cerebellum. If we're sitting in a crowd and we get up out of our seat and try to get out from our aisle without stepping on anybody's toes, and we're doing this little movie theater dance or ball game dance to go to the bathroom, and we get out of our crowded section to walk to the aisle to be able to get out, and we don't step on anybody's feet and we don't trip over our own, that's cerebellum acting to help us orient our body in space. Now, the cerebellum does something else very important beyond that coordinated activity, coordinated movement activity. And that is, when the cerebellum fires, it inhibits the sympathetic nervous system, and it gets the parasympathetic nervous system to dial up. So if you're a long haul trucker with sciatic pain, two great things to do are, every time you can take a stop, or even if you can concentrate on your driving and do this at the same time, just as we talked about, make yourself long in the torso, sitting up straight, shoulder blades are sinking, and just start breathing in deeply. Inhale through your nose, hold it for 1,001, and we're going to do more of these together in just a few minutes, and exhale through your mouth. When you take a break, when you're in the cab and you get out to go to the bathroom or to get a bite to eat or just to stretch your legs, over exaggerate the walking and turn it into a march in place, and walk in such a way that you're going to bring your left knee all the way up as high as you can towards your chest, and you're going to lift your right arm up as high as you can with your left leg, and then switch back and forth almost like you're marching in military, over exaggerated military fashion. Now, there are a lot of reasons why somebody might have specific sciatic pain, and I'd like to have a chance to evaluate this person and figure out specific, tailor-made for you, not a one-size-fits-all. What can we do for your sciatic pain? What kind of exercise might be appropriate for your back and for your hips that are condition-specific, not very simply, well, there's a sheet on the wall that says if you have sciatic pain, do this stretch. We're not dealing with a one-size-fits-all circumstance in the specific regard. In the general regard, the deep breathing and the coordinated muscular activity, specifically the marching in place, specifically walking along an imaginary tightrope and fighting for your balance, trying to maintain it, really, really good general exercises to limit pain. So we touched very briefly. We're going to go into a little bit more detail. The cerebellum. I hope this has never happened to anybody out there listening, but if you've maybe watched Cops or watched the evening news at some point, you see a police checkpoint, a DUI sobriety checkpoint. And what the officers are doing is they're having the suspects do a field sobriety test, which is really basically a neurological exam testing the integrity of the cerebellum. Can you touch your finger to your nose? Can you touch your finger to your nose with your eyes closed? Can you walk in tandem along a straight line? Can you march in place without deviating out too far to your right or too far to your left? These are the same tests that a neurologist would do in a comprehensive neurological screening in the hospital or their private office to check the cerebellum. Because the cerebellum is the part of the brain that in the presence of alcohol will be the first to be deprived oxygen. So we talk about deep breathing exercise and all the good that it can do. Let's put at the top of the list, we said that every metabolic process in the human body was oxygen dependent. So you're feeding every single system in your body when you have a deep breathing state. 2, we talked about that deep breathing in the context of feeding the cerebellum and making sure that it doesn't become deprived of oxygen, or it doesn't become hypoxic, or it doesn't dehydrate. And the cerebellum is going to help to inhibit the sympathetic nervous system, which once again is our fight or flight nervous system, our wound up, our making our bodies hospitable to be a painful environment. And it gives the parasympathetics, the wine and dine, the calm you down. It gives that aspect of a nervous system a chance to flourish and to go into its protected state, which will help us to suppress the pain that's moving through the painful stimuli that's moving through our body toward our brain for that individual emotional experience. So the next thing we want to do is we want to reinforce this deep breathing. So we're going to do this exercise together for just another couple deep breaths. I hope you guys feel as good doing this as I do. We're going to make ourselves as tall as possible in our torso. Once again, the spot where our rib cage ends at the bottom, at the top of our abdomen, down to our belt buckle. We're stretching that as much as we possibly can. And we're going to get our shoulder blades to sink down. And we're just going to hold this position. And our bodies are essentially going to support themselves as a single functioning unit, not as a collection of parts. So you should feel very comfortable and very locked into this position. Now, big deep breath in through your nose. And our torsos are expanding as they fill up with air, with delicious oxygen, but our shoulders are not shrugging up. So we're inhaling, and we're going to hold, and we're going to hold, and we're going to hold again, and we're going to hold some more, and blow out through your mouths. Again, another big deep breath. In through your nose. Hold, hold, hold again, and blow out through your mouths. One last time. In through your nose. And hold, hold again, hold some more, and blow out. Okay. So we talked about walking along an imaginary tightrope for a balance exercise to synchronize our bodies and to stimulate our cerebellum and to inhibit our sympathetic nervous system. We decided that if that was too difficult to walk along that imaginary tightrope in a tandem walk, it's okay to build up to that point simply by just standing in that position. We talked about if it's too easy for you, if it doesn't present enough of a challenge, try with your eyes shut. And decrease the environmental stimuli and the input that you're getting from your visual fields, and just rely on your body to find itself in space. Next coordinated activity, I'm going to illustrate with my hands, but this is really going to be done with your feet. I'm going to put my right heel into the ground so my toes are up as high as they can. And I'm standing on my left side on my tiptoes, and I'm just going to switch in slow motion back and forth. Toes are on a straight line, so both feet are facing 12 o'clock. There's a line right across here, so I'm not deviating one foot out to my right or out to my left, but I'm walking straight ahead without actually walking. Heel all the way down, toes all the way down, and we're going to switch, and move slowly, and move slower, and speed up. And we're moving our feet in that preordained manner. Now, there are 28 bones in each foot. And of those 28 bones, 26 of them are movable. If you keep your foot facing 12 o'clock, and if you move as maximally as you can, all the way into flexion and extension, heel all the way down, heel all the way up, you'll move all 26 of those bones the way they're designed to move. Now, why is that so important? Well, first of all, we can talk about all of these exercises as prehab, getting your body to move the way it's supposed to and reinforcing proper mechanics to prevent injury. 2, we can talk about them as rehab. What if your foot or your ankle is injured and you want to retrain it to move the way it's supposed to? Number 3, if you were tuned into my talk on Saturday, we talked about workstations and how you can, what can you do at your home workstation to keep your body and your mind stimulated and engaged all day long. We talked about a few very specific exercises that you can do while you're sitting right there at your desk. Right now, guess what? Same exercises fit perfectly into neurological rehab and keep your body and keep your brain engaged with yourself at your desk. Things you can do at home without any equipment. The same exact exercises, the same exact principles apply in so many different contexts. Now, number 3 reason, why is that foot drill so important? Well, this is my favorite. This is what I do as a neuromusculoskeletal chiropractic. If you could imagine a string of dental floss, and we're going to tie a knot put it between my bottom 2 front teeth, and then somebody's going to take the other end of that dental floss and they're going to pull, and they're going to force the bottom part of my jaw to come forward. And we're going to start to play tug of war, where these muscles up here, which are very strong to chew, and they're capable of pulling backwards to get my jaw to retract against the pressure that's being exerted as somebody pulls that string of dental floss, but that's not what they're designed for. So these muscles are going to strain, and they're going to become injured, and they're going to inflame and become irritated, and they're going to prevent me from opening and closing my jaw and chewing comfortably. And the whole thing is going to hurt. So if we're going to fix this, we got to do 3 things. 1, we got to get rid of the inflammation that builds up. Inflammation is a chemical phenomenon. We like to get rid of inflammation with nutritional supplements. I'm a big fan of turmeric and fish oil as anti-inflammatories. All week long, people are doing presentations on products. So I'm going to leave that to the details of those good folk, and I'm going to dwell on the mechanics. The second thing that we have to do is we have to repair the mechanics of the hinge of the jaw. That means that we have to get these muscles to come out of spasm and to relax. And maybe we have to manipulate the jaw at the hinge a little bit to coax it back into its proper movement pattern. We might even have to force it a little bit. The third thing that has to happen, you got to quit pulling on the dental floss. Otherwise, we're going to do the same thing over and over again. This is the big principle of neuromusculoskeletal chiropractic. Muscles, tendons, and the skeleton behave the exact same way. A muscle or a group of muscles or an action of muscles are going to spasm. That means they're tightening and pulling in a way that's disadvantageous for us. Those muscles all attach to tendons, and the tendons are like the dental floss. They're a fixed length. Those tendons are going to connect from the spasm muscle to the injured joint. And what's going to happen is we're going to lose the mechanics. The joint's going to fail in terms of its range of motion. It remains to be seen whether anything gets misaligned or put out of place. I have my doubts as to whether or not that happens. But this joint certainly loses its ability to move through its proper plane of motion. and the whole complex starts to inflame. So using the dental floss analogy, we can talk about muscles in the lower back tightening, pulling in a direction that's disadvantageous, possibly supporting somebody while they're sitting in an uncomfortable trucker seat, possibly musculature of the hip, possibly the truck goes over a pothole or uneven road with bad shock absorbers. These muscles start to react and they're tightening. They start to pull asymmetrically on the tendons that that these specific muscles attach to, the lumbar multifidus, the spinal erectors, the longissimus, the iliocostalis muscle. These are just anatomical parts. They're fancy anatomical words for muscles in your back. Those muscles start to clamp down. They attach to joints, to bones along the pelvis, in the hips, and in the vertebral column. And what happens is we stop moving those joints the way that they're supposed to. If you look at the spine from the profile view, it's a system of concave curves stacked on top of a convexity, stacked on top of a concavity. So the spine is a spring-loaded shock absorber. In the event that that shock absorber fails because of the asymmetrical pulling of those muscles that I mentioned a moment ago, possibly due to the compression of sitting on an uncomfortable seat for 600 miles a night, then those bones of the spine stop moving with each other the way that they're supposed to. Now, a moment ago, we talked about the foot drill, the seated gait, moving your feet all the way up and all the way down in opposite tandem with one another. When we do that, we talked about triggering the cerebellum because we have coordinated movement that we're working on. And we talked about moving those joints of the feet, those 26 movable bones, through their full range of motion. The joints of the feet, the joints of the jaw, the joints of the spine, the elbow, all the joints of our body share a very unique property. And that property is this. There's very specialized nervous tissue that lives in those joints. They're called receptors. They're pressure-sensitive mechanoreceptors. So what receptors do is they receive information from the environment and transmit it in such a way that the message is picked up, goes into the nervous system to a peripheral nerve, from the peripheral nerve to the spinal cord, traveling up the spinal cord to the brain, and then the brain is interpreting those messages as, hey, what's going on here? Where are we in space? Is the joint moving the way it's supposed to? Is there too much pressure? Is there not enough pressure being placed upon this nervous tissue? So these pressure-sensitive mechanoreceptors, they become compressed. The bones of the lower back, the lumbar spine, the pelvis aren't moving the way they're supposed to. They become compressed when the feet are not moving the way that they're supposed to, and the bones of the feet don't move through their prescribed ranges of motion. And then what happens is the radar goes blank. When those pressure-sensitive mechanoreceptors are compressed, they cease to send the appropriate information into the brain, into the spinal cord, and subsequently to the brain. And now the brain doesn't receive feedback from an area of the body. So what happens? The brain has to assign information or assign feedback. And what happens is the brain starts to fill in those gaps with different chemistry. As those pressure-sensitive mechanoreceptors, cease to fire, we start to have different chemistry experiences, and those chemistry experiences come from something called substance P. When substance P fires into the nervous system, the brain interprets that as pain. So if we can move our feet, if we can move our spine, if we can move our shoulders, instead of developing substance P, we're going to send messages that lead to our natural endorphin system starting to fire, chemicals that suppress pain, the chemicals that make us feel good. So what neuromusculoskeletal chiropractic is all about is finding areas on the body that are not moving the way they're supposed to. For the people who've been my patients, I mean, I know that 100% of you have come in and said something like, I feel headache. I feel like I have headaches. My neck is stiff. And you feel my hands scanning the joints or the bones of your neck, your upper back, your shoulders, maybe even down as low as your pelvis. We're not looking at this as there's one spot that causes your headache because this is the only area that's not moving the way it's supposed to, or this is the only area that's tight. We're looking at this as the additive properties, where the headache is a symptom of not just one spot, one bone in the neck or one bone in the rib cage not moving the way it's supposed to, but rather what's the whole spine doing as a functional unit. Once again, when we sit up in this position with our shoulders sunk down, our top of our abdomen and our belt buckle being separated as much as possible, and you're sitting up straight, what you're really doing here is accentuating the convexities and the concavities of your spine, turning your spine into a spring-loaded shock absorber that it's meant to be, using your torso as a single functional unit to be able to support yourself, and taking stress off of individual body parts, meaning that your pressure and your weight and your mass are all being evenly distributed to the places where it should sit. So when we talk about the spinal movement and we talk about your body being an entire system and not an individual group of one part and another, and this part is dysfunctional causing me headaches and that part is dysfunctional causing me shortness of breath, we're looking at this as how is your body working as a group? Are you able to swing your right arm forward as you step forward with your left leg and vice versa? Big window into how healthy is your cerebellum. The healthier your cerebellum might be, the more likely you are to be able to shift very quickly into a parasympathetic state and away from a sympathetic state. So we're using that very same dental floss story to say, where are your muscles tight? Those are places where I'm going to use stretching techniques and muscle therapy, trigger point pressure techniques, and active and passive release techniques. These are all names of techniques to get rid of muscle tightness. These are all reasons why I might recommend that the patient take magnesium or even some B complex or B6 vitamins to help facilitate better muscle relaxation. And then asking the question, where on the skeleton, presumably, but not necessarily on the spine. I see people for shoulder dysfunction, rib cage dysfunction. I have people whose main complaints are their elbows. Where on the spine are we going to be able to make it, or where on the skeleton, I should say, are we going to make adjustments that are going to allow the joints to move the way they're supposed to? And when we see that movement that's occurring the way it's supposed to occur, we know that those pressure-sensitive mechanoreceptors are not being compressed. They're not being choked off. They're allowed to fire. And when they fire, once again, we're starting to release those natural endorphins and the natural enkephalons, and we're starting to reduce or inhibit the amount of substance P that we're generating. Our brains are receiving the message that says, hey, it's time to start feeling good. There's no reason for us to sit here in this pain state, in this sympathetic, wound up situation where we can form these artificial synapses, these ephapses, where the sympathetic nervous system and the pain fibers start to cross-talk with each other, telling our brains that not only are we in good shape to start feeling pain, but let's let it persist for longer and longer periods of time. And we're breaking up those cycles, and we're re-educating the body to be coordinated, to move through space comfortably, to act as a single functional unit, to be more supple and to be able to be more flexible. And we're getting the brain to be stimulated with good messages. And when I say good messages, once again, we're going to shift out of sympathetic toward parasympathetic. And I should throw out this disclaimer here. Nothing is all good. Nothing is all bad. We need to have a sympathetic nervous system. Our species would not have survived all these years if we didn't know when it was time to fight and when it was time to flee. we have to have a sympathetic nervous system. It is not a bad thing. It's just a state that we don't want to live in all the time, or the majority of the time. We want to be more in our relaxed state. So neuromusculoskeletal chiropractic is about looking and evaluating patients from head to toe, figuring out where their movement pattern dysfunctions may be, which muscles are involved. Is this a muscle problem that's local to the area that we're treating? Is this going to be a more bigger picture, wide-ranging muscle issue of tightness? If so, those are patients that I refer to Adam, our very talented European-trained muscle therapist, super guy, super practitioner. To an extent, I work on some of those muscles myself, tracing the muscle back to where on the skeleton has the range of motion been blocked, in which case, where are we going to apply the chiropractic adjustment? When we make those adjustments, we get those mechanoreceptors to fire, the pressure-sensitive mechanoreceptors to fire, and we start to send messages back into the brain, specifically to part of the cortex that perceives sensation, and specifically to parts of the cerebellum that allow for coordinated movement. The cerebellum, which we're coaching you to exercise through deep breathing and coordinated movement and balance. And we help people feel more comfortable, more at home, more at ease in their bodies. So my biggest population of patients are people who came to see me at the very beginning. They had pain, they had discomfort. Some of them were indignant. Their last doctor couldn't figure out what was going on, and told the patient, your pain is all in your head. Well, of course it's all in your head. Let's explain why that is, and what that really means, and how we're going to attack it. We attack that pain through hands-on technique and through very specific targeted exercises, two of which I'd like to review one more time before I run out of time. So let's take a couple more deep breaths together. And we're going to turn our torsos into well-stabilized functional units by making ourselves as tall as possible, from our belt buckle to the top of our abdomen. We're going to lift ourselves as high as we can here. We're going to allow our shoulder blades to sink down, pointing them towards our belt buckle. And we're going to inhale through our noses, not allowing our shoulders to shrug up, keeping them right where they are. Our torsos are expanding like big balloons, holding the air, our delicious oxygen being sucked in. Our lungs are our balloons, and blow out through your mouths. Again, big deep breath in. And hold 1,001, 1,002, and blow out through your mouths. One more time. Big deep breath in through your nose. And we're holding, and our torso is expanding. And we're going to blow out through our mouths. Now we're going to put our feet up against the imaginary line. So both our toes are facing, all 10 of our toes are facing 12 o'clock due north cardinal direction. Right foot all the way onto our tiptoes, left foot all the way up on our heel. And slowly and deliberately, we're going to switch. And slowly and deliberately, we're going to switch back. And slow again. And slow one more time. These are exercises that can be done at your home workstation. I don't know if a foot exercise can be done in the cab of a truck. You might want to have your foot poised to be able to tap the brake if need be, the gas pedal if need be. But I know that you can do some deep breathing exercises when you're driving down the road, because that's what I'm doing my whole commute to work, is I'm concentrating on my breathing and inhale, hold, exhale through my mouth. And sometimes I stop at a red light and I wonder if somebody's looking over at me and wondering, why does that guy look so, how did his posture get so good? The car is a great place to do some of these exercises, and a great place to come to explore chiropractic care to see what we can do to offer you is the Weiner Wellness Center. We're accepting new patients. My patients have aged between, my youngest patient that I've seen here was 2 months old, and the oldest patient that I've seen here was 96 years old. So that's a pretty broad spectrum. And I'm proud of the fact that I work with a good staff and a good group of colleagues, and we've been able to help an enormous amount of people with an enormous amount of different conditions. And I hope that if you're in the Pittsburgh area and you're watching this presentation, if you're looking for a chiropractor, I hope that you'll take what I'm saying seriously and like to explore what it is that we do here clinically. If you're out of the area and you're one of our new friends who we may not necessarily meet, but we interact with over the technology, and you're fascinated by what we're doing here and you'd like to just reach out and say hi, or even see if maybe I know somebody in your area who practices in a similar manner, please feel free to reach out, give our center a call. It's 412-922-9355. That's 412-922-WELL. I'm very proud of the fact that we have a state-of-the-art nutrition store. We carry a lot of products from 4 different brands in specific, and we carry a lot of products like as a brand that we don't think that brand is like it's too much overlap with what we already have, but they have a couple really innovative products. So we don't carry the whole brand, but we certainly carry their innovative products. We have healthcare products in our store. We have myself and Adam Karwa. We take care of, for the majority of our neuromusculoskeletal aches and pains, athletic injuries, those types of patients. I work with Dr. Joe Honigman, who he does more lifestyle nutrition consultation and a minimal of neuromusculoskeletal aches and pains. You met Jeffrey Niznik earlier this morning at our kickoff. He takes care of allergy eliminations and does nutritional supplementation to promote good organic health and good digestion. Our front desk staff is amazing. When you consider the volume of people that pass through here every single day, and you think about how many people are calling or scheduling appointments or just coming in to gather up information, our front desk staff is hospitable and easy to get along with and accommodating. Ashley, Phil, and Sonia, our shipping department. We ship supplements all over the country. Our shipping department, Monica and Mike, they do an incredible job. I feel like I barely know those people, but I pass them many times a day because they're so busy. They're practically on roller skates, buzzing around the nutrition store, pulling product off the shelves to ship out. And we, as a team, I speak for all of us when I say we would really like to have the chance to help you if you're in a time of need. And if you're not in a time of need and just want to stop by, go for it. Tracy, any questions that I'm missing or anything to?
Nope, that was fabulous.
Good.
Thank you so much, Dr. Orbach, for all of your information. It's always priceless. Okay. And I think people agree with you. We need to breathe deep and stay in a relaxed state at this time in our lives. So I hope people will come in and see you, get an adjustment, get a reset. That's what we all need.
Yeah. And
okay. Well, we were up next with. Go ahead, sir.
I know. I'm just like I'm looking at my notes and I'm looking. This is a conversation to me. I'm just talking about what I know and what I do, and I have all these index cards with little bullet points on them to make sure you say this, make sure you say that. I gave a presentation with a PowerPoint once and never again.
Right.
Right. And so I'm just very conscious that somebody's up after me, and did I get to say everything I want to say? And can I tell, I think Jamie's up next. Can I tell him to you know what, buddy, just go help out in the nutrition store. I'm on a roll here.
Right.
I don't know if that would be fair. But
you just have to talk about the immune system because that's what's up next. So
right. Well, I can do that. Not as well as Jamie can, but I can do that. But one of the things that I'm really concerned about, and I know that we're still live and people are listening in. This isn't private talk between me and Dr. Tracy, but the most important thing to me in giving these presentations and workshops are the exercises, the actionable steps. I mean, I can talk about spinal dysfunction, and I can use words like EFAPS and sympathetic nervous system and dysdiadochokinesia and all the stuff that none of the patients want to hear. I mean, it's just like I can do
Those are
this
big
lecture
words.
right. I mean, these are some silver dollar words that are appropriate for professional colleagues, not for people who I'm trying to get interested in what it is that we do. So I would be very happy to go on and on, but I just make sure the most important thing, we covered the exercises. And I'm actually grateful to the woman who typed in with the question about her husband, the trucker, because it gives us a chance to segue and it gives us a chance to contextualize it. And like as soon as I read that question on the board, I know she was asking, what are the lower back exercises? What are the hip exercises? But
Right.
that's one size fits all stuff. You can go to any physical therapist in the known universe, pull a free sheet off the wall, and it has a list of 3 set stretches that'll be good for sciatic pain. Maybe, I don't know what's causing your sciatic pain. Maybe not. But what we're offering here is, let's look at this more. This is a systemic problem with a local manifestation in the sciatic area. So
Right.
let's start and let's make sure that everybody who's listening in understands that these deep breathing exercises, these coordinated balance exercises, they're for you, regardless of what your complaint is. And if you don't have a complaint, they're still for you, because let's prevent that from happening. This is rehab, this is prehab. And for our patients who come in and say, I have, and they point to their lower back, their hip, their pelvis, their thigh. And I said, I was looking online, I think I have sciatica. My orthopedist diagnosed me with the last chiropractor. Okay, sciatica is a great buzzword. Now let's figure out the individual specificity for you and not have this cookie cutter approach where everybody gets the same thing.
Right.
So
Well, that's what makes you set apart, right? You have an individualized plan. That's right.
I like to think, and for the woman who asked that question about her husband, thank you so much. I mean, I wouldn't have had the opportunity to explain this in this level of detail if it weren't for you. I'm grateful.
Absolutely.
Okay.
Well, thank you, Dr. Orbach, for all your wisdom. We'll see you later, I'm sure.
Yes, we will.
Have a good day.
All right, thank you. You too.
All right, guys, stay tuned. We are bringing up Jamie Dorley, CEO and owner of Nutritional Frontiers. He's going to be talking with us about breaking news on building your immune system. So stay tuned. In 2 minutes, we'll be bringing him on board. Okay, we are back and we are all set to go with Jamie Dorley, CEO of Nutritional Frontiers. And we're so excited, Jamie. This looks like a fabulous lecture on the immune system. I just scrolled through your PowerPoint just for a spoiler alert for myself.
Oh, you scrolled through it already, huh?
I did.
Okay.
I always want to make sure that I have the right PowerPoint up.
Oh, you never know. Me, sometimes I prepare, sometimes it's just off the cuff. So
Well,
with this very important topic, I had to make sure I did some last minute preparations, and I didn't want to use the old PowerPoint, so I got a couple new updates because it's changing so rapidly. So thanks for having me on. I appreciate the opportunity once again.
Well, let's get rolling, shall we?
Yeah, so we are at the March Madness Wine of Wellness Week at World of Wellness right here in Pittsburgh, PA. Our mission is to make people healthy in their mind, body, and spirit. Not just about how you look, not just about how you feel, but more importantly about the spirit and soul. So I appreciate the opportunity coming on. We have an incredible week right now going on. And I was just out there talking to a couple people, and somebody likes the Super Shake Cafe Mocha so much, Tracy, they didn't buy 1, 2, or 3. They bought a whole case because their family lives on Super Shake.
Joe?
Actually, Joe's getting a video of them. It was not Joe, but one of our clients here. And they said they use that for breakfast for their entire family, and they absolutely love Super Shake. So that's tied right in we're talking about, because the immune system is vital to our survival and to fight things off. And it really goes back into a lot of the lifestyle, which we're going to talk about. But before we do, I want to say a huge little drum roll. Congratulations to the one and only Joe Messino. He's got a lot of nicknames. Some call him the Godfather, Jody, Joe, Messino, Mattina. I call him Silvio from Sopranos. But congratulations to Joe. He's a new manager of the Wine and Wellness Center and World of Wellness right here in Pittsburgh, PA. And Joe's got an incredible amount of experience working with people, and nobody does it with a bigger smile than Joe. So I want to say congratulations. They are accepting new patients. And if you've been a patient before at the Wine and Wellness Center or all the way back to the Pain Release Clinic, we are still seeing patients. You can be new or you can come back. We have doctors of chiropractic. We do European-trained muscle therapy here. It includes trigger point therapy, myofascial release. We have functional medicine nutrition with Dr. Hahnemann, who has a master's in public health. We do applied kinesiology innate with Jeff Niznik. We have Ashley Rozzi on the team now doing Zyto. We do education, wellness events, radio, newsletters, videos. And currently under construction is the brand new Studio 109. So that will be launched this year. So we're excited. Joe's doing a great job already. We are having an open house this week. You do not need an appointment to come in and shop, ask questions, get free education, free literature, and take advantage of all the different things we have to offer, because it's not just Nutritional Frontier supplements. That is our favorite, of course, right, Tracy?
Absolutely, 100%.
Good answer. We agree on one thing. If we can agree on one thing each day, we're going in the right direction. So we have nutraceuticals by all the top companies, including my old company, Metagenics, my new company, Nutritional Frontiers, Douglas Labs, Standard Process. We have herbs, liquid organic herbal tinctures. We have so many different protein powders. We have the vegan Super Shake. We have the Best Way. We have the Nido Keto and the Power Cleanse. Tracy, what's your favorite smoothie?
I love the Power Cleanse mixed with the lean greens. So that's our Remove Complete kit.
We agree on 2 things already, and it's only 10 a.m. Can you believe
it's a Christmas miracle, and it's March.
Maybe one of those days.
Michaela right now is like, whoo. I agree on 2 things.
He's like, God, just freeze. In addition, we have the phytonutrients. This is one of the Dr. Wina's favorites, was that, he always said you need a plant-based diet. And it's challenging, between shopping for all the different types of nutrients and the convenience and the cost. So we have something called Pro Colors, and that comes in greens, purples, oranges, and reds. And I know your favorite, of course, is the greens. I'm a big green guy, but I also like the oranges for energy. People want blood sugar, pre-workout. They get tired in the afternoon. So we have all these phytonutrients. Personal hygiene care, of course, you don't need that, Tracy, and neither do I. But some people want to dye their hair or get some skincare. I do use the Miracle 2 lotion, so it helps keep my face nice and moist. We also have an incredible sale going on this week on books and videos. So if you'd like to take full advantage of that, you can come in the store. We're at 2419 Baldwick Road, right in the heart of Pittsburgh, PA. In addition, you can do mail orders. So if you want to ship right to your house, we're better than Amazon. We don't charge Prime. There's no shipping cost at all. So you can call 412-922-WELL, 412-922-9355, and order anything you want. Ship right to the comfort and convenience of your home or office, and we ship anywhere in the continental U.S. In addition, some people like to do a curbside pickup. You call ahead, it's all pulled and ready for you. You pull up, a little toot on the horn, and we bring it right out for you. So many different ways to participate. All you got to do is take some action. We are here all week from 8 a.m. to 5 p.m. every day. And Monday and Wednesday, we stay till 7 p.m. So great opportunity if you work different schedule, or if you're not available until the weekend, we'll be here throughout the entire week. So I want to really dive right into this, Tracy, because so many people are concerned right now with their immune health. You know, I saw some people last weekend at the Wine and Wellness Center, and I haven't seen them in a year. And it was so nice to see people. You know, of course, we're wearing masks and taking all the PPP precautions. However, you know, at some point we need to move forward, and you need to rely on not a external vaccination, but internal mask, hand sanitizer, and vaccination, which is your immune system. I know I saw somebody yesterday driving in their car with the mask on, and I thought that might have been a little overkill. I'm not sure what they were exposed to, but let's build the immune system on the inside. And before we dive deep in this, I just want to give everyone a little bit of my background. So I know it's so hard to believe, because this December, I'll be celebrating 30 years since I graduated from one of the most prestigious health schools in the country, Slippery Rock University. I graduated in 1991. It was so long ago, Tracy, it wasn't even called public health. It was called community health. And now the degree is called public health. I've worked in Bally's Health Club as an American College of Sports Medicine's personal trainer. I worked in sports nutrition. And for the last 20 years, I worked with some of the top companies, including Metagenics, and was a founder of Nutritional Frontiers. I also own NutriPharmacy. Now I do own the Wine and Wellness Center. So really excited to be able to give back to the community this week. After all these years, we finally got to where we want to be able to help people out at our level. So we do a tremendous amount of education. And let's dive right into it, Tracy, because the immune system, it sounds so simple to people, but it's a very complex system. You know, it includes everything from even like your tonsils and your adenoids. So when people get those removed, they're usually at high risk, especially kids, for ear infections or tubes in their ears. You know, it includes everything from the esophagus to the liver to the gallbladder. So many different parts of the immune system on the physical structure. It's like a concert or a symphony. They all have to work in concert together. You can't start pulling these things out. Oh, I got the appendix removed, and people with their gallbladder out. And, you know, God forbid, I had met some people recently who had parts of their colon removed. Folks, as Dr. Wana once famously said, you don't have an overabundance of organs and a deficiency in medications. God put these there in your body for a reason. You may be able to live without some, but are you going to be able to live at an optimal level? Again, we live in the Steel City here in Pittsburgh. Defense is a big thing for us. You need all your players out there. They all have a role in your body. And let's take a look at the players and the immune system, Tracy. So you have so many, it's like a football team. So if you're into football, Tracy, I know you got kids on the team. I think your kids play for the Saints and your husband's a coach. So you know about football. You live in a football state. I'm a big fan of those states. So, you know, we look at the immune system. It's like a football team. You have different players and different parts do different things. So you have everything from white blood cells all the way through your bone marrow and hormones. They all have a unique role, and they all must work together to be a complete high-functioning system. So when we look at what do they do, well, the first line of defense is really limiting your exposure to bacteria, parasites, funguses, viruses, molds. Tracy, how many things are we exposed to on a daily basis other than just the infamous COVID?
500,000 viruses every day, millions of bacteria every day. So we're always surrounded.
If I had $1 for every virus we were exposed to, we'd be doing this somewhere else. Huh?
We'd be on the beach.
So yeah, we're exposed to a tremendous amount, folks. Our body is a miracle, the way it was designed and created and the way it functions. So the whole idea is to help resist your exposure, number one. Second, that's why you clean your hands and take a shower and clean your house or apartment. And you want to keep your clothes clean and, make sure that your food and things. So the first thing is reduce your exposure, right? But if they do get into your body, that's why you have stomach acids. That's the first line of defense of killing off foreign invaders, bacteria, funguses, mold, viruses, whatever it may be. So if you're on an antacid, you are already putting yourself at high risk. Tracy, how many people, when you were in clinical practice, did you see or still see that are on antacids?
Well, almost everybody. I mean, and when you ask them if are they on any medications, they usually say no, because it's become so commonplace that they don't even consider it a medication. Or if it's not prescribed, then they're using over the counter. They don't even tell you. So you have to be very specific.
Yeah. So when you look at that, they're already putting themselves at high risk. And then you look at the diet, right? There's so many phytonutrients in colorful food. I'm not talking Skittles or Fruity Pebbles. I'm talking about key foods you need to eat. And we're going to talk about that in a minute. But it could be anything from a cold to a flu to cancer to, the amount of autoimmune conditions I see these days. It's just overwhelming. And I think in the next 5 years, that's going to be the one that breaks the camel's back of our healthcare system. So when we look at overall, what can you do as far as the pyramid of health? This is a really key for people because, the famous saying, self-care is how you take your power back, right? So folks, you can't rely on the government. You can't rely on a vaccination or medication. The whole idea is to take your health into your own hands, right? Your genetics are your genetics, but epigenetics is the environment that your genetics are put into. Give you an example. Tracy has a brother, right? You guys have similar genetics. So if you're at your house for a barbecue, Tracy, and someone goes out in the sun for 3 or 4 hours, your skin's going to change color, right? And why is that? Your genetics have not changed, but the environment has. And it's no different than having chronic inflammation in your body due to smoking or alcohol or stress or a poor diet. So we always build from the foundation up, and that starts with your lifestyle. So that's everything you do. Movement, stress reduction, right? So I start my day this morning, typical morning. I started by getting on my knees and saying my prayers and giving gratitude. Next I did my reading. I drank water and took my probiotic, did some meditation, listened to about a half hour of good prayer on a podcast. Did my cardiovascular training. Today was one of the 2 days a week I take off from weights. And I'll continue that throughout the day. I do some stretching throughout the day, drinking Fiji water, one of the best waters you're going to find out there, right? So got my supplements right here, Tracy. I'm not teasing you, but I know this is one of your favorite, the gummies. So
Out too.
How many of these can you take in a day?
Are you asking how many I take or how many can you?
Either one. How many do you take? I think that you take the max.
Yeah, I probably take 2 or 3 a day, but who's counting, right?
Is that bottles or it's gummies?
Just the gummies, but one a day is enough.
Okay. Yeah, so I like to take a couple during the day if I need it. Today, I had a lot going on this morning, so I just took a couple and feel a lot better already. So the lifestyle, folks, is the key to healthy living. Can't change your genetics, but you can change how they act. And some of the key steps to avoiding illness, I think the biggest thing for me, well, all of them are, but you got to sleep well. I slept like a baby last night. One of the best nights of sleep I had in a long time. I woke up this morning and felt super strong, felt great, great mood, energy. Sleep is vital folks. If you're not falling asleep and staying asleep, you need to work on sleep. And there's a lot of factors involved in that. Sometimes it's just the environment you're sleeping in or trying to. Sometimes the mind is racing. Maybe you don't have a good mattress. You should spend about a third of your life on the mattress, but I think most people spend probably 10 times the amount on their car than they do a good mattress. So if you don't have a good mattress, start there. But sleep is vital. That's where you repair and rebuild your hormones. Your diet, that's where all the nutrients come from. Think about if there was no grocery store, what kind of food would be on the planet? That's the kind of food you should be eating. Real fruits, real vegetables, greens, salads, beans, nuts, seeds, fish, chicken, turkey. Those are the real foods you should be eating, not the processed junk. Exercise, I've been talking to my brother yesterday. He's 5 years older, and I started working out when I was 9 years old. This is way back in the 70s. So I find the consistency is the most important part of all these things. And then stress management, prayer, meditation, yoga, going for a walk, deep breathing, affirmations, reading, listen to podcasts, surrounding yourselves with good, positive people that support and enhance you, not suppress you. So when we're looking at food, let's look at the breakfast of champions. Right? When we look at the breakfast of champions, I'm old enough to remember it was a box of Wheaties, right? At one time, there was Bruce Jenner on the cover when he was the gold medal in the 1976 decathlon, which made him the best athlete in the world. That was actually in Montreal, Canada, when I was a little kid, one of my favorite Olympics. But back then, we looked at Wheaties as the breakfast of champions. But when you look at what's in Wheaties, a lot of processed carbohydrates, right? Very little nutrients. There's sugar, there's wheat, there's corn syrup. These are just some of the main ingredients in there, and very little protein and little to no fiber or good fats. So as Tracy was mentioning before, start your day with Power Cleanse. Tracy, what flavor do you like in a Power Cleanse? Because I know people are concerned when I hear cleanse, oh, it's not going to taste good.
No, it tastes incredible. I like the pineapple coconut, so that's my favorite, and it's delicious.
And you're not an easy person to please, so if she likes it, folks, what does that mean?
Have you been talking to my husband?
I don't need to, but if I did, we would agree on that. But yeah, look, we're consumers too. We want something that tastes good. This is hypoallergenic. There's nothing in there your body's not going to love. It's got your food in there, your protein, carbs, fat, and fiber. So it has all your nutrients you need, including coconut oil. In addition, we have a complete active vitamin and chelated, patented research trademark mineral complex. So you get your food, you get your vitamins and minerals, your essential fatty acids, and some liver support. So when I do the Power Cleanse every day now with the greens, I don't take my multi at that time. I just take my probiotics, which actually in the greens has the pre and probiotics, has all your super green foods. So it's a complete meal. You can live on Power Cleanse and greens, folks. It's a complete meal. And for about $2 a day, you get all your vitamins, minerals, superfoods, probiotics, prebiotics, and macronutrients in one. Have you seen a more complete formula out there, Tracy, in all your experience?
No, and it's something that I recommend for all of my clients, not for a cleanse, but just an everyday maintenance of our systems and functions in a very toxic world. So I think it's an everyday shake.
That's a great point. It's a great point. You're constantly exposed to toxins in the world. Even if you eat real healthy, just the biochemical waste from digestion, you need to help detoxify. Plus all the things we're exposed to on an everyday basis, right? If you go into a grocery store, who knows what they're cleaning the floor with? The air, the pollutants, the chemicals. So the other thing I like to do too is I like to ramp up, and sometimes I'll do 2 shakes a day. Occasionally I'll do 3 shakes a day. So if you're getting ready for the beach, you're getting ready to lean down, it's spring cleaning time of year, this will help with your immune system, folks. It's giving all the nutrients you need so that you are getting nutrient-dense food, because one, we got to be concerned with toxicity. Second is nutritional deficiencies. And these 2 things, Cheerios and Wheaties, folks, not breakfast of champions. They're going to add to your toxic load, and they're going to provide nutritional deficiencies for you. So I'm not a big promoter of these intermittent fasting or fasting at all. But if you are, you can still do the power cleansing greens. Very easy to digest, very simple to take. So those are some of the key things we got to look at: is lifestyle, food, and food-based nutrition. Power cleansing greens, Tracy, as you know, goes under the grocery store budget and grocery food budget, not on the supplements. This is a food-based nutritional therapy. Some people call them medical foods. We don't want like the word medical. So this is a real food you can drink every day, 1 to 3 times. Great for adults, teenagers, and even kids. Kids, just give them a half a serving. That's all you need.
Well, I always tell people supplements should be part of your grocery budget. Like, I don't know why they're separate. So.
Absolutely, especially the power cleansing, the greens. This is food, folks. So I see what people shop for, during the quarantine and COVID. I was at the grocery store in Walmart. I see what people are buying, folks. 90% of it's not food. You got to stay on the perimeter of the store. You got to eat real foods. And remember, they are making this food or product addicting. So be careful, buyer beware. Dr. Weiner always said, Tracy, that the cardboard box has a little fiber, so that might actually be more healthy for you than what's inside the packaging. But when we look at what are some of the key things, just look at for COVID, for example. How do we prevent the absorption of COVID in our system? So the number one thing we got to do is make sure our vitamin D levels are high enough. There was a study from April 2nd, 2020, so about a year ago. It looked at vitamin D and how much you need to prevent COVID. Now, it wasn't that long ago, Tracy, that vitamin D at 400 IUs a day was optimal. Now we're looking at 5 to 10,000. This comes straight from PubMed. 5 to 10,000 IUs of vitamin D3 per day. I always ask people, well, what is your number? What's your vitamin D levels? Now, the problem, Tracy, as you know, is the vitamin D range is 30 to 100. That's a big range, folks. So if you're at 30, they're saying you're healthy. And if you're at 90, you're healthy, right? Well, we know autoimmune conditions start to creep up when the vitamin D gets below 30. Why? Because the macrophages, right, part of your immune system, they don't activate when it gets too low at vitamin D levels. There's a correlation between the two. So vitamin D is very safe to take. You want a therapeutic dose of 5 to 10,000. They said until your levels get over 60, and then you may do 5,000 in maintenance. And Tracy, if you do have COVID, they say take much greater levels for at least 3 weeks. So 5 to 10,000 a day for prevention, 10 to 100,000 per day for therapeutic results. And the great thing about vitamin D, we have it in different forms for you. Let's take a look at those. One is the D3 liquid, and we have D3 in a capsule. Which one do you prefer, the liquid or the capsule?
I like the liquid, and I just add it to my shake in the morning. So then, the compliance is easier. That way I don't forget.
Yeah, we have a good amount in the power cleanse. It's more of a maintenance dose, about 1,000. We have it in our multivitamins, but we need therapeutic levels, folks. That's where you need to start adding on, because why is vitamin D so important? Years ago, we were trained and educated that it was great for the brains and bones. But what we've learned over the years, it's more of a hormone-like substance. So when you read that in the future or you hear vitamin D, the hormone, remember you heard it here first. D3 has the ability to block the absorption of the coronavirus. Let me say that again. D3 has the ability at the receptor site level on your cells to block your body's absorbability of the coronavirus. That's where you're supposed to say, wow.
Wow.
Okay, here we go. Right in tune. So we are in sync today. So when we look at vitamin D3 levels, I work with a functional endocrinologist, Dr. Edwin Lee. He's out of Orlando, Florida. He did his residency up in the state and city of Pittsburgh at Pitt. And that's correct, Pam Avery. People say, well, I'm in the sun a lot. Number one, if you're in the sun and usually are covered up. You need to have full body exposure. And if you have sunscreen on that's 15 or higher, you block 99% of the absorbability of the vitamin D. And you have to convert it in your liver. So if you have a fatty liver, you're overweight, you're on cholesterol drugs, you get the idea. You're not going to have vitamin D levels real high. So Edwin Lee showed us this chart, and it shows as your vitamin D levels get higher, your risk factors of all chronic conditions, cancers of all kinds, type 1 diabetes, right? You look at fractures, heart disease, all those decline. So if we did nothing more than get on a therapeutic level of vitamin D, we can reduce our risk of some cancers by over 50%, right? So we need to make sure we're looking at natural therapies for prevention, because we've been trained in our country that don't worry about vitamins. They have nothing to do with it. Don't worry about your health. It's just your genetics. And what do? They want to give everyone a flu shot. When's the last time you got a flu shot, Dr. Tracy?
The year 19, never.
Oh, never.
I've never had one.
Ago. So, in all full transparency, I'll be honest. My last one was in 1994. I was getting ready for Mr. Pennsylvania bodybuilding competition in the best shape of my life, and I got talked into it by a coworker. And lo and behold, they told me it was the worst flu ever. I don't want to get sick. I got the shot on a Thursday. About 3 hours later, I started getting chills. I was in bed for 4 days. When I came back to work on that following Monday, I explained to the nurse that, hey, I got really sick last weekend. She says, well, did you get the shot? I said, yes. She goes, well, thank God. Imagine how sick you would have been if you didn't get the shot. So I said, well, that's how I got sick, was from the shot. Her words were impossible. So I completely disagree. The last time I got the shot 27 years ago. And here's the stats on the flu shot, Tracy. Let's go to the next one. So when you look at the flu shot overall, it's really a shot in the dark. First of all, they have to guess which strain it is about 10 months before the flu, quote unquote, season even begins. So if they look at it, it's really a coin flip, because if the past 12 flu seasons, the flu vaccine reduced the risk by about 50%, right? The CDC itself says that the flu vaccine is about 60% effective. So when we start looking at the stats, how many people get the flu versus did they have the right strain, and then what's your risk factor? So it shows only about 2 people out of 100 even get the flu in the first place. Let's go to the next slide. So a flu shot possibly helps 1% of the population, 1%, and the risk factor of having some type of reaction is more than double. So it's a law of diminishing returns. We've heard my neighbor's mom actually got the flu shot, and she was paralyzed from the waist down. We've heard people dying from the flu shot. I'm not trying to scare anyone. I just want you to become educated and make an informed, educated decision. Proven steps to stay healthy: washing your hands, exercise, eat healthy, take immune support, relax. These are all things we've been talking about for a long time. Let's go to the next one. So as we talked about prevention for a little bit, Tracy, what happens if you do get sick? And let's talk about what's that first sign or symptom. For me, if I'm going to get sick, and it's been quite a while, it's been a couple of years actually, my first sign or symptom is I get chills. My temperature starts to change in my body, and my back gets sore. I get really tired really quick. What's some of the first symptoms you start to experience?
I lose my voice. That's usually the first sign. Like, I'll start to lose my voice, and then I'll get a sore throat, and then I get really tired.
So when you lose your voice, is that all bad, or
it's like the best day of your life?
I can't hear you.
You're like, that's a shame.
Terrible. I haven't heard her lose her voice in years, so she's very healthy. But yeah, everyone has their different sign or symptom. Be aware of that, because you want to keep the immune boosters on hand at home, because how far can you go into the body, Tracy? Halfway. Then you have to go out of the body, right? So when people say it's got to run its course, it's because it's already deep in your cells. You can't give it 3-4 days head start. You need to have the vitamin D in your system. You need to be on the power cleanse and the greens. We'll get into vitamin C and zinc and Immunomax next. But you got to have these vitamins and nutrients and formulations in your body and at your beck and call, right? You got to be able to increase the dosage dramatically when you're having that first sign or symptom. If you wait 2 and 3 days, it's too late. So the number one thing I recommend, vitamin D, C, zinc, and Immunomax. Make sure you get a lot of fluids in. This is a good time to get some herbal teas. I like soup any day of the year, especially if I'm not feeling good, and a lot of soup broth, right? Lighter meals, right? Even if you're not that hungry, make sure you're getting your fluids in, because one of the main concerns when someone's sick is that they're dehydrated, right? Especially if you're having, extra bowel movements or diarrhea, those types of things. So, use herbal teas, get plenty of rest. The body needs to cleanse right now. Too much physical activity going on is just going to make it worse. Don't try and work it out like I used to always do. I always like what Doc said, extra clothes, extra blanket, a little bit of sweat means the body's trying to kill off that bacteria you have. So those are some simple things you can do. Don't eat processed foods, dairy products, heavy cream soups. Those types of things are a no-no, especially when you're sick. So let's look at a little more of the breakdown on the foods. So always vegetables. You can never go wrong. I like a little bit of fruit. You can do some frozen fruit or natural fruit. Frozen actually isn't so bad. I think when we start to go to canned versions, we drop down quite a bit. But if the only thing you have at your in your house is going to be canned soup, that's okay. I watch some of the heavier fats at this time. Eat lighter foods, a lot easier to digest, and make sure your fluid intake is really high. So that's what some of the things we want to make sure we're doing for prevention, and then also if you get sick. Let's look at now at COVID, right? It's on everybody's mind. So the COVID virus is not brand new. The newer version, of course, is the concern the most is it's highly contagious. Not highly deadly, but highly contagious. That's why the theory behind the mask and washing your hands in quarantine is that, well, if you're not exposed to it, you may not get it. That's correct. But even if you are exposed, you want your immune system. So when you look at the risk factors, the highest risk factor were elderly with cardiovascular disease, right? So younger people don't really have the risk factors unless their body fats are really high. So they rushed out, in my opinion, these vaccinations. Normally vaccines take a few years to come out with. And I think now there's up to 4 vaccines. So I'm not the vaccine expert, but Tracy, I know you have a lot more experience in this. Can you explain a little bit of the theories behind these vaccinations and why they're so different with the storage and how often you got to take them?
Yeah, so the difference between this type of vaccination and what we have on the market is, most vaccines have an attenuated virus. They inject that into your system. That virus is surrounded by different preservatives and metals to activate the immune system. So your immune system makes an antibody against that attenuated virus. These, and depending on who the company is, these are genetic snippets of the SARS-CoV-2 virus. So it's an mRNA vaccine, which has never been done before. And I agree with you, Jamie, that, I feel they rushed this out for something that was not as much of a pandemic as they let on. Yes, people had succumbed to that particular disease. However, according to Joe, what did he say? There were 12,000 pandemics since 1970 something. And why did we hear about this one? So really, it was more of the propaganda. I advise people to, really look into these vaccinations and the contraindications, which they're not telling you about. Most of the people that they are injecting first, such as elderly, immunocompromised, those are actually the people that are most contraindicated. So, like you said, Jamie, make an educated decision when you're doing anything regarding your health. And I know people ask me all the time about supplements and are they safe, and they read literature. The exact same thing should be done when you are given a 3-page insert to any drug or what most people are saying about this is not a vaccination. This is a medical device, the way that it's working.
Yeah.
So if you have to pick from, according to Dr. Len Bransowitz, he said the Johnson & Johnson is probably the least dangerous. But the other ones, you might want to look into, like the Pfizer and the Moderna.
Yeah, when you look at it too, I did some research on the history with vitamins. There's been zero causes of death from any vitamin. When you look at it overall, medications is one of the top 5 leading causes of death in the U.S. every year. That's properly prescribed medication, right? So always beware, always be careful, do what's right for you. I'm not telling anyone else what to do, but as a true gentleman that I am, Tracy, I'm going to go to the back of the line, let everyone else go first. And it's been very concerning for me. I know some people got the vaccine and they're fine, and others not so fine. There's a lot of side effects, including death. There was one of my heroes, Hank Aaron. He was the home run king until Barry Bonds beat him. He was a very strong African-American male, right? And he went on TV. There was higher risk for African-Americans. And what he wanted to do is he wanted to be a leader of the community. So he went on TV and took the vaccination. Hank Aaron looked the same for the last 30, 40 years. The guy looked great. 2 weeks later, he dropped dead. So is it the vaccine or not? I don't know. But there's a strong coincidence there that he was healthy, took the vaccine. 2 weeks later, he died. And you don't hear anything about it anymore. Were you aware of that situation?
I was. Also, the cardiovascular doctor that did the same thing, went on and was making fun of people that were refusing the vaccination, and he died a few weeks later of ITP, which is a reactive autoimmune disorder that destroys the red blood cells. So he didn't have it before the vaccination, and all of a sudden it onset very quickly, and he died. So, everybody has the right to choose. That's the beautiful thing about education in our country and freedom. And not every body is the same or can handle the same interventions. So anytime somebody is putting something into your bloodstream, it's called a medical procedure, and you should have the right to refuse.
Yeah, and I think, you got to do your homework. I always ask people, are you doing the other things to keep your body healthy? Are you doing your prayer and meditation? Are you drinking water every day? Are you getting movement? Are you addressing emotional wellness, spirituality? Are you sleeping well? Are you doing all these other things? What is your diet like? So I think if all those things are in line, then what do you need the vaccine for, right? The last thing I want to bring up on that, we just go back to that one slide on the side effects. When they say side effects, I think they're downplaying it. These are just effects, right? Common COVID-19 vaccines. Let's eliminate the word side effects. Because when someone hears side effects, myself included, I think, well, it's not going to happen to me, number one. And number two, it's really rare, right? Probably not the case, because I've heard anyone who's gotten this, they did say they were tired for 12 to 24 hours afterwards. There can be a lot of pain or swelling at the injection site. Fever or chills, telling me that, your body is sick. And the other big one I hear is the headache. Now, in most cases, of course, whatever that means, most, discomfort from fever or pain is normal. So now they're saying here right below it, the side effect of pain and fever is normal, right? It's not no longer a side effect, it's just an effect. So basically what it says, in most cases, discomfort from fever or pain is normal. So that's going to happen to everyone. Call your doctor, healthcare provider if this continues for after 24 hours, or if the side effects are worrying you do not seem to be going away after a few days. I would not wait a few days if you get this. You need to build your immune system before and after, right? And as someone commenting, look, I'm not going to go into hypotheticals and worry about the future. If they push you need a vaccine to fly or some jobs. As of today, I can get on a plane, which I am next week, and fly into Florida. I do not need a vaccination. The goal is, for me, is that when enough people get the vaccine, we'll finally have everyone agree that there is something called herd immunity. We won't have to get it. And if we have to get it at some point or they're making it mandatory, well, there's always ways around that, of course. So we'll discuss those at a future date.
Jamie, to your point about tiredness, fever, chills, headache, if you look at one of the longest running, probably chronic health issues in our country since it happened onset was Lyme disease. Those are also, acute onset symptoms of Lyme. And you don't hear people saying, well, after a few days that goes away and you're going to be fine. So just know that when your body responds in this way to something that is not an attenuated virus, but a DNA transcriptase, something that's going to communicate with your body, it's not going to go away. It may stop, just like those acute onset, symptoms stop with Lyme, but Lyme lays dormant. Lyme is there. Lyme becomes chronic. So just keep that in mind.
Well, great minds think alike. I saved a Lyme slide for the end just because I knew that was a concern. Also, I think that there's going to be a increase in autoimmune conditions from this. So that's where vitamin D comes back into play, the C, the Immunomax, Super Zinc. So folks, you got to do your homework. You got to get educated, and you got to make an informed, educated decision. You still may make the wrong decision, but at least give yourself the opportunity to be empowered so that you're doing your homework and you are making a decision that's best for you and your family. If it's mandatory somewhere, I had a teacher come in on Saturday to the Wellness Week. Great friend of mine. He's been coming here for years. And he says, he asked if we were hiring. I said, well, you're a teacher. He says, well, I think they're going to make it mandatory. I have to get my shot. And I'm willing to resign if that's the case. Now, he's been a teacher for over 20 years, right? He's got a pension and health care and, retirement and everything else. But, he's feeling that strongly against it. And he says, I'm fighting it right now, but we'll see what happens. So he's already making adjustments with his life because he doesn't want to do it. So we go to the next slide and we talk about, well, what are some of the other things above and beyond the vitamin D? Here's our immune kit right here. The Immunomax builds your immune system across the board. This is your foundation. Everyone should be taking one Immunomax per day at least. If you get sick or have that first sign or symptom, you can dramatically increase the dose. I've done on a capsule up to 12 a day. On the chewables, probably half a dozen a day if I wasn't feeling great. So the Immunomax is the foundation. D3 will help prevent the binding of COVID. It also helps support your immune system. And you really want your vitamin D levels optimal or 70 to 80. Have you ever had anybody ask you about concerns with vitamin D toxicity?
Oh, yeah. Vitamin D, vitamin A. They worry about those fat-soluble vitamins, so maybe you can put our minds at ease today, Jamie.
Yeah, well, I've never had anybody have those issues with toxicity, number one. Number two, vitamin D toxicity does not start from, according to Dr. Lenny Goldberg, between 120 and 150. How many people have you seen with vitamin D levels over 120?
0.0.
Our favorite number, 0.0, folks. Not a concern. Get your vitamin D levels tested every year when you get your blood work done. If you're not sure, you can always bring it in. We can take a peek at it. So vitamin D, vitamin A, vitamin E, toxicity, vitamin K, not the case. People are having more issues with toxicity from heavy metals, artificial flavorings, colorings, dyes, additives, than they're going to have from vitamins. So you got vitamin D, Immunomax. Now, the great thing about vitamin C is it'll help kill off viruses, bacteria, parasites, molds, funguses. And we have many options on vitamin C. And the nice thing about our capsule is that it's buffered, just like our powder. And you don't have to worry about any acidity to it or poor absorbability. So it's not how much vitamin C you take in per day, but the form. So we use a buffered C and a veggie cap. We also have bioflavonoids that are a really important part of that component with the vitamin C. They work in synchronicity together. So the C will help kill it off. And the great thing about zinc is, it's fantastic to help with inhibiting the replication of any types of viruses. So that's why zinc was being promoted by the CDC and the president, because it'll stop the replication of it. And they looked at many studies on it, but they actually injected chicks with this. And when they utilized zinc and vitamin C, it stopped the growth of anything. So zinc and C combined together work great to help build the immune system up and to kill off anything you're exposed to. Go to the next slide. This is the new Buffered C Plus powder. The reason we put it in a powder is if you want higher dosages of it. It's well tolerated because we use an effervescent sodium bicarbonate system. That's a buffering system. That way you can tolerate higher dosages of the vitamin C. In addition, we put some extra minerals and B vitamins in it, and it tastes fantastic. It's in a nice orange flavored powder. It gives that effervescent fizz, so it's very calming to the intestinal tract, and it maximizes the absorbability. So you can take vitamin C at higher levels until bowel tolerance. So once the stools start to move, then you can back the dose down a little bit. Great for kids or adults. And then we have the wellness solutions, the immune wellness solutions. These are Cliff Note versions. You go right to nutritionalfrontiers.com, or you get them at the Wine and Wellness Center. These provide all the different protocols that we have, lifestyle therapies, how the immune system works. It's all in one easy to read booklet that are free for you and your family. There's other support nutrients, Tracy, that help with the immune system. So one of my favorites is probiotics. I take the Superbiotics every morning. That is our strongest probiotic. All of our probiotics at Nutritional Frontiers come in a blue glass bottle because we found that with the live bacteria, and that's what probiotics are, they're live good bacteria, you need to maintain their dosing and their freshness. And the only way you can do that is by putting them in a glass bottle. When they're in a plastic bottle, they're exposed to air and they will break down quicker. So we put ours in glass, they're guaranteed expiration date. And we only use patented research trademarked ingredients in there from Niznik. So these make the probiotics stable at room temperature. They survive all the stomach acids, bile, and digestive enzymes. They all actually get somewhere in the intestinal tract and have the ability to turn something on. So some work better in the small intestine and cool down inflammation. Some are better at digesting lactose, and others are better in maybe the large intestine and colon, and some improve bowel regularity. So the important thing, there's no shortage of probiotics out there, Tracy. What I see is a shortage of good quality probiotics, even from some of the top companies. So we use patent research trademarked ingredients. These are really important because they're backed with all the science for the safety and efficacy of the ingredient. And it's similar to, if you're not really experienced with probiotics, it's similar to buying a dog that's a full bred dog with papers versus, maybe one from the pound. And it doesn't mean the one from the pound is not going to be a great dog, but it may not have some of the characteristics you may be looking for from these purebred, same with the pure strains. Now, our Frontier is more of a mild dose, about 6 billion per capsule, 8 to 10 different strains. And the nice thing is that you can take a lower amount of those every day as a multi for your intestinal tract and immune system. And boom, if you're having an issue on the weekend, you can increase that dosage right up. Safe in the fact that we have a 180 count, which is a nice family size. So you get a great value. I haven't seen many of the professional companies have a probiotic that is the therapeutic dose that has the family value size. So probiotics, great for everyone, multi for the immune system and the gut. Now, I know a lot of people say they eat yogurt. Well, that may be okay for some people. Remember, most yogurts are loaded with sugar, and you'd have to eat about 30 containers of yogurt to get in what you get in one of our Frontier Biotics. So you're not going to do that in a day, maybe in a month, but you're going to be exposed to a lot of the dairy products. So I'm not a big fan of yogurt. I know people think it's healthy, but It depends on where you buy it. Most yogurts are going to be loaded with sugar and not have any type of therapeutic dose of probiotics in them.
You know what I like to call store-bought yogurt? Now, fermented yogurt's different, right? If you get a fermenting kit, you ferment whole, raw, organic milk, you're going to have great yogurt. Other than that, it's creamy junk food.
Yeah, and most people haven't done that lately, so I always go with the masses. Right. And look, if you're hardcore out there, you're listening and you're watching this, and you say, "Well, I make my own kefir and yogurt and sauerkraut," and all. Great, you are the minority. 99% of everyone else is not doing this, myself included. So I'll take the superbiotics. It's worth my time and investment. Air Max is a great formula for any type of lung issues, which are tied into not only COVID, but probably more commonly you get things like asthma, pneumonia, bronchitis. So Air Max works quick and fast, Tracy, for any acute relief. When you combine this with vitamin C and eliminating dairy, Dr. Juan had an over 80% success rate of eliminating asthma. Now, I'm not making any claims. I'm just repeating what he achieved in his practice, was over 80% elimination of asthma by using Air Max, Buffered C Plus, and getting off dairy products. Now, most people say, well, I'm going to check with my doctor about, just try it. For less than $50, wouldn't you like to see your kid see improvement or eliminate asthma? So very simple and easy. All right, we're going to finish it up here. Just a brief discussion with Lyme, because we know this is a big concern. Most people don't realize Lyme is a man-made disease. It comes from Lyme, Connecticut, right across the Long Island Sound from where I grew up. And there was a lot of, you might have saw the Montauk Monster. There's a lot of experimental science and research going on at the island up there by the military and the government. And they found that suddenly a lot of people across the Sound, right across the bay, were getting these weird neurological disease. So that's why it's called Lyme disease, Lyme, Connecticut. But now it is spread throughout a lot of the Northeast and even down south. It's not only ticks. It can be from any airborne bug. So if you are or have been exposed to it, you need things like DMG, our immune tincture, ProReds, and then if you're having any side effects with joints or heart, there's some other nutrients you can provide. So thanks so much for having me on, Dr. Tracy. Hopefully this helps everybody out. I know we're all concerned with our immune system, but it's just another example of putting the microscope on the poor health of our country. And I take a lot of pride in this. We're doing a lot of education this week for free. We do over 100 days per year of free education. It's actually more when you add up all the radio shows, but it's hundreds of days a year. And we do this to give back to everybody. Of course, we are a business, but we want to show you that we're doing extra value for you, providing extra value. And this is just one of the ways to do it. So if you have any questions, I'd love to hear back from you. People are asking, is it safe for kids to take the vitamin D? Absolutely. So vitamin D levels for kids, same thing. Maybe a half a dropper per day would be great. Again, you should have them tested too when they get their blood work done.
Yeah, Jamie, do you want to talk about some other educational opportunities coming up with Nutritional Frontiers? Because I know, the topic you just went over, how does germs work in the body? The germ terrain theory seems to be a big issue still. And we have a great professional training event coming up April 10th.
Absolutely.
With Dr. Kim Furman. So,
do you know who my favorite speaker is? It's you, Dr. Tracy.
The person that you agree with least?
Yeah, so, hey, you know what? We like when we disagree. So Dr. Tracy Stropp and Dr. Kim Furman will be speaking on the contagion myth, breaking the contagion myth. This is a huge opportunity. I'm going to be the opening act. So I'm going to warm up the crowd at 9:30 talking about quality and going through some really unique research that's going on right now. And then Dr. Kim and Dr. Tracy are going to bring it home, talking about this whole contagion myth, right? How do you are you exposed, right? How does your body respond? How is one thing contagious from one person to another person? What are some of your risk factors? And then most importantly, what are some of the solutions? So it's an opportunity to sign up for any healthcare professional and staff. This is right here in Pittsburgh, PA. It's on a Saturday, April 10th. Great time of the year. It's a full day event, but it's not overwhelming. It's in a beautiful place right down here at the hotel near the casino in Cannonsburg. We have registration at 9. I start about 9:30, and then we go from 10 to 12. Take a nice healthy lunch break together, and then we're going to go from 1 to 3 p.m. So we've got a lot of great feedback from people that attend our events that they are very educational, but they can digest the event too. So there's great things that they can take from the event and apply right now, not only in their life, but also in their practice. So great opportunity. Saturday, April 10th. Do we still have seats available?
Yes, actually, yes. And, we'd love to see you there live. But just know if you can't come live, there are other options where you can live stream with us or get the playback. I mean, the best part of these events is that they're live and in person. You can meet the staff. You can network with like-minded people. You can make connections. I know in our last event, Jamie, we had so many connections made between practitioners. So just know this is an opportunity more for education, but, networking and growing your practice as well.
Okay, sounds great. So I look forward to seeing everyone there. Everyone, come on down to the Wine and Wellness Week. If you're a patient, if you're brand new, if you are a healthcare professional, staff, our doors are open to everyone. We do not discriminate. So come on down. We have a tremendous amount of free literature, books on deep discounts, excellent formulas, and it's another way to get that camaraderie and network with other people. You learn a lot from the other people even there or some of the staff involved.
Absolutely. Thank you so much for being here. Thank you, Jamie. It was a great lecture. Give the Weiner Wellness Center a call, and we will see you in a little bit. Thanks, Jamie.
Sounds great. Thanks. Have a great day. God bless.
order. God's chaos code now.
Hi, I'm Jamie Dorley. I'm CEO, owner, and co-founder of Nutritional Frontiers, along with the late, great international icon, Dr. James Weiner. And Nutritional Frontiers, we're breaking through nutritional boundaries. Our mission is to make the world healthy. Hi, I'm Jamie Dorley. I'm CEO, owner, and co-founder of Nutritional Frontiers, along with the late, great international icon, Dr. James Weiner. And Nutritional Frontiers, we're breaking through nutritional boundaries. Our mission is to make the world healthy. We'd like to welcome you to our team. If nothing changes, nothing changes. Currently, the U.S. ranks 37th in healthcare systems in the world. We rank 72nd in health. We spend more money per person. We're only 5% of the world's population, and we consume over 2/3 of the world's medication. And it's not working, folks. Now, you can buy products from anywhere out there. They even sell them at some of the gas stations. However, if you want to implement nutrition in your business and in your life, improve your patient outcomes, and increase your practice profits, then you need to look no further than Nutritional Frontiers. We have created and perfected all the different solutions to the challenges you face in your business. So let's take a look at all the different things that many of your colleagues have taken advantage of. Things such as our educational program for the doctor, patient, and staff, our sampling program, and our direct shipments. So these are all just some examples of some of the things you can benefit from tremendously. I guarantee you implement our system from Nutritional Frontiers, you'll improve your patient outcomes, and you'll help make your world and the world healthy. Hi, I'm here to talk talk to you about an incredible formulation by Nutritional Frontiers called 2020. This is great for eye health, and we have it in 2 different versions, veggie caps and an organic liquid herbal tincture. All you need to do is take 1 to 3 caps a day or 1 to 3 liquid droppers per day. Excellent for anyone who wants to help with eye problems, wants to help prevent eye issues, or even if you have poor vision or wear glasses, this would not be an ideal formula for you. Very inexpensive, costs $1.50 or less per day. Easy to take, both in veggie caps and liquid, plus excellent for anyone who is exposed to blue lights. We have an incredible amount of research on this, including a full article in our Holistic Truth on eye health. So 2020 by Nutritional Frontiers, both capsules and liquid.
Hi, folks. I want to talk to you a little bit about activated B12 with folate today. You know, there's been B12 supplements forever on the market, right? Folic acid forever on the market. But there's only one that combines both the methylated version of vitamin B12 and the methylated version of folic acid in the form of quadrifolic, and another branded ingredient that you're going to find only in Nutritional Frontiers products. Now, why is that important? Well, all the B vitamins are important, but vitamin B12 directly related to sleep and anxiety, and combined with folic acid, directly responsible for the formation of red blood cells. Okay, so you need to get the activated forms of these so that they're readily absorbed by the body, especially the folic acid. This quadrifolic, they have found that over 40% of the population has a genetic disposition that prevents them from absorbing folic acid. Now, this methylated form of folic acid completely solves that problem. So when you want to get folic acid in a therapeutic level at 1,000 micrograms and vitamin B12 in a method that your body will absorb, active B12 with folate is the one. And of course, very affordable at less than $1 a day in an easily taken, chewable, great tasting tablet. Active B12 with folate.
Adrenal tincture is a unique blend of herbs that helps tonify the adrenals and helps promote resilience to stress. This formula is for anyone experiencing stress or feeling slightly fatigued. I like to utilize this formula in conjunction with many other products such as iodine and other things at Nutritional Frontiers. If you suffer from gastroesophageal reflux, ulcerative colitis, or peptic ulcers, or are pregnant or nursing, we recommend not taking this product. We recommend taking the adrenal tincture 1 to 2 dropperfuls a day, 3 to 6 times a day for optimal results. If you are experiencing stress or fatigue, for 95 cents a day, the adrenal tincture may be the product for you.
Today we're going to talk about another tremendous formula in our line called Adrenamax 3. Adrenamax is specifically for your adrenal glands, your stress glands. So classic adrenal fatigue is someone who is tired in the morning, really takes them a long time to get going. They might be reaching for caffeine, coffee, and so forth, which, by the way, burns out your adrenals even more. And then it shifts to in the evening time when you're coming home from work, trying to unwind. You can't do that. You can't shut it off, flip the switch. So that is your classic adrenal fatigue, someone who's tired in the morning, but yet having trouble sleeping at night. And so that is where this formula would be very, very effective for. Also, for people who have thyroid issues, also puts a tremendous amount of stress on your thyroid. So anybody on thyroid medication could also benefit from this Adrenamax formula as well. So this is a complete herbal formula. Plus it has one mushroom, cordyceps. So what's nice about herbals is wherever you fit on the HPA axis, hypothalamus, pituitary, adrenal axis, think of it as a big giant seesaw, whether you're low or high, the herbals actually reset or rebalance. That is really how we look at this formula, is rebalance in your adrenals. The way we would dose this is also pretty unique. So I get the best clinical results if someone doses it in this sequence. So we would break it down per week. So the first week, we would recommend 3 breakfast, 3 lunch, so 6 cups a day. A person should have tremendous energy, but it's a different type of energy. It's not caffeine. You don't get high and low, crash and burn. It's adrenal energy. So it's a completely different type of energy. After the first week, then we start lowering the dosage. 2 breakfasts, 2 lunch for the second week, so 4 a day at that point. The third week, we would dose it 1 breakfast and 1 lunch. And the 4th week on, we dose it 1 breakfast until we finish the bottle. However, if you notice that your energy levels are starting to wane, then we would go back to week 2 for 1 more bottle, 1 more month. Just 1 bottle was not enough time to get those adrenals completely under control or rebalance them or resetting them. Also, there's one herb in here that we're using, licorice. Now, licorice is the fastest natural herb to help rebalance cortisol. But for those who have high blood pressure or on high blood pressure medication, they can be sensitive to this. So you can still use Adrenamax, but we would dose it in reverse sequence. So we would introduce it more slowly and gradually to your system. 1 breakfast for the first week, then 1 breakfast, 1 lunch for the second, then 2 breakfasts, 2 lunch for the third, then 3 and 3, and then we go backwards, just like we talked about earlier, 6, 4, 2, 1. So it's a more slower, gradual effect for people with blood pressure issues. Also, nursing or pregnant, we wouldn't recommend this, and anybody on prescription blood thinners where there's no monitoring, we wouldn't recommend it. But for everybody else, this works really well and really fast. And it's actually only 38 cents a pill if you break it down per pill. Thank you.
Hi, how you doing? I want to talk about incredible formulation by Nutritional Frontiers called Air Max. The great thing about Air Max is this for everybody and anyone with any issues with sinuses, breathing, colds, flus, asthma, anything where you need help with the lungs, the sinuses, and the ears. Great thing about Air Max is it comes in a veggie capsule and it's chewable. Very simple to take. You can take 1 a day for prevention, 3 a day for chronic, and 6 a day if you have an acute flare-up. Very inexpensive. It costs you about $1 per day. And you can take it even if you're on inhalers or any type of medication to help a lung or sinus function. Air Max great in the chewable or veggie cap, appropriate and safe for kids, adults, and seniors. Check it out now. Thank you. All right, let's talk about a very simple, easy way to address a few key metabolic functions for weight loss. I'm talking about berry-tone 2, folks. What a fantastic way. There's many things out there in the market to help you with weight loss. However, there are very few as comprehensive as berry-tone 2. Very simply, take 2 capsules twice per day with food, and you'll be on your way to helping with not only balance out your weight, lose weight, but more importantly for some people, to maintain weight. Oftentimes I'm told that people are doing their best to help lose weight and they're not getting results. Berry-tone 2 is your solution if you're struggling with weight loss. Doesn't matter if you need to lose 5 pounds, 50 or 100 pounds. Berry-tone 2, folks, very simple and effective, plus very inexpensive. Costs you less than $1.50 per day, even at the therapeutic dose. Take your berry-tone 2 capsules twice a day.
Most people think heartburn is a production of too much stomach acid. This is actually a misconception. Betazyme is a synergistic formula supporting digestive health. As a dietary supplement, take 1 or 2 capsules before meals or as directed by a healthcare practitioner. If you have any type of stomach ulcers, we don't recommend that you take this product, or if you're pregnant or nursing. For $1.30 a day, Betazyme may be the product for you if you experience occasional heartburn or have gas or bloating after eating.
Today we're going to talk about another great formula for us, and that is called Brain Boost 2. Brain Boost is a fantastic formula for helping with anybody from memory issues. So as we age and normally forgetting names, phone numbers, keys, things of that sort, all the way to possibly can help with dementia and even Alzheimer's. We've had a couple clinical cases where we have seen dramatic improvement. So even a worst case situation. It's a very unique combination of many different herbs, such as bacopa and vinpocetine. And also we added phosphatidylserine and phosphatidylcholine. We're using quadrifolate in this as well, plus many, many other ingredients. So it's a really comprehensive, unique blend of multiple ingredients that focuses on raising your acetylcholine. And acetylcholine is your main neurotransmitter in your brain, beneficial for memory and so forth. It's been linked to low levels, actually contributing to dementia and Alzheimer's. So dosage, if we're just talking about basic memory issues, is 3 caps a day. It's a little over $1 a serving, but it's also fantastic if you're trying to get ready for a test, an exam, finals. So it can be used by all ages. The only people we would recommend would be nursing and pregnant or prescription blood thinners where there's no testing. But it really sharpens the saw, sharpens that brain, and doesn't matter what other condition you might have. If you can't think right or talk right or speak right, then nothing else really matters. So the brain should always be your number one organ to pay attention to. Once your symptoms improve, your memory improves, which again, in most cases within 1 bottle, then you just come back to down to 1 capsule a day as a basic preventative maintenance formula for your brain, and basically a multiple vitamin for your brain. So give it a chance if this is you. Thank you.
Hi, let's talk about incredible formulation that's appropriate for almost just about everybody. We've all heard of vitamin C before, right? It's been utilized for hundreds, if not thousands of years. And there's so much research on vitamin C. I think really what it comes down to is what's the best vitamin C for you? Well, how about Nutritional Frontiers Buffered C Plus? 2 key things about this formulation. Number 1, it's non-GMO. Most vitamin C's on the market are GMO. This is not genetically modified. Secondly, most vitamin C's on the market are corn derived. However, Buffered C Plus by Nutritional Frontiers is not corn derived. It's non-GMO. It's actually made from beets. Very safe to use. It's in a veggie capsule. You can use 1 a day for prevention. Helps with the immune system, colds and flus, wound healing, asthma, sinuses. You name it, vitamin C is appropriate for just about everybody out there. You can also do higher dosages if you need acute relief. And the only thing we watch is take it to bowel tolerance. Very safe, very effective, and most importantly, inexpensive for you. Costs you about $1 per day. Buffered C Plus by Nutritional Frontiers. Great for kids, adults, and seniors.
Okay, well, welcome back, everybody. I'm going to be bringing on the panel, and we are going to be talking about autoimmune. They didn't know the topic until about 5 minutes ago, so I like to keep them guessing. So with us, first and foremost, is Jamie Dorley and Dr. Orbach. Hello, gentlemen. Welcome back.
Hey, Dr. Tracy.
And of course,
Go ahead. This is the Dorley and Orbach family versus the Messino and the Niznik family. Come on down.
And Joe Messina and Jeff Niznik, the Godfather. Jeff, I think you're safer. You're with the Godfather.
No, so, I always feel safe with the Godfather.
Well, you don't need to be safer.
We like to live on the edge.
So this is our roundtable discussion, and I'm going to pose questions to the group pertaining to autoimmune. Jamie, you had mentioned in your lecture that you see this as something that's going to be coming up hard and heavy, more scary than the COVID pandemic ever was. And can you just tell me a little bit why you think that's going to be happening?
Well, it looks like from the concern with the vaccinations and people are already sick already. And if you look back when I was doing consults for years at the Wellness Center, I saw a rapid rise, especially younger adults with autoimmune conditions, colon resections, IBS, Crohn's, colitis. I mean, it became to the point where anytime someone came in their 30s, I expected that, they would have some kind of surgery already. So, the overconsumption of antacids, the side effects from the medications and the toxicity that people are exposed to. So I see a rapid rise in this already. And now there's 100 different autoimmune types of conditions, diagnoses, maybe more, right?
Yeah, at least that many.
So I think it's only going to get worse in the next 3 to 5 years. And, now you have all the unknown about the vaccinations. So I'm very concerned about this. And I think that's why when I was doing consults for so long, eventually I realized, wow, I do pretty much Candikill and superbiotics on everyone the first month just to see what really is going on with them.
Yeah.
Dr. Orbach would say, he goes, get them off of dairy and sugar and you're almost there.
That's so true.
And so that's my concern. I think this is going to get a lot worse.
Well, I have a similar observation and a similar perspective, but I'm noticing a different mechanism or a different red flag. I mean, when you think about treating a patient from a chiropractic standpoint, what brings you in? Why did you come to see a chiropractor? And the number one answer is some sort of ache or pain. And when we start to see patients who have multi-joint, multi-body region ache or pain without necessarily having a traumatic injury. You think about a joint. A joint is actually, there's physical space there. Your body is so wise. If there's a problem, if there's something that doesn't belong in your body that might be a harmful metabolite, your body is going to store it somewhere first where we don't have to compete for space. So what we see, gluten sensitivity is a really good one to pull out as an example. And we know that gluten hypersensitivity reaction leads to a whole sequela of autoimmune issues. Like we start to see the proteins start to match certain proteins that we see in joints. So it's a really difficult diagnosis to make, to be able to say, this is routine joint dysfunction that comes up because of the repetitive motions of daily life, or maybe some sort of low-level trauma or even a car accident, versus you have a dozen different areas of your body. Like you're telling me that you have specific parts of one foot and specific parts of the other foot, and it's not mirror images of each other, and we see the same thing in your hands. Like when I see that, like they're a chiropractic patient in the sense that, yeah, we're going to do some neuromusculoskeletal adjusting in order to reintegrate the way the brain and body are talking to each other. But you also just became, in my mind, a nutrition patient. So I'm lucky. I work with people who are just absolutely superior nutritionists. One of them, for example, is sitting at the computer in the other room. If Mr. Niznik, if you'd like to wave.
Not you, Joe. Not you, Joe. The other guy.
Joe and Jamie are both are both top flight nutrition experts as well, but neither of them see patients here in this office. So I'm thinking about the context in which, who am I referring patients to? How are we going to clean up the debris, literally the debris that has begun to exist in your body that is either a symptom of or about to be the cause of an autoimmune disease? And the very first manifestation, the window that I'm seeing, is multi-regional, non-traumatic, non-repetitive motion type of event, pain specifically located to joints, without a lot of concomitant muscle pain that would typically would see. So that's just that's a highlight. I mean, it's not a highlight, but that's a
great observation. I mean, I was gonna, ask you to define pertaining to immunity with chiropractic, but I'm gonna throw a question to Team 2, the Joe Niznik dynamic duo. So it sounded like Dr. Orbach made a pretty good distinction. So there's a lot of diagnosed autoimmune disorders, right? There's Hashimoto's, fibromyalgia. I mean, we can go on and on with the names that they give these. But really what I heard Dr. Orbach say is inflammatory markers are the first indicator. So can you guys touch on defining autoimmune disease? What does that mean really? And can you make distinctions for me? Jeff, I know you deal with a lot of allergies. I'm sure you can deal with this. So what are some more common names for the diagnoses, but then what are the secondary autoimmune factors that you're seeing?
Well, our topic was about autoimmunity, and we talked about the vaccines in general. I mean, as kids, in the time that I was born, we were given a vaccine that had simian monkey virus in it that alters our DNA. And these new vaccines are no different. They're altering our DNA. And the vaccine adverse event reporting system, the VAERS system, as of February 18th, there's over 1,095 people that have died from the vaccine, over 14,000 some injured. And you look at the data and they list autoimmune diseases that people are listed on there as an adverse event from this. And that number is huge. It's huge. Just from the small fraction of people who are actually reporting to the vaccine adverse event reporting system. They say only 1% actually reports a problem to the system. So where's all this trouble come from? Not only that, the vaccines, but the chemicals in food, the chemicals that they're adding to our food, the obesogens. These are altering our body's functioning. It could very well be altering our DNA, adding to this inflammation in our joints, pain in our body, dysfunction. But you think who would profit from that? I think you can answer that very well, couldn't you, Joe?
Yeah, well, there's a company that makes both the toxins and the drugs. So that's Monsanto, not to mention names. But, I got to go back and refer back to Dr. Tracy, because, one of the things I always quote her on, I quote her a lot, but this one phrase, the body never does anything wrong. So they're calling all these things autoimmune diseases. We know most of them are diagnosed as idiopathic, which means no cause known, or they don't know the cause. So this all goes back to what's triggering that to happen in the body. Something's triggering it. Your body just doesn't attack itself for no reason. It's responding to a trigger. And it's got to go back to food for the most part, chemicals, both injected and ingested. And I think that's where we got to start. Glyphosate was 1976. And I heard you earlier, Tracy, quote me on the quote I get from Dr. Zach Bush, which was there were 12,800 known epidemics since 1976, the year glyphosate was introduced to our food system.
Right.
Wow.
So to the point of autoimmunity, I mean, how does it begin, right? Are we looking at chicken or the egg? Is this something that we're born with? Is it our genetics? How did we get here? So we're seeing, like Jamie said, thousands and thousands of cases now of new types of autoimmunity. We heard from Dr. Orbach saying that there are some inflammatory things that we do from the outside in. We have the potential of the vaccine coming in. We have toxicity, as Jeff was saying. And then, Joe, you're saying that, most of these are idiopathic. So let's talk about diagnoses of autoimmune. Can anybody wants to answer? Maybe Jamie, you can touch on this. how are these diagnosed, and what do they look for in order to give you a diagnosis
Yeah,
on
I
an
think we gotta
autoimmune?
back up a little bit and just look at what's going on in the body, right? How does it? Why would you have an autoimmune, quote unquote? Your body's attacking itself. Isn't that what people are told? Yeah, yeah. So
trigger.
yeah, so that's what people are understanding when they go to the medical doctor and they're telling them, hey, my hands are all tight, my joints hurt because I have an autoimmune. So your immune system is attacking yourself, so we're going to suppress your immune system. That's what they're being told, right? So let's go back up a little bit. Dr. Weiner would say, Dr. Jeffrey Weiner would say, it would never make sense in the real world for your body to attack itself. So let's go back and look at the structure of what's happening. So oftentimes, and I've been victim or a case of autoimmune back in college. I was a sports medicine student. That was my major. And I developed this really interesting discoloration on my skin. It started on my shin, and eventually it became psoriasis throughout my body. And when I kept going back to the healthcare center on campus, they would just say, oh, it's just a rash, take this cream. I kept going back, and then finally I was diagnosed with psoriasis. He said it's genetic, so my mom was full-blood Italian. She called everyone in the history of our family. No one had it. So after going back over and over and over again, the guy says, well, there may be, some liver issue or yeast. So I researched it more and more. I found out what was really going on. So with an autoimmune condition, your immune system is hypersensitive. I always tell patients, if you call the cops 100 times in one day, someone's going to jail, right? Yeah. So what happens is, in a very simple explanation, is your intestinal tract is designed, it's like the old screen door in grandma's house, to let the air in and keep the bugs out. But when the screen door got ripped open, many times from the dog or us playing, the bugs would come in and grandma would get a little upset. So someone was getting in trouble. Same thing with your intestinal tract. It's designed to let the smallest possible particles of food in to the bloodstream, and then they get transported throughout. When that intestinal tract is broken down, they call it candidiasis, leaky gut, dysbiosis, all these fancy terms. But really, you have a penetration out through the intestinal tract of larger molecules, usually of undigested proteins, dairy products, toxins, mold, funguses, bacteria, whatever it may be. Things are leaking in now to the bloodstream that normally would be filtered out. And now the immune system sees this as a foreign invader, turns on the immune response, which the end result of any immune response is inflammation. So think about having that irritation all day long of that cheese getting in, some of that undigested protein getting into the bloodstream, the immune system firing up, boom. Now you have this chronic low-grade inflammation that over time can manifest as psoriasis, rheumatoid arthritis, colitis, scleroderma, so many different terms. And now you've been diagnosed, and they're going to say, well, your immune system's super hyper. Let's just shut it down, right? Mm-hmm. No different than shutting down grandma when she's young because the bugs are in. So a very simple approach from where we're sitting that will help at least 80% of people in their first month would be to eliminate the things that are coming in that are going to be very hard to digest, like milk products, dairy products, sugars, junk food. And then let's start to heal the gut with things like GI Complete, superbiotics, and give some enzymes like Cybezyme, Probezyme, Betazyme to clean up any debris. So from where we're sitting, it's a very complex process, but a very simple solution.
Right. Something that you haven't mentioned that I think is an enormous help to this whole sequela of events is the Super Cleanse. I think it's a new-ish product.
Power Cleanse.
Power Cleanse.
Yeah.
Thank you, Power Cleanse. That we want to find as many different ways as possible to clean out primarily the digestive tract. But when you're cleaning out your digestive tract, you're just as these pathogens that we're talking about become systemic, that they're able to escape the digestive tract or make their way into circulation, the cleanse does the same thing. So when you talk about a good digestive tract cleanse, we're making a good systemic cleanse. And there's one case that just stands out in my mind. We're going back probably 6-8 years ago a woman had these just an intense rash on her lower leg. They all look like these blood blisters. And Dr. Weiner was still here with us then, and the group of us put our heads together. And we're like, well, it can't be this, it can't be that, but it might be this and it might be the other. And by committee, we figured out that she should be taking, the first thing we're going to try is an anti-parasite cleanse. Now, the parasites are intestinal by definition, but they make their way out of the intestinal tract and they become systemic. So we're looking at this cleanse that within a matter of weeks, you could see a noticeable difference on this woman's legs. And if you think about how long would those parasites have to be sitting in her intestinal tract to the point where they reached a critical mass that they escaped, got into the circulatory system, and then found a convenient home in her lower legs. I mean, this is probably a process that's been going on for years, maybe decades. And then in relatively speaking, in the blink of an eye, we start to see tangible changes and observable changes in her legs. Now, the point of all this backstory is, what do you think if she went to go see her medical doctor? What do you think she would have been diagnosed with? Which medication would she have been put on? How would they have addressed this? That is really, now that we know, because the treatment was so successful, we can say this woman had parasites. The only reason we can say that is because we made a really good educated guess based on what other people have had similar presentations with in the past. And that's what we did for them. It worked out beautifully, but we could have just as easily have made an educated guess and say this is Candida or this is we should be doing an antiviral protocol.
Mm-hmm.
And so very simple. She would have been put on prednisone.
Exactly. That's exactly right.
Well,
exactly,
let's talk about. So that was. Go ahead, Dr. Orbach.
I just want to finish this point without encroaching on other people's time. But the point is that if we're talking about autoimmunity, first we're going to have a really interesting debate as whether or not that even exists. But once the pathogen has escaped the digestive tract, yeah, that's an autoimmune disease. Your body's turning on itself to fight itself.
Yeah. Trying to clean itself up.
Right.
Yeah.
Right. So once again, as with everything in the healthcare world, early detection. When you first start to have these signs of symptoms, when something's not right, go see a provider. That don't come in and say, well, it started off about 2 years ago when I had this, and then it snowballed to that, and now it's become the other. That always, as with all things, the sooner we can get our hands on it, wrap our brains around it, the easier it is to fix and to correct.
Yeah, as Joe would say, don't race for the cure, race for the cause, right, Joe?
Look for the cause.
Well, I think
There's
you
always
guys
a
are
why.
putting out a lot of information that's probably shocking to people, because I know when people would come see me at my clinic, they had this diagnosis of some sort of autoimmune, and it was terminal to them. So for me to even put a glimmer of hope into their life was to actually go against what the medical profession said. And that's a risky place. So I love that you brought up the connection with gut dysbiosis, right? Leaky gut, Jamie. The screen door was always an analogy I used when I taught my students at Trinity of, it's meant to let some things in and out, but not all things. And, again, we got in trouble for breaking that screen door. So autoimmune, and maybe Jeff and Joe can touch on this. What about food sensitivities that Dr. Orbach was talking about? What are the most common culprits that can start this downward spiral? And then I want to talk about the most common treatments out of the allopathic next, because we need to talk about what is, the most common treatments for this condition or these conditions, and then what can we do with alternative solutions. So Jeff and Joe, can you touch on food sensitivity and the cascade of how that might create an unfavorable environment?
Well, yeah, your body has an immune system, and your body has sentinels or scouts that goes out throughout your body looking for the bad guys. When they find bad guys, they attack it, just like any army does. And if, like Jamie said earlier, when incomplete products of digestion get in your bloodstream, you can react to this stuff. You're supposed to be able to break your food down to amino acids, proteins down to amino acids. But if these bigger proteins get in your bloodstream, right by above your heart there is your thymus gland, and your thymus will be scanning your blood looking for the bad guys. And when it sees these proteins that should be there, it mounts an immune response to it. And then you end up wasting energy creating an inflammatory response. You waste energy creating an immune response to food that should be feeding you and nutrifying you and giving you energy. You're wasting energy with this. And that boils down to, well, why aren't you digesting your food? Quite often we don't have all the nutrients in our body to digest food, to create all the different chemical reactions that your stomach and pancreas are supposed to do. Or we're just are not putting enough nutrients in, and we're eating things that block our absorption of it. Our intestines are leaking and letting problems in, or we're coating our intestines with, most people have problem digesting gluten or gliadin, that's in oats, and that's coating your intestines and blocking absorption of nutrients on top of that. And that interferes with your body's ability to produce the digestive juices you need to break food down, and then you get this inflammation in your body from food. People come and see me on that first visit, and I test them on food, and they fell on 50, 60, 70 foods. And they come back 4 weeks later, and they don't feel hardly anything anymore. And all they did was change their lifestyle a little bit. They basically stopped eating these things that their body said, like, I can't tell you your body has a problem with this. Your body will tell both of us you have a problem with these things. And so once you improve that, stop the inflammation, nutrify the body starts to work better.
You know, I think one thing needs to be addressed and cleared up right away, and that is we actually have two immune systems. You know, we have an innate immune system and an adaptive immune system. The adaptive immune system is when you get hit with something hard, bang, a virus, a bacteria, an injury, whatever. But our innate immune system's working 24/7 all the time. And it should have an easy job, but it doesn't, because of we're bombarding it with toxins on a regular basis, both ingested and injected and topically in our environment. So the innate immune system gets worn out. And then when you have an event, you've already lost half of your army to fight this event, this immune response. So that's why I think so many people are having such a bad time, because their innate immune system is depleted. So their adaptive immune system, and that's where we can come in and help fortify them, is their adaptive immune system with vitamin D, with products like Immunomax, you know, with all of the things that we know that we can incorporate to help boost that immune system and help it fight better and help replenish that army. So,
but Joe, I have to say, and maybe the group can discuss this point, a lot of people with autoimmune are told not to boost their immune system, and that certain supplements that are, you know, advertised as immune boosting are dangerous. Does anybody want to comment on that
I want
point?
to comment on that, Tracy. And I'm going to answer your question that what are the most common foods that are triggered?
Thank you.
Right? So the one that I saw when I was working as a nutritional consultant in the Wine and Wellness Center and working with thousands of functional medicine doctors throughout the country, and Dr. Bland and the whole team, you know, the most common one, you know, there's probably 6 or 7, but dairy products I found number one. So that's milk, cheese, ice cream, creamers, yogurt, believe it or not, yogurt, cottage cheese, and anything else that falls under dairy. Dairy's not eggs. Dairy's from a cow, not from a chicken. So anything that comes from a cow is concerning for me. I usually find people tend to eat a lot of cheese, and they do a lot of milk or creamers or ice cream. It's usually one or the other. So number one for me was dairy. Number two I saw was wheat and wheat products. So people think wheat bread is better than bread. It's probably worse. So any wheat or baked products that has wheat flour, enriched wheat or flour in it. So that's pretty much all baked goods, crackers, cookies, pies, bagels, donuts, all that stuff. So one is dairy. Two is going to be any baked goods that contain wheat or yeast or brewer's yeast. Those are the top two. Next one will be corn. I saw it to be very common. Corn and corn products. Just because you don't eat corn on the cob does not mean you're not ingesting corn. Corn is the base of a lot of products that are made. High fructose corn syrup, of course. So sugar being the next one, was in just about everything. I'm not talking about fruit, which a lot of people give fruit a bad rap. Oh, there's sugar in it, but meanwhile, look at their diet, right? So I find dairy products, wheat and baked products, corn, sugar, and then the other one I look at is soy. Those are my top 5 that I found to be the most common culprits. Now, I didn't include in, of course, fast food, junk foods, and just junk, because as you guys taught me, there is no junk food. It's either junk or food. So all the processed stuff comes in. But those 5, I think, oftentimes people think that and look, don't want to discourage them, right? When I first started out, I was eating turkey on wheat bread. I thought that was good, right? You got to start somewhere. But we got to take continual steps as we grow with wellness, just like anything else. So even if it's skim milk or lactate milk or any other fancy names, it's not good for you. And what happens is over time, they're trying to suppress the immune system because the person's consuming so much of this trigger. It's more and more gasoline. The fire is getting bigger, and they don't know what to do with it. What do you
Right.
thought?
I agree completely that you certainly have seen a lot more nutrition patients than I have. But I mean, when you were going through your list of foods there, I'm thinking, yeah, that's right. I know exactly. Spot on. And your analogy about throwing the gas on the fire, this comes back to what I said earlier, is when people have, like, we have to do a better job of coaching the population to understand that when you wake up and your hips are a little bit stiff, when you get out of bed and you make your way to the bathroom, and by the time you're done shaving, your hips aren't stiff anymore. I mean, that's uncomfortable. That's not a big problem. When you get out of bed and all your joints ache and you can't remember doing anything to injure yourself, that's the time to make an appointment to see somebody who can help you. And maybe that's chiropractic help. More realistically, that could be nutritional help. We have to do a better job of teaching people to understand the signs that their body is throwing out at them, so that we don't get to this point where there's so much gasoline on the fire that all we can do is hope for the best.
Yeah, one quick point.
That's a great point, Dr. Orbach.
I saw him recently, and I said, wow, you look good. You lost a little bit of weight. He's like, I'm down almost 20 pounds, but even better, he goes, my joints don't hurt anymore. I said, what did you do? He says, oh, I listen to you. I just cut soda out. I'm like,
that's all it takes.
Yeah.
Sometimes it's simple, right? Sometimes it doesn't have to be cut out every food you talked about. And yeah, I agree. Like, those are the most inflammatory that I've seen. But one step at a time, right? I mean, and that's why I tell people, I wasn't always healthy. You know, I was overweight primarily half my life. So it's like you get to a level of like, oh, okay, this is true and this is false. And then you move towards truth. So
I had a client years ago who, she was probably 5'9" and 107 pounds, and she drank at least 2 liters of Dr. Pepper a day, and she ached so badly, and it was like an addiction. She couldn't get off it. It took her about 8-9 months to whittle down to 1 2-liter a day.
Well, you know what I used to tell my clients? It's not bad enough yet. If you're not willing to give up the things that's creating your disease, it's not bad enough yet. Come back when it's bad. So one of the first, I think, medications that are given to people that are experiencing autoimmune, although I don't think it's considered autoimmune until it's diagnosed, right, is PPIs or acid reducers. I think those are the first medications when someone's experiencing, you know, a reaction to foods. And they're so commonplace in our society. So I think that's one of the medications. Then we can get into biologics, steroids, NSAIDs. Can you guys touch on these medications, maybe one by one, and why they're not the best path for long-term use?
You know, you mentioned the PPIs. I mean, it goes back to what we talked about earlier. And
What PPI is.
A proton pump inhibitor. These are to stop acid reflux. You know, acid reflux. I mean, it's a digestive issue. Come on, that's where it all starts. And it goes back to the point that they're not looking at the cause, Tracy. They're not looking at the cause.
So what would the cause be in that case, Jim?
In that case, they're not making enough hydrochloric acid to digest the foods they're eating.
Or they're eating foods that are on the list Jamie just gave us, right?
Exactly. Now you're looking at betazyme. It's the exact opposite of what that old phrase, the exact opposite of your intended effect. It's not that they make too much. They're not making enough. I had some battles with doctors years and years ago over this. How can you say that? How can you add more? They're making too much. No, they're not. They're not making enough to digest the food properly, primarily the proteins and the fats. Mm-hmm. And then you have the whole issue with, you mentioned, Tracy, blood pressure, cholesterol, and digestion, and proton pump inhibitors. Every one of those is for a disease that's idiopathic. They don't have the cause. They don't know the cause. We know the cause. First of all, blood pressure is not a disease. That varies with age, activity, size, movement, everything. But they set those limits, and the limits keep, either going up or down based on the sale of the limits for the drug.
Well, I remember my grandmother saying, years back when she had her blood pressure measured, 140 was normal. Now we're down to 120. Right. We're going to be down to 0 here soon, 0 over 0. But, with the digestive inhibitors, which I like to call them, they're the top 4 medications prescribed in all of the world. Top 4.
That's
so
right.
Then we go into biologics, NSAIDs, and steroids. And maybe, Jamie, you want to touch, or Dr. Orbach, on NSAIDs, non-steroidal drugs, and over-the-counter as well, right?
Yeah, this is the tip of my tongue. So NSAIDs, non-steroidal anti-inflammatory drugs, then the new ones came out, Vioxx and Celebrex, and these were selective COX-2 inhibitors. Now, COX-2 is an enzyme, right? So in the joints, it creates pain, but in the stomach, it's a repair mechanism, right? Mm-hmm. So it'd be like if we have a problem with the light in here, I can shut down this switch here. I can shut down the power in the building, or I can shut down the city of Pittsburgh. They would all accomplish the same thing, but some would have a lot more effects to other people, right? Mm-hmm. And that's the problem with these NSAIDs. First of all, they were designed as a 24 to 48 hour pain relief, and they're miracles for that. They were not designed for chronic use. The problem is the people that use these are heavy users and chronic users. Mm-hmm. That's why you have issues with stomach, kidneys, liver, and they double your risk of heart attacks.
Wow.
When I was first invited to help make presentations during the wellness weeks, I think this was when we moved into this building. It was like 2008 or 2009. It was the first time I got a speaking part. And so Dr. Weiner said, hey, give a speech. And I didn't know how long is it going to be. It was scheduled for a Tuesday afternoon, and I had no patient scheduled for Tuesday afternoon. So you know what? I'm going to speak for about 2 hours or maybe longer. I'm just going to ramble and roll with it and just talk about topics and more topics and then some more. And so I'm building this speech, and I came across this insane statistic that more Americans die every year from gastrointestinal bleeds related to non-steroidal anti-inflammatories than of HIV/AIDS.
Wow.
So I would ask the crowd, I would just point to somebody at random, and I would just say, who's your favorite band? And they look at me with a deer caught in the headlights look. I'm like, you like music, don't you? Who would you wait in line to see concert tickets for? And finally we would get to it, and somebody would name like the Rolling Stones. And so I was trying to be a little sarcastic and a little witty and keep people's attention. And I said, do you think the Rolling Stones would be up for doing a charity awareness benefit concert? No, not starving children, not homeless veterans. Teach Americans to quit taking so much aspirin. Do you think they'd be into that? So
it's the number one over-the-counter prescribed now for COVID, 325 milligrams of aspirin daily. So imagine that's a lot of aspirin. It's shocking to me. It really is.
Yeah, if you look on the label of those, it also says do not consume if you have 3 alcoholic drinks per week. And in Pittsburgh, between church and the Steelers games, that's easily included every week.
So Pittsburgh, beware, yeah. Right. So one of the things I want to talk about, and Jeff, maybe you can address this, and Joe, because this kind of goes with allergies. The number one prescribed treatment for any allergic reaction is steroids, and especially in children. And it's just the norm now with kids. It's almost like a growth marker when little Jimmy gets asthma. But what is that asthma coming from? What is this inflammation in kids coming from? And, according to studies done on PubMed, the contraindications to prescribing steroids to children are weight gain, growth retardation, Cushingoid features, and most frequent ADRs seen when long-course oral steroids were given to children. So I know that my one friend has been on an inhaler ever since I can remember.
Yeah, so asthma, breathing problems, you got to look at what's inflaming the body. I've done a lot of different allergy reversal treatments on people over the years. And that alone, doing 3 or 4 treatments on some people, got rid of, they had no more asthma symptoms. That was pretty amazing. About 11 people at the last place I worked at in about a year span told me they didn't have asthma anymore. I didn't treat them for asthma. We just, toned down their negative response to dairy and a bunch of different things, and they started to do better. So why is your body not handling all this stuff? Is your liver that congested and it's not filtering your body and doing the things it's supposed to do? Is your kidney that messed up? It's not filtering your blood? Are you eating so many things that are inflaming your body? And your body's just overloaded. Your lymphatic system can only handle so much from all this inflammation and damage. You start putting pollens in on top of that, or cat fur, and all of a sudden people react to these things. So number one, you got to clear up the body. You got to improve digestion. You got to stop putting the poison stuff in, and then look at allergy reversal treatments. So also, the lungs are related to the kidney in a sense. If the kidney is spilling out the albumin, you may be getting so much inflammation in your lungs from not enough albumin in your bloodstream. Keeping the water in your bloodstream, it's spilling out as inflammation in your body. That's another thing to look at. The body will tell you what it really wants, what it's really having a problem with. You just have to ask it. Every one of your cells has incredible knowledge and intelligence, and your body is able to communicate with you if you know how to communicate with it. And that's basically what I do when people come to me, because some people can be inflamed from parasites, or other people are inflamed from fungus, other people are inflamed from, almost everybody's inflamed from food and wheat. Like Jamie said earlier, the number one thing for him was dairy. To me, the number one thing people have an issue with is wheat. On the first visit, many people fail on dairy. Once you improve their digestion, improve their daily nutrition, improve their reduction in inflammatory agents, when people come back 4 weeks later, I test them again, and they usually don't have a problem with dairy, they still have a problem with wheat. Wheat's a really big problem. And that just, it just boils down to, you most likely you're not producing enough digestive things to break that down. And then that coats your intestines, and that blocks your absorption of nutrients, and the whole bowl starts rolling downhill the wrong way.
Well, I think that one of the issues is very simple. Allopathic medicine is a reductionist approach, a pill for an ill, period. End of story. That's all they do. That's all they're taught. This is a holistic approach. So it's not look at, well, what do we, how many times, Jamie, we get people come in here during the wellness weeks and they say, what can I take for my cholesterol? What can I take for my blood pressure? And they're 50, 60, 70 pounds overweight. You can smell the smoke on them. It's a holistic approach that we have to get people back into, not a pill for an ill. You can't treat the thyroid outside the body. You can't treat the gallbladder outside the body. They'll just take them out, right? Dr. Weiner's, my favorite quote. I know, Jamie, you have yours. Mine is, modern medicine, and I'm not going to say traditional because it's not traditional, but modern medicine thinks we have too many organs and not enough drugs. So that pill for an ill reductionist approach has to go away. And that's what drives the pharmaceutical industry. We're the exact opposite of that. Whole body.
Well, Tracy, I love the fact when you talk about NSAIDs, right? That's the beginning of the problem. But how often is a person with autoimmune conditions told when they're first diagnosed, we're going to start you on NSAIDs. And when your problem gets really bad, we're going to bring in the heavy hitters, methotrexate, sulfasalazine.
Right.
And the person says, well, why can't I use them now? The doctor says, well, there's too many side effects. They're too dangerous. So basically what they're telling the person is, hey, you got a problem. I can't help you. We're going to try these NSAIDs. And when your problem gets bad, which eventually it will, we're going to use really bad medication on you. And we can't cure you no matter what. I work with a functional medicine rheumatologist in Florida, and she says those medicines are killing people. She says they're so dangerous that she tells her colleagues don't even use them. And she was using fish oils, probiotics, some of the curcumin, turmeric, things like that. And she says a lot of course, was the diet base. So the medicines are really dangerous because people are using these for acute medicines for chronic cares, right?
Yeah, that's well said.
Is it fair to say then that simply by changing your diet, removing inflammatory markers out of your nutrition plan, such as gluten, dairy, sugar, things that are really hard for the body to digest, optimizing your digestion with good enzymes and probiotics, maybe cleaning out the digestive tract, like Dr. Orbach was saying, of parasites and candida, and then maybe doing some things to reduce inflammation, Jamie, like with turmeric, maybe X-Flame and Inflam. Is it possible for these people that have this diagnosis of autoimmune, can they overcome it?
Well, I just talk about my personal experience. We're not making any claims here. At one point, I had 90% of my body covered with psoriasis. Not a very pleasant condition, especially as a young man, right? It was painful. It was embarrassing. It didn't look real nice. You know, you don't want to go out without a shirt. I would wear a sweatshirt in the summer, always long sweatpants on. So for me, I'll tell you my story. You know, currently I have 0 psoriasis on my entire body. I had about 5% of my body for years. And then when I did the last food allergy testing, it all went away. So for me, I had not cured, but I had 0 symptoms of it. Now I know if I eat really bad or started drinking alcohol, a lot of alcohol and stress, I would probably have it flare back up again. But for me, no signs or symptoms. I'll give you another case study. One of my best friends, Mark Kelsch, he was my roommate at Slippery Rock. He was diagnosed with scleroderma about 15 years ago, and they gave him 18 months to live. Now, Mark's good looking, built like Dr. Orbach, you know, great shape, and he was scared to death. He was on a picnic basket full of medications. And I met with him one day, and he said, I can't take it. He goes, and he's not a medicine guy. He goes, what am I going to do? Take 2 picnic baskets full? I says, look, you're out of work. Let's get you down to your mom's house in Florida. Let's get you on a cleanse. And that was the beginning to his comeback. He's currently retired, living with his wife in Costa Rica, which we were all jealous of.
Yeah.
0 symptoms of scleroderma, which is a hardening of the tissue. His was systemic. So there's 2 examples. We have hundreds of examples. One of our doctors, Dr. Conan Shaw, he has 20 documented cases of MS patients being cured. And I know you guys have seen many people here. So that's it. Look, it can't hurt the person, right? So at the very least, you know, it's not going to hurt them.
I think it's really dangerous to use the word cure. That's a big promise. I don't even know what a cure means. I mean, 100% relief 100% of the time. We don't know if you've been cured until you've passed from something else. But I like to say that almost everybody, probably everybody, if approached right, we can make improvements in your condition. We can help you get from A to B, and then once we're at B, we can endeavor to get from B to C. But to say that we're going to cure everything and make 100% of the problems go away, I mean, that's writing a really big check that I don't know if we can cash. But it's once again, the sooner we get to working with people, and one of my favorite words is prehab. And I think about prehab in the context of athletic injuries. How are we going to program your body in such a way that you're less likely to roll an ankle, less likely to strain yourself? But prehab means really it's not just athletic injuries, but it's prehab for life. That what kind of a nutritional supplement program can we put somebody on when they're really feeling very okay, and help them to get from really okay to pretty good without having a picnic basket size bottle of pills, whether it's medication, whether it's nutritional supplements. At the risk of sounding lazy, how are we going to be able to accomplish the most by doing the least? And if we can get to people and educate them properly and say, look, you've seen this script play out. I've seen this script play out more times than I care to list. Let's get you on a program for a lifetime that's not going to be burdensome in the terms of finances. It's not going to be burdensome in terms of time commitment, and it's going to help you hedge your bets that we don't have to worry about getting you from A to B and then B to C over the course of a lifetime.
Those are great points because, sometimes just getting the person to where they're not getting worse is a big accomplishment, right?
Yeah.
Right.
The ship's a big ship to turn. So if you're not getting worse, that's a big accomplishment. I think people have to be a little more patient. I think they're looking for the magic cure that's going to fix them instantly. It's the world we live in now, the world of drive-through medicine and COVID testing in your car, right? Folks, it may take time to fix it, right?
Mm-hmm.
Mine was a long, gradual process with the psoriasis, right? To where it was like if I was 80% symptom-free, I was happy. And then you get to 90, 95, and now there's 0, right? But I could easily get right back into that.
Right.
So improvement and patience.
And
So-
one of the things I like about Jamie's experience is your experience in college. I mean, let's not divulge anybody's ages and whatnot, but it was long enough ago that we can say right now in 2021, we know substantially more about nutrition and natural health than we knew when you and I were in college. And hopefully when 2040 rolls around, we'll look back at what we knew in 2021 and say, man, we've grown from that point.
Well, I think that's such an awesome point. All
right,
hang on.
Collective we.
So I think that's a great point.
I don't know, 40.
Everybody calm down or I'm going to mute you.
When 2020 rolls around, I don't have any intention of working full time. But be that as it may, my point is very simply this, that we know so much more now than we did then. We continue to learn more. And the reason why we have roundtables like this, I mean, we're broadcasting our roundtable on the web and inviting people to listen in. But what you don't see is the roundtable that occurs in 2 to 5 minute chunks multiple times every single day here, where Dr. Honigman, who's not here today, I mean, I think he's one of the smarter people that I know. He's like, when you go through the drawer and you cut your finger without looking at what you're doing, that was Dr. Honigman's knife. But like he's a constant reader and studier, and he'll stop me between patients, and I'm kind of hustling to stay on schedule. He's like, hey, Dr. O, did you know? And I'm like, am I going to get to the next patient or am I going to learn something new? So these roundtable discussions, they're happening all day long in informal little bits and chunks in our facility. We have a solid commitment to making sure that we know the latest and the greatest when it comes to which techniques go together, which nutritional supplements go together, how do we combine this and that, how do we make these symptoms go away by using something that we just learned yesterday. And so the point is, like, we're on top of things. We're making sure to all the practitioners here stay educated, and we continue to educate one another. And so that's why we can say to somebody who's a very, very athletic, fitness-oriented 20-year-old college student, look, we can help you. We know, we've seen this before. We can help you. And if you're going to buy into what we're saying and what we're doing here, we're going to be able to offer you help at a much quicker rate than we were able to 10 years ago, 15 years ago. And God willing, that whoever's practicing here at the Weiner Wellness Center, at this Wellness Center in 2040, they'll be ahead of the pace that we're at now.
He's resigning. He's out. You're too young to be out by 2040. So here's what I'm going to try to summarize.
I'm 119 years old.
You look great. It must be that power cleanse.
It must be.
So decreasing the inflammatory foods, increasing gut health with enzymes and probiotics. Last question for Joe and Jeff. Is it safe if these people are the most susceptible to COVID? Because people that have comorbidity, that have a diagnosis, and a lot of people that are autoimmune, diabetic, I mean, they were the most susceptible. What can they do in order to boost their immune system? Joe?
Well, it's very simple. There's not a single person that walks in here that should not walk out with a couple of bottles of D3. It's got to start there. Every single one. I keep telling people, get a bottle for every member of your family. They need their own bottle. It's not enough to get one for the family.
But Joe, can they get sick from too much vitamin D?
Great question. No, you cannot get sick. You cannot become toxic We do not use the word toxic and vitamin in the same sentence around here. We've got enough toxins to deal with. We're not going to do that to vitamins. And even though D3 is not a vitamin, it's essential. You have to have it now more than ever. You got to start there. D3, everybody in the family needs that, right? Work on the gut. Digestive enzymes and probiotics, are they safe? Yeah. You know, when you ask that question, you know what came to mind? The Marathon Man. Remember that movie? Dustin Hoffman and Laurence Olivier? He kept drilling his tooth. Is it safe? Is it safe? And he didn't know the answer. We know the answer. Yes.
Mm-hmm.
It's safe.
So all safe. So vitamin D. Well, thanks, Jeff. That was great. Well, I think a lot of people worry if they're on autoimmune, types of medications, whether it's steroids or whatever. You know, Jamie, we talk about this a lot. If you're on this medication, many studies have said take this supplement, right? So point in case would be a statin. You would take CoQ10. I always say if you're on a steroid, then you need a probiotic, because that's going to destroy the gut microbiome. I think a lot of these biologics and NSAIDs, they're very destructive to the body. What depletion do they cause that we can offer people today? Like, okay, if you're on this medication, we can't tell you to come off. That's not legally our job. So you have to talk to your medical professional. But what nutrients can they bring in that'll be safe and, help them boost their immune system a little bit?
Yeah, earlier you talked about the NSAIDs, the non-steroidal anti-inflammatory drugs. Don't those deplete your body's ability to produce proteoglycans, the building block for your joints? Dr. Wani used to say, you take this stuff, your joints will wear out. You're taking it temporarily to give you pain relief in your joints.
Right.
In the long run, you're wearing your joint out more rapidly by taking these drugs. What's the better approach? Well, come see us and let's find out what a better approach is. Are you have too much fungus in your system and it's eating up your food? You're wasting so much energy fighting that fungus. You don't have extra energy for the rest of your restorative processes of your body. It's just one of those things. You have too many toxins in your system destroying cells in your body. You need to get that stuff out of your system.
Hey.
Come to the Wine and Wellness Center. Let's look at a holistic approach and looking at your whole body, not
Yeah, absolutely.
just one little.
So any other words of wisdom from the panel today? This was a good discussion on autoimmune. I think you opened the eyes of a lot of people. I see people tagging people. I just don't think people approach autoimmune disorders like you did today. So thank you very much.
Yeah, one last thought is I feel that everyone needs a coach and a doctor. So I recommend people, hopefully they go to the Wine and Wellness Center. You can call. We are accepting new patients here. You can call 412-922-WELL, 412-922-9355. You can also do a telemedicine appointment if you're out of town. It's worth the trip. I travel down to Florida to see my medical doctor. So, you need the right direction, guidance, and coaches. Even the top athletes in the world have the right coaches. So we highly recommend you come in, let us do some evaluation, non-invasive, of course, and customize a program to meet you where you are and whatever your challenge you're facing. So in addition, you come down this week and be more than happy to talk to you.
I see that something popped up on the screen that someone said, can you do that kind of screening on telemedicine? And certainly telemedicine has its limitations, but the reality is everything that we do, whether we're talking about hands-on chiropractic, whether we're talking about muscle therapy, or we're talking about a nutritional protocol, it begins with a conversation. So yes, absolutely. If you're sitting somewhere that's too far from Pittsburgh that you feel like you want to see us do telemedicine and not in person, we can get started with you. We can talk about your circumstances, your individual specific circumstances. We can make some observations. We can ask you a few pointed questions, and we can help you get started. And we might be able to be your primary people through telemedicine. And if we're not, we can help you do some research and find somebody in your area to pick up the proverbial ball where we just can't do anything beyond the point without being physically present. Mm-hmm. So telemedicine, it's a great tool for a portal of entry and let's at least get you oriented and started.
Great, thank you. Jeff or Joe, anything?
Yeah, when you mentioned telemedicine, to me that just throws up a red flag as far as the name of it. I like telenutrition, telechiropractic, but telemedicine's to me a no name.
Yeah.
But yeah, folks, you're meant to design to eat food, and food's supposed to give you nutrients, and most of our food doesn't have the nutrients in it. We have nutrients here. Let's come find out what the right one is for you. Let's help you pinpoint that. Spend some time with me. Spend some time with Joe, Jamie on the floor out there. Ask them questions, and let's get you started on a path to maybe getting more nutrition to your cells, get your body working better. What could be wrong with that? You need food to function. Our food doesn't have the nutrients the way it should. Let's get some nutrients in your body.
Take the first step. Come on down, give us a call, but come on down. We're here. The Wellness Week's going strong. The energy in here is better than ever, and you're gonna feel that energy, and you're gonna be able to use it for yourself, and then talk to us, because we're going to be able to help you just by talking to you. The people in here have testimonials. Everybody that comes in here has a testimonial. But come on in and let's get you on the path to optimal health. Sometimes that path has to get you back to zero, a level playing ground first, and then we'll get you to that path. Like Jamie says all the time, you got to take that first step, that baby step, and let's just get you a little bit healthy. And then, that from there on in, sky's the limit.
That's right. Well, thank you so much, guys, for all your time and your knowledge. I really appreciate it. And stay tuned, because, Jeff, it looks like you're up next. Why are you fatigued, lethargic, and have low energy? Well, everybody should be tuning into this lecture. So thank you, Jamie, Dr. Orbach, Joe, Jeff. Thank you all. And stay tuned, everybody. And in 4 minutes, we'll have Jeff Niznik up from the Weiner Wellness Center. If you're fatigued, hang tight.
Ciao.
So guys, we have about 4 minutes until the next lecture is coming up. So just stay tuned and we'll be right back. Well, welcome back, everybody, to the Weiner Wellness Virtual Summit. And just in case people don't know who I am so quick to introduce our speakers. My name is Tracy Straub. I'm the Vice President of Marketing and Education at Nutritional Frontiers. I'm also a naturopathic doctor and a certified natural health professional. I have a degree in exercise science, so I do a lot of education, and I'm very honored to be hosting this entire event today. Jeff Niznik is actually coming up next. So I'm going to bring Jeff on now. And Jeff, good morning. How are you? Well, good afternoon. It went by so quickly. Look at me. I don't even know what day or time it is. I might as well just give it up.
I'm doing great. Doing great. Having a great day. Tracy, how do I pull up my PowerPoint for this one here?
Yeah, Phil's on his way. You got to pull up your screen share down at the bottom. It's a little computer with a red slash.
Okay.
See, you guys didn't watch my training video.
Did not.
I know. You have to have your PowerPoint open.
Okay, that's open.
Yep. So when you go to screen share, oh, hi, Phil.
Hello.
This is Phil. He works at the Weiner Wellness Center.
Screen share.
The grandson of Dr. Weiner. Just kidding. All right. We're ready to go? All right, Jeff, so you're going to control your slides, and I'll let you take it away. How's that?
Awesome. Thank you. Thanks, everyone. Well, folks, my name is Jeffrey Niznik. I'm a nutritional consultant here at the Weiner Wellness Center. I'm going to be talking about today why you're fatigued, lethargic, why you have low energy, and some natural solutions for this. And hopefully you don't look like this poor little guy here. So a little bit about me. I went to Center High School locally. I went to Carnegie Mellon, studied some mechanical engineering. I worked for several civil engineering firms in the Washington, D.C. area. And then I got into the health and healing arts field. My whole life has been about being in pain. And recently, the past 4 or 5 years, getting out of pain. And my journey has helped me learn what I need to do to help other people with their problems as well. The past 29 years, this is basically what I've been doing. I actually started training massage therapy 30 years ago. So it's coming full circle now. Free classroom on the air. I'm on the airways. I do a radio show for Health Breakthroughs radio show. This is sponsored by the Weiner Wellness Center. That's on Monday mornings at 10 a.m. and Friday afternoons at 5 p.m. And they repeat my show sometimes during the week. That's broadcast on these 4 different radio stations. But if you're out of range, you can go to khbradio.com during that time, hit the Listen Live tab, and you can listen live anywhere you get internet access. Also, I'm on Nutritional Frontiers Holistic Truth radio show once a month. It's usually on a Friday morning at 8 in the morning. And once a month or more, I'm on KDKA Radio 1020 on the AM dial and 101.FM Saturday afternoons at 1 p.m. Okay, contact info. If you want to get a hold of me or schedule an appointment with me, call the Weiner Wellness Center, and that's 412-922-9355. FDA disclaimer, folks, I'm not a medical doctor. I don't treat, I don't cure, I don't prevent any disease. This presentation and everything I'm going to talk about, this is for informational purposes only. It's not intended to treat, diagnose, cure, prevent any disease. If you've got any medical problems, you're advised to go see your licensed healthcare practitioner for that. And good luck with that. So a holistic natural therapy, integrating the ancient wisdom of Oriental medicine and modern science. Kinesiology, applied kinesiology. This is what I do. So doing an appointment with me, I'm going to use this applied kinesiology system. This isn't just a way that we can communicate together. Your body is going to communicate with you consciously and me. And we're going to discover how you react to foods. We're going to discover where you have weaknesses, basically a disturbance in the force, blocked energies. We're going to discover what nutrients strengthen all these weak reflexes. And that may help you pinpoint what your body's saying. You know what? I have all this weakness in my body, and these 5 different antifungal remedies help me with that. It strengthens all the weaknesses. Chances are, if you've got a fungus, I can't tell you got a fungus, but for me and no other nutrients, no other immune boosters, strengthen everything that was inside of me, I would take the antifungal stuff. That's basically how it works here. So we don't treat or prevent anything. We aid and assist people in just improving your nutritional status. And through this energy testing, we can discover what's weak. Through this type of energy testing, we can discover what makes those weak reflexes strong. So we're never going to make any claims. So let's get into this. Why are we fatigued? Why are we lethargic? Why are we just struggling with energy? Well, let's look at some statistics first. The number one killer in the United States is heart disease. Almost 660,000 people here die from that. 600,000 die from cancer. All those are way more than just accidents. Then there's chronic respiratory diseases, strokes, Alzheimer's, diabetes, influenza, pneumonia is way down on the list. Heart disease is way, way worse than that. Did you know that out of people that are United States residents, basically, they're 18 to 24, over 70% of them would not qualify to get into the military. They have that many health issues and challenges, 70%. This is a national security risk. Folks, if you're watching this presentation and you're with younger people, really try to start educating them about health, healing, and nutrition. Because they're watching the TV, and the TV says if you have these health problems, you need this drug. And they've had this message in their mind hundreds and hundreds of times. Your body responds to nutrition. You're not drug deficient. You need nutrients for this. This is so grossly overlooked in the whole educational system. When you look at infant mortality, we're 56th on the list of developed countries. You think if we spend more than many other groups of nations combined, we spend more than that on healthcare. We're 56th in infant mortality. It's an abomination. But this is a big money-making deal for the pharmaceutical industry, the healthcare industry. It's not really healthcare industry, it's disease care. And we spend more in healthcare, but we have worse outcomes than just comparable countries. Countries that are similar to us, we spend a lot more than them, and we're terrible in relation to them as far as health outcomes. And on average, we spend more than 2 times the comparable countries. This all is just a statement of what's going on here with our educational system. And thank God for Dr. Weiner, who basically was educating me for 27 years or so. Driving on the roads all the time, I've always listened to Dr. Weiner. And now, thankfully, we're at the Weiner Wellness Center, we're continuing this whole nutritional educational program. Other great companies like Nutritional Frontiers are doing this. Other natural health care providers are still on the radio doing this. And thank God for them and for us that we're getting this information out. If you have neighbors that are having health challenges, have them tune into our radio show. Have them tune into our presentations here during the Wine and Wellness Week sale. Okay. So, U.S. ranks 34th in life expectancy at birth. This is terrible. 34th. Japan's number 1. Let's just move on. We don't need to go into all this stuff. Chronic diseases. This is also a huge moneymaker for the United States. Healthcare companies, pharmaceutical companies. 6 in 10 adults have at least one chronic disease. 4 in 10 adults have at least 2 or more chronic diseases. And if you're the head of a CEO, CEO of a pharmaceutical company, would you want to have all these people to be healthy? Or would you want them to be sick and getting worse so you can make more profit off of this? It's basically the issues we have here in the United States. What about insulin? Insulin resistance. Insulin resistance is huge. We have 5 to 7 times more insulin in our bloodstream than we should have. The average American consumes 152 pounds of sugar a year, the average. Now, there's other people who are eating way more than that because I don't eat 152 pounds of sugar a year. So other people are just having extreme amounts. And this is leading to all these different health challenges. That all can lead to fatigue, not feeling so well, creating fungal overgrowth. And so what in the world is going on? Why are we so fatigued? Why so much lethargy? Why low energy? Well, our food supply is toxic. It's very nutrient poor, and it's loaded with these horrible chemicals called obesogens. I was over in Italy 4 different times, and you don't see any fat people over there. It's shocking. It's like a different country. It is a different country. It's shocking to see, if you ever watched the Soul Train videos from back in the 70s, everybody was real thin, super lean and skinny. That's what Italy was like. I started researching this, and I started noticing, you know what, the European Union and Italy in particular doesn't allow endocrine system disrupting chemicals to be added to their food. They don't allow these obesogens. They don't allow genetically modified foods. Their wheat has 1/5. We have 5 times more gluten in our wheat than they have over there. So food is a big, big problem. Not only is food a problem, our water supply is loaded with chemicals, loaded with fluoride. Drinking tap water is not the best, but when you shower in water that's treated with chlorine, you're breathing that in. Our atmosphere is toxic. Look up in the sky. When's the last time you've seen crystal clear skies, especially in Pittsburgh? But if we had the chance to have crystal clear skies, you'll see within an hour or two, there's crisscrosses of chemtrails everywhere, and all of a sudden it's all clouded over. There's chemicals in those chemtrails, aluminum, barium, who knows what else they're doing in there. Have you seen the snow in Texas? So people gathered up the snow and tried melting it with a lighter, and it didn't melt. It just got black and kind of burned. What are they putting up in the sky? We're breathing that in. That can have an effect on our overall toxicity level, our energy levels. So factories are belching out things. When you follow a car going to work, you're breathing in those car fumes. You probably don't smell it. You smell it when you're following a bus, diesel truck. You're smelling it. You know your windows are up. Those fumes are getting in your car. Well, every car you follow, you're getting those fumes in your car. You're breathing that in. So not only that, the media is very toxic. It programs your mind. Your kids are watching these programs. Think about this. Your kids are watching a commercial hundreds of times in a week's time. They're seeing hundreds of commercials for drugs. And the drug says, if you have this problem, you need this drug, even though it gives you these horrible side effects, you need this drug. Even though it might kill you, might give you psychotic behavior, give you head zaps when you stop taking it, your head will zap, you still need the drug. And this is the message kids are getting. But folks, the media can have a very, very negative effect on the programming of your mind, but also the minds of your children. Really, if you're going to watch television, if you're going to watch commercials, at least scoff and ridicule the drug commercials. we rarely see drug commercials in general because we DVR everything. Anytime I watch a program on TV, I never watch it live. I always watch the DVR and fast forward through the commercials. But sometimes if something is live, and we do see a commercial, we will ridicule the side effects of these things. You know, why would I want to take this when it can kill me? This can add to the toxicity level in your body. It can add to you not feeling so well when you take this stuff. So, not only that, your clothing is washed with toxic chemicals. I test people on clothes. When people come and see me, we ask their body how they respond to foods and drinks and all sorts of things. And I also test clothes. I'll say, grab your shirt. Let me see how your body responds to clothes washed with your laundry detergent. And sometimes that response is very strong. Sometimes that response is abysmally weak. They'll say, what do you use? And they'll say some national brand. And most of the major national brands test terribly. But Dr. Wine used to talk about that on the radio. And I'm thinking, like, how can that bother you, really? Well, everything is an energy, and you're wearing an energy all day long that your body's reacting negatively to. And then you sleep on bedding all night long, washed with the same stuff. I had a client years ago, when you test somebody, they're supposed to be testable. They're supposed to have good energy flow. And her body didn't have good energy flow. And I was trying different things to get her body to balance out. It wasn't working. When I tested her clothes were fine. She had a rash around her midsection for several months and couldn't get rid of the rash. And I said, when I tested her clothes, she had a very good response to that. And it just dawned on me. I said, do you wash your bras with the same thing you wash your clothes with? She goes, oh no, I use this woolite for that. I said, let me see how your body responds to the water detergent you use to wash your bras with. And she was super weak in response. I said, well, take your bra off. She took her bra off, and she instantly was energy testable. That gave her that balance back. So just wearing clothes, covering your whole body all day with this toxic energy may be one of the things that's adding to your fatigue. So when you come to see me, we're going to test all this stuff and see how your body responds to these things. If you're tired, if you're fatigued, lethargic, and low energy, is your laundry detergent part of it? Some people use these natural brands and it doesn't bother them. But many people, this energy is just flat out wrong for them. Okay, so how about that? When you research the foundation of medical schools in this country, you'd be appalled at what you would find. The educational system we have here for the average person, as well as the educational system for medical doctors, in my opinion, is abysmally deficient in what you need to do to be a healthy person. You know, if, one of the guys I used to listen to on the radio all the time said that 90% of all the medical schools in this country don't require their graduating doctors to have a 3-credit class in nutrition, which I found to be just appalling. You know, aren't these the professionals you're supposed to go to see if you have a health condition? When you go there, you're prescribed a drug. And you're not prescribed for the most part vitamin or mineral therapies, things that your body is lacking. You're not drug deficient, you're nutrient deficient. So none of that, you know, our schools don't teach grade schoolers or middle schoolers or high schoolers or even college students about healing with herbs, vitamin and mineral therapies, supplements, energy nutrition, none of this stuff. Your body needs nutrients to function. If you don't have enough nutrients in your system, chances are you're not going to function very well. You can't put regular unleaded gasoline into a top fuel dragster that requires nitromethane. Put nitromethane in that car, man, it goes. You put a lower grade fuel source in it, it doesn't go so well. Your body's the same thing. You can't leave your house in the morning drinking a cup of coffee or eating a bagel and expect that to give you all the nutrients you need for your brain to function at max, and your liver to function at max, and your kidneys to function at max, and your skin to have all its healing properties. You can't expect that. This is what people are asking their body to do, though. They'll be very nutrient poor at breakfast, they'll be very nutrient poor at lunch, they'll be very nutrient poor at dinner, and then all of a sudden they're tired and they're fatigued and they got things going on, or they overeat sugar or whatever. So let's spend some time, come in and spend some time with me and let me do some testing with you and see how your body responds to all these different things. And we can try to figure out, why do you have these issues? Not only all that stuff, but only the stress of daily life, your commitments, your schedules, your jobs, you know, and caring for other people. These people believe it's okay to eat fast food and just don't have time to make meals. You've got to plan your meals. Fast food is fast poison. Fast food is fast toxicity. Fast food is abysmally unhealthy. They are putting obesogens in all fast foods. They're putting chemicals in there that alter your signaling from your stomach to your brain. It happens all the time. And most children and many adults, you know, they're injected. On top of all that, kid comes out of the womb within 2 days, they're injected with all sorts of things. These could be DNA altering vaccines, harmful chemicals, treating for sexually transmitted disease 2 days out of the womb. Where is the sensibility in that? Is your blood-brain barrier fully formed by that? And then for the rest of your life, if you have issues with your DNA because of that vaccine. So the root causes of disease, they're never addressed, really. Toxicity and nutrient deficiency. How toxic is your food, your diet, your lifestyle, your environment? How nutrient deficient or how nutrient sufficient is your food? If you're not drug deficient, you have issues with these other things. So let's delve into that. So are you ready for the solution to all this? So if you're looking for that one magic pill that can make all your health problems go away, you might just want to just stop watching this right now because it won't go well for you there. So it takes more than just that, the magic pill. So if your lifestyle, it's your lifestyle, folks, that brought you to the health challenge that you have. It's your daily habits. You know, it has to do with what you've been eating, has to do with how well you sleep. If you get to bed early enough, is your room dark when you're in bed, or do you have lights going on, or are you playing with your phone right before bed and stimulating your mind? It's going to have an effect on your restorative capacity while you're asleep. While you sleep, your body's supposed to produce growth hormone, supposed to detoxify your body, supposed to rebuild cells. Are you interfering with that process? How toxic is your body? How much toxins have built up in you? Is your capacity to get this stuff out of your system adequate? When people come and see me on the first visit, and I test them on the heavy metals testing kit, quite often they'll fail on 3, 4, 5, 6 different metals on the first visit. And then I test them, and they'll fail on 50, 60 foods, sometimes 70. One person failed on 91 foods. There was a lady, I'm going to see her relatively soon here for another follow-up visit. She fell on 86 foods on the first visit. Just had a very terrible response to all these different things. And then we found out that she had a very strong response from these different supplements that may help you with an overgrowth of fungus in the body. She took that stuff. She took a group of like 90 essential nutrients. She came back 4 weeks later and I tested her again. Instead of failing on 86 foods, she fell on 6. She fell on, I think, 8 metals on the first visit. She fell on none on the second visit. She fell on 12 different weak reflexes on her body, and none of those were weak on the follow-up visit. 4 weeks' time. And what changed? She changed her lifestyle. She changed the way she daily ate. She prepared her meals in advance. She stopped eating toxic things. And she was always on the road, and on the road is not a good place to try to find food anymore, especially because of the salad bars all shut down. So it takes a little bit of time to plan your meals in advance, but her overall toxicity level, because she wasn't eating foods outside of her house anymore, prepared outside of her house, toxicity level of her food went down. So in addition to that, do you have problems with your teeth? If you have root canals, do you have infected crowns, do you have mercury fillings? Those are problems for the body. If you have a mercury filling in your molar down here, you're probably blocking your own energy flow and rebuilding of your body because of that mercury there. It's affecting your lungs and your large intestine from that one too. How many other teeth have problems in it? It's affecting different organs. Let's test you and ask your body how you respond to these teeth. And how nutrient dense and how non-toxic are all of your meals? Some people eat 3 or 4 days eat pretty good, and then one day they eat a bunch of junk. This isn't good. We're mind, body, and soul. So how toxic are your relationships? How toxic is your own self-thought? What do you say to yourself? And do you exercise? How much exercise do you get, if any, and how intensive is it? Do you do high-intensity interval training? If you get some type of movement to help train your body. Do you have an overgrowth of fungus, parasites, bacteria, viruses? These are things that all this stuff can add to fatigue, lethargy, low energy. So come in and spend some time with me, and let's delve into this and see what we can do to get you on the right path to help you with this. So how do you know what's adding to your health challenges? How do you know if a food, heavy metal, toxic chemicals, environmental factors? How do you know if your pets are bothering you? How do you know if any of this stuff is causing you problems? Well, let's do some energy testing with you. Let's apply kinesiology testing, muscle testing. Let's see what your body says. Your body's going to tell us answers. We're going to ask it all these questions. Your body's going to give us its answers. Here's a general process I use when people come to see me. If you want to maybe possibly improve your overall health, stop putting inflammatory stuff in your body. There's reflexes on your body that may tell us or lead to that you may have too much bacteria in your system, or fungus, or parasites, or virus, or even allergies. Let's ask your body where it's weak and help deal with this. Take out and let's talk about let's test your root canals, mercury fillings, infected crown teeth. Let's test that. You want to bring in 90 different nutrients and special formulas. You wouldn't be able to digest all that. You want to eliminate toxic stuff in your body. You want to improve your energy flow through scars. How many, like 1.2 million women a year have a C-section? Well, they don't realize, the doctors don't tell them that that's probably probably blocking voltage to like 6 different organs in your body and your circulation and sex energy breathing on top of all that. So what do you do about that? Let's talk about that. You got to be able to move your body, help straighten the lymphatic system, has many other advantages to moving your body and exercise. Use the power of your mind, folks. The power of your mind is immensely powerful. Start using it. Do some relaxation, do some meditation, do some visual imaging. Visualize yourself getting better, getting well. Because you have to believe. Always hold that in the back of your mind. Your body can heal. Your body can fix itself. Your body can overcome. No matter what your health challenges are, put that energy out there. Your body can overcome. So let's talk about these a little bit more in depth now. So you want to avoid things that act like poisons in your body. Your processed foods, chemicals, environmental factors, these things can create inflammation in your body. And you don't get something for nothing. If you have inflammation, it costs you energy and nutrients to create that inflammatory response and immune response. And all that inflammation damages your cells. When you have damaged cells, in the walls of all your cells are cholesterols. And your liver is going to produce the right amount of cholesterol to make new cells. Cholesterol could be a response to the amount of inflammation in your body, the amount of damage that's going on, the amount of repair that needs to happen. If your body needs to build new cells, your liver is going to produce the right amount of cholesterol to repair itself, to rebuild itself. Coming up with a number said, oh, you should be below 200. Above that, you're going to die. I would listen to cardiothoracic surgeons that wrote books on how to reverse heart disease and restore your health. But listen to what they say about cholesterol more than someone that's selling a drug for profit. Okay, 12 bad foods. So you want to find out what foods you really want to stay away from. But if you just go to YouTube and look up 12 bad foods, this is a good start. The first 4 in his list of 12 bad foods is wheat, barley, rye, and oats. When I test people on this stuff, these guys say that over 90% of the population doesn't produce enough digestive juices to break it down and blocks your absorption of nutrients. It's around 95% of the people I test fail on it. And when people return in 4 weeks, they fell on 60 different foods. When they return in 4 weeks, after changing their lifestyle and nutrition and so forth, I test them again, they usually fell on like 6 different things. And one of the things they always fail in those 6. 95% of people fell on it on the first visit, and around 94.8% of the people fell on the second visit. They still have a negative response to this stuff. And I believe it's what he says. You can't break it down. It coats your intestines, and it blocks your absorption of nutrients, and then you're in trouble. Okay. So put on immune system fires. There's reflexes on your body, and Dr. Dick Personal will teach what these different immune reflexes are. And if there's weaknesses there, you can find out what nutrients strengthen those weak responses. You can look to see if this one particular reflex is weak, maybe you have too much parasites in your system. Your body will tell us when you have a challenge to your immune system here or there. Or is it just allergies? You've got to help deal with this in the first, when people come to see me, we help deal with this stuff. Identify if you have a strong response to anti-parasite formulas. If you have a strong response to other immune boosting formulas, your body will communicate with us and it'll tell us. So you find out what's weak, you find out what different immune boosting formulas strengthen those weak reflexes. And then you find out which particular probiotic formula strengthens those weak reflexes. I have 8 different probiotic formulas on there, on my wall in my testing room, and people test on one of those. One strengthens all the weak reflexes. You may test well, or we ask the question like, overall, let me see how your body responds to this. Yes. Does it strengthen your descending large intestinal reflex? No. You have another probiotic. Let me see how your body responds to this. Nice and strong. Overall, let me see how your descending large intestinal reflex responds to this. No. So we go through this process of elimination, and we find the one that strengthens that descending large intestinal weak reflex. That's basically what I do when you come to see me. We'll help you pinpoint what your body says. These 3, they're okay body-wise, Only this particular one strengthened that weakness there. For me, that would be the one I take. I can't tell you that this will cure you. I never use those words. I'll show you what's weak. I'll show you what makes it strong. So then we look at teeth. I test on the teeth. And in a root canal, within 3 months of having a root canal, like 40% of the tubules in that root canal can already be infected with bacteria and or fungus. And they produce these nasty toxins called gliotoxins and thioethers. They say these are worse than like U.S. weapons grade biotoxins. So what do you do about that? Well, I can show you which tooth is weak, but then I'll refer you to a biological dentist who's also a naturopathic doctor, and let them check you out and let them advise you on what to do. I can help you, see what's going on in your mouth, get some awareness in you that this is an issue. People say, I've had this root canal, I had these two root canals being for 41 years. For 41 years, most likely, I blocked the energy flow to my kidney and bladder from these two teeth. I was probably putting bacteria and or fungus in my body every day of my life. And I put these toxins in my body every day of my life from having these two root canals. And I have since had those taken out. So you want to assess the voltage with the teeth to figure out if it's strong or not. If it is weakness, I'll mark it down. I'll show you what organ system that corresponds to. Here's the chart. Like I said earlier, if you have problems with these teeth, with root canals, mercury fillings, whatever, you're going to end up blocking voltage to your lungs and large intestine. I was blocking voltage to my kidney and bladder for 41 years with these two teeth. So it depends where it is in your mouth. Your canine teeth, those are on the liver and gallbladder. The upper molars, stomach and spleen on this side, over this side, pancreas and stomach. Interfering with the way your energy force, your life force, your chi flows to these organs. Okay, so you got to take in all the nutrients that your body needs to produce all the chemical reactions that it's supposed to make. 16 vitamins, 12 amino acids, 2 essential fatty acids, 60 different minerals. These and cannabinoids. I put the 60 minerals in there. The 60 minerals are supposed to be additives. That adds up to 91. This isn't something that I, conjured up in my garage 2 weeks ago. A huge research study was done from 1971 to 1983 where they discovered this. They did over 20,000 autopsies on animals and humans, 450 different further animal species. They found our body cannot make these things, but requires it to function at max. You can't put a lid of gas into a nitromethane requiring calcium dioxide. You can't run out the door eating a bagel and expect to be healthy. Maybe having a piece of pizza for lunch. But coming home and having a big pile of cold pasta. You're missing out on many different nutrients that your body needs to function. And maybe that's part of why you're tired, fatigued, or lethargic. The body just doesn't have the fuel it needs to run. Let's go. So not only do you have to put that in your body, you got to be able to digest it, break it down. If you don't break down food properly, I'm talking about like good things for you, like cabbage, peppers, onions, mangoes, cherries, tomatoes. If you don't break down food properly, and these larger protein molecules get in your bloodstream, your thymus gland, which there's the thymus gland, your thymus gland senses this stuff. It's always looking for these proteins. When it sees these proteins that shouldn't be there, you're going to waste energy and nutrition creating an immune response and an inflammatory response. And then when you inflame the body, you're also damaging cells, which in turn you waste even more energy replacing those cells. So people are asking, like, why am I tired? Why am I fatigued? Why am I lethargic? Let's look at the whole body as a whole. And if we can improve your digestion, maybe that's going to help reduce this inflammation. So there's 16 different digestive formulas I have in my wall, in my testing room, in my office. And I'll ask your body which one of those 16 is the best for you. Your body will tell us. I can't tell you what's best for you. Your body will say, I have the greatest response to these 3 out of the 16, and out of these 3, this one in particular is better than the other 2. Your body will tell us this. This is the testing that I do. So call the Wine and Wellness Center at 412-922-9355. Set an appointment with me. Let's see if we can go through this stuff. So there's your thymus again. So there's reflex points on your body that could allude to you may need some support with either digestive enzymes or stomach acids or gallbladder supports. Your body will tell us, which one. And then on my wall 16, there may be 5 different ones that are just enzymes and stomach acids. Other ones that have gallbladder support with it. Your body will tell us which is the best one for you. And then in addition to that, if you're too acidic, that can create a great breeding ground for all kinds of problems. And all diseases, it can flourish. A lot of diseases can flourish in an acidic environment. So the more you nutrify your body, the better chances of overcoming any of your health challenges. In the basis of Dr. Max Gerson, his granddaughter Charlotte Gerson was friends with Dr. Weiner. And in the 40s, Dr. Gerson would put people on juice fasting, drinking a whole bunch of freshly made organic vegetable juices, doing a lot of detoxification, and help people really overcome a lot of the challenges that they had in their body. And the basic premise of that is nutrient density, detoxification. This is what he did, and people responded very favorably to his program. So I just noticed it said nutrifying. I should say nutrifying. Okay, so in addition to that, we live in a toxic society. If you lived here in the United States area in the year 1200, what kind of toxins were you exposed to back then? Maybe some fire smoke? We had crystal clear air, crystal clear water. We didn't have any pollution. Now we're getting chemically deluged from all these different sources. And this stuff can bind to the walls of your cells. You have an immune system that will handle a lot of this stuff. But some of these things can bind to the walls of your cells. Your body doesn't want this to happen. It'll try to capture it, try to dilute it with water, store it in your fat cells. You got to think like, how toxic is the food you're eating? Well, what is that animal being fed? Is that animal being fed a bunch of steroids, antibiotics, insulin growth-like factors, platelet inhibiting factors, all these different chemicals in the feed? In the feed are the kinds of pesticides and herbicides and fungicides and algicides in the feed for that animal. So if they can't purge those toxins and it stores in their fat cells and you eat that fat, you can get those toxins in your body. So the more you eat organically fed animals, grass-fed animals, organically raised, you may have a much less chance of getting all these toxins in your body. So back then, everything was wild organic. When you had some meat back in that day, you didn't have any of these steroids and all these things that are injecting in animals now. That's having an effect on our body. So what we do is that there's heavy metals testing kits I have in the office. We can see if you have a problem with heavy metals. And if so, there are detoxifying nutrients. Say you're weak on aluminum, you're weak on cadmium, weak on mercury, weak on manganese, weak on nickel. So I'll have you hold those 5 things and let me see how you respond to these 5 things. And muscle test, energy test are super weak. Then I'll have you hold protein greens. Does that strengthen your response? Yes. I'll have you hold Nutella Clear. Does that strengthen your response? No. I'll have you hold Project Cleanse. Does that strengthen your response? Yes. So we'll ask your body what strengthens these weak responses. Say we find 2 or 3 things that you do well with. I said, well, let me see how you respond to these 3 things. And said, no. Let me see how you respond to these 2 things. No. Is this one better than that one? Yes. Your body will tell us. Your body will communicate with us what it says you have the strongest reaction to. And then if there were many, that's what I would take. I can't tell you that these protein greens will detoxify these heavy metals. But I can show you have a really weak response to these metals, and these greens strengthen. Let's ask your body to tell us the answers that we're looking for, and that may in turn help you with fatigue, with lethargy, with low energy. Get this stuff out of your system. If you are having an inflammatory response to this stuff, you're wasting energy and nutrition fighting that stuff. So what if you didn't have to waste that energy and nutrition? That's the premise of what we're talking about here. So then if you have a scar, you've had some kind of surgery, had some kind of injury, you had C-section, where 1.2 million women a year get a C-section. Underneath your skin, on your fascia is where your body sends electrical signals. And if you have say you have a cut across your forearm right here, you have a cut there, right through there is a large intestine energy meridian. You could possibly be reducing your own energy flow to your large intestine because of that cut right there. We can ask your body, we can test that and say, let me see how your body, let me see how that energy flows to that scar, and say it is weak. And then, okay, well, what could possibly strengthen those weak reflexes? We'll test you on frankincense, strong. Test you on lemon grass, no. Test you on essential oil of lemon, yes. And we'll ask your body what essential oil strengthens the weakness there. And I can't tell you that this will improve the energy flow through there, definitely, but this is the system. Chances are this may help you reconnect that short circuiting that's been happening there because of the scar. When they do a C-section on a woman, if they cut from one side to the other side, right in the center of your body is the circulation and sex energy meridian. We're cutting that. Right on the other side of that's a kidney meridian. We're cutting that. Right beside that is the stomach meridian. We're cutting those. On the other side of those is the liver and the spleen meridians. We're cutting that too. So if you're having challenges with energy, have you had surgery? Have you had scars? Come in and let's test all these things and ask your body what's weak. Ask your body what strength is it. So here we go talking about C-section. They make a lot of money doing this. The average childbirth costs around $20,000. C-section, we're going to make around $25,000. So the number of vaginal deliveries every year is 2.58 million. Number of C-sections is 1.21 million almost. Well, almost 32% of all baby deliveries are C-section. And pretty much all of those probably have decreased energy flow, decreased voltage, decreased chi, decreased life force energy because of that C-section. Well, let's find out which particular essential oil may strengthen that weakness down there. Okay. So essential oils, here we go. When you put essential oils on your body, they may be too strong. You may want to cut that with a carrier oil like coconut oil. And this, you put it on the scars and on the bottom of your feet and on your hands are reflexes. If you superimpose your body, per se, on your feet or your hands, up the left side of my body is the large intestine, ascending side of your large intestine, the transverse part of my large intestine. On your hand and on your foot, the outside is where the large intestine would be, across the middle, and down. And if you had a decreased, you have a scar across the large intestine and your meridian, put that essential oil on that path. That may put more energy or voltage into that organ system. Likewise, across to where it's cut. Okay. Now, exercising, when you move your body, this can have profoundly huge benefits in helping you with your energy levels, with hormone production, with regeneration of your tissues, give you more daily drive to attack the day and attack the world and reduce depression, reduce anxiety. It's possible. Drain your lymphatic system. Whenever you move, it helps you drain your lymphatic system. Toxins are dumped into your lymphatic system. If they're stagnant and not moving, it's not a good thing. So exercise can help you with that. How many people say, you're like, I don't have time to exercise. Hey, did you see the news last night? You're like, yeah. Well, what if you exercise, got on an exercise bike for 10 minutes while you're watching the news? You can do two things at one time. And many people don't realize the incredible benefits of exercise. Your body will always respond to stress. And so if you stress the body's going to want to be able to handle that stress more easily. If I go and do some 300-pound shoulder shrugs, I'm going to tear down a lot of muscle and tissue up in my shoulders, but my body's going to rebuild it stronger so the next time I do it, it doesn't stress me as much. I'm going to build a better cardiovascular system, pumping energy and nutrients to that area. What if you did that over your whole body? Be able to pump energy and nutrients through your whole body more efficiently with exercise. So you got to move, and whatever your level you're at, if you're in a wheelchair, what about pumping your arms? If you're in a wheelchair, grab some books, do something to get that heart rate up, get your body moving. So the more load-bearing exercise you do, the more it stresses your bones. Your bones are going to respond to that stress. If you have osteoporosis, osteopenia, the doctor says it's okay, start exercising. I had a problem with my one knee for a while, and for years actually. And the nutrition really helped a lot, but certain things I did irritated that knee. When I started doing leg extensions, that helped my knee a little bit. When I started doing leg presses, it helped my knee a little bit. When I did the leg curls, where the bar is behind your Achilles tendon there and you're pulling backwards, contracting the back of your thigh, when I did those exercises, it helped my knee the most. So your body's going to respond to stress. And this can be a very healing, restorative thing and help you overall with your energy levels, with many different facets of your body. So, you've got a powerful mind. Your mind can make or break you. Decide to have it make you. Get active mentally. Get moving mentally. Sit in a room, a dark room, shut off all the lights, and just feel bliss. It's going to have tremendously beneficial effects on your body. Feel the feelings of gratitude. Just sit in a room and be grateful. We live in a country where we don't have to live on dirt floors. We don't have to have bugs crawling on us. We don't have to kill an animal every day for food or dig up something from the dirt to find something to eat or eat bugs. We're blessed. Feel the gratitude of that blessing. This can have a profound effect on overall your health and nutrition and healing and energy levels as well. And then emotions can also make or break you. If you fear something, fear you will react negatively to a stimulus can actually make you react negatively to it if you just fear it. So things like hypnosis, acupuncture, allergy reversal treatments, these may help you with those emotions as well. So energy testing for stored emotions. I have 2 kits in my office that have 150 different testing files in there. And these have the energies of all these different emotions that printed on it. We can ask your body which ones you have a problem with, if any. If you do have a problem with them, we'll ask your body, would it benefit you to do an allergy reversal treatment for this? And this has helped. Quite a few people have done this one. Folks, the one thing is, you have to believe that you can be better. Your body can heal itself. Your body is designed to heal itself. You have to believe your body is designed to heal itself. And if you're not healing it, maybe somebody, somewhere, somehow can lead you to help you heal yourself. You gotta always leave open that possibility. No matter what your health challenges are, you can reverse this. It can get better. This is what I'm here to do. This is what I've done for many, many people, and chances are I can help you too. These health challenges that you have, that doesn't have to be a life sentence. With proper nutrition, diet, voltage, mental attitude, you can rebuild, you can detoxify, you can strengthen, you can fortify, you can protect your health, you can possibly reverse many, many chronic health conditions. It takes some effort. It starts with, if you're stagnant, all stagnation responds to activity. Get active mentally, get active physically, get changing this stuff, and your life could change. So with that, Tracy, we are out of time. I'm out of slides. And is there any
Hey, Jeff, that was excellent. Thank you so much. Great lecture, great information. I loved it. So now I know why I'm so tired.
Where are you at? Let me see.
So guys, we're going to wrap up Jeff's lecture. If you want to make an appointment with him, you can call the Weiner Wellness Center. He is available for virtual or in-person consultations. Stop into the Weiner Wellness Center today, get your products, talk to everybody there. They are open, so you're welcome to go in. And up next, we have Joe Messino. He's going to be talking about who is Q, the forgotten king of nutrients. This ought to be interesting. I can't wait. So, Jeff, thanks again for joining us, guys. Stay tuned. We'll be back in about 10 minutes. Okay, welcome back, everybody. Thanks for staying with us. We have our final presentation for the day. I'm very excited for this one. Our very own Joe Messino, godfather of nutrition, manager at the Weiner Wellness Center, is going to be presenting for us today. And Joe, your topic is Who is Q, the Forgotten King of Nutrients? Interesting play on words. I'm excited to hear this.
You know, you got, like I said on Saturday, you got to have a little fun with these, you know, but Q was a big turn. You know, that letter was so popular over the last year or two that I thought maybe that would get a little attention, but it is actually just a play on letters, maybe not words, because, you know, Q is a big part of the nutrients for life. Tracy, the forgotten king of nutrients. The only reason I say that is because, you know, we've been concentrating so much lately on D3 and on zinc and on vitamin C. Sure, all necessary, all things that we need for our immune system right now. And other things too that we talk about on a regular basis, like DMG, our favorite, right? But there is one nutrient that, you know, has been called everything from, I mean, it's the spark of life when you think about it, because our cells require it. Every single one of those trillions of cells requires this nutrient, or it dies, or it prematurely, or it goes into senescence. So it is that important. So without any further ado,
I'm excited. Have fun.
It's CoQ10, yes, hey, look, we've known about CoQ10. CoQ10, coenzyme Q10, has been one of my favorite nutrients for as long as I can remember, that I've been in this industry. It was always one of my core 4 products, and it still is to this day. And the reason is very simple. It's like it says, it's the lifeblood of our cells. There's so many things that CoQ10 does in our body, and what we do to destroy it is unbelievable. But trust me when I tell you that every single adult in this country needs to be on a CoQ10 supplement, some more than others. And we'll get into dosing later on in the presentation and how it's affected in the body. But let's just, for example, this is the way you have to approach it. CoQ10 equals life. Every cell has it. If it's not in the cell dies. Okay, so CoQ10, coenzyme Q10, equates to life. We have trillions of cells in our body. Every single one of them has to have CoQ10 to live. Now, there's higher concentration and higher serum levels in some parts of the body than in the other. And we'll go through that. But that doesn't mean that every single cell in your body doesn't require it, because it does. Now, cellular energy is a term we use a lot in this industry. You can't have it without CoQ10. And how do you think of cellular energy? You think of it as the opposite to stimulant energy, to a quick fix, right? Stimulants come in all kinds of shapes, sizes, and forms. But this is far from it. This isn't a stimulant. This is cellular energy. And here's the biggest takeaway from that. You could take CoQ10 at night. At night, you could take it and go to bed. There is no bad time to take it, because it's not going to keep you awake. It's not going to stimulate you not to be able to sleep. It's cellular energy that works at that microscopic level to power systems within the body. These are systems that you require while you're sleeping as well. And we're going to get into some delivery methods and different types of CoQ10, you know, and which ones that you can use for different reasons. But just trust me when I tell you that it doesn't matter what part of the day you take CoQ10, just take it. You require cellular energy 24 hours a day, 7 days a week. So there's no bad time to take CoQ10. Now, here's a phrase, the super antioxidants. This was coined years ago, because there is a group, there's this network, this special network of antioxidants that CoQ10 happens to be a part of. And the reason it's so special, and the reason it's so important, is because if you think about what an antioxidant does at its core, right, it stops the progression, the chain reaction of destruction at the cellular level, free radical damage. All right, we've talked about it for years. We know it's one of the most accepted theories of aging, and that is excessive free radical damage at the cellular level. So what an antioxidant does, real quick 101 here on antioxidants. When that destructive chain of events starts to happen, a free radical is a molecule that takes an electron from another one because it's been damaged, so it wants to be whole again. So it goes and steals one from another cell. Well, now that cell is damaged and a free radical. How do you stop that chain of events? These 5 antioxidants that I'll tell you about do that, because they're able to donate that electron without becoming a free radical themselves. That's important information that you need to have and know why you need these 5 super antioxidants. CoQ10 happens to be one of them. Dr. Stephen Sinatra got to be the world's foremost functional medicine cardiologist. I've attended his lectures for years. He's written several books. One is always on my desk. Okay, that's this one, the Sinatra Solution. You can see all my tabs and all my notes, and it's all, you know, I'm not the resident expert on CoQ10, but I go to the experts on CoQ10 and heart health and antioxidant therapy. Dr. Stephen Sinatra is one of them. The Sinatra Solution has always had at its core, for heart health, mandatory coenzyme Q10, D-ribose, and L-carnitine. Those were his 3 core nutrients, and they still are. He's the one that calls CoQ10 the spark of life. That's how important it is. And it's also the anchor nutrient in another famous functional medicine practitioner, and that's Dr. David Perlmutter. Now let's go to a different organ with Dr. Perlmutter. With Dr. Perlmutter, he is a neurological specialist. And many years ago, he came up with a protocol for Parkinson's. At the core of that protocol is coenzyme Q10. So let's think about that. At the core of the foremost cardiologist in the country, at his protocol for heart health, is CoQ10. And one of the foremost neurologic MDs in the country, at the core of his protocol for Parkinson's and other neurological diseases, it's CoQ10, the brain and the heart. They just happen to be 2 of the organs with the highest serum levels of CoQ10. The lungs and the liver are close behind. So look at those 4 organs, and do you think that those organs are being stressed right now? I mean, they were stressed before Myron. Now they're stressed again, and even more so. The lungs, the liver, the heart, and the brain. CoQ10 is the key nutrient for those organs. It's a key nutrient for every cell in your body. But if you had to get somewhere, if you had to get specific with it, I don't think you can get much more specific than that. So let's give you a little history about CoQ10. Way back in 1957, they discovered it while they were dissecting cow hearts, looking for metabolic pathways, cardiovascular health, and they were using the hearts of cows. And it's a really unique story because the physician that originally was doing the work on cow hearts, they were looking at different things. They didn't know what CoQ10 was at the time, 1957. But they had a cow heart in the refrigerator, and they noticed that it had this yellow substance around it. And isn't that really unique? Because most CoQ10 you associate with the color yellow, okay? Because it is. It's yellow in the body as well, especially around the heart. But they discovered it back then. Now, what is a coenzyme? It's a vitamin-like substance. What does that mean? That means that it's a signaling agent in the body. It's a messenger, like enzymes, like hormones. Okay, it's a signaling agent, and it contributes to chemical reactions. All coenzymes do. Coenzyme Q10 contributes to one very specific chemical reaction, and that's energy. Energy, cellular energy. Can't say it any better than that. Then in 1972, they found the first correlation between a CoQ10 deficiency and heart disease of all kinds. That study went on and on. They were looking at it even more until 1978. Look at this. Part of the Nobel Prize for Medicine went to this cellular process, cellular energy with CoQ10 at the core. I mean, there's been some really exciting scientific discoveries that have been marked by Nobel Prize winning physicians like Otto Warburg, like Dr. Ignaro that I told you about on Saturday, and his work with nitric oxide. And now we know CoQ10 was involved in this as well. Now here is a clinical pearl for you folks, okay? I told you that in 1978, right? Part of the cellular power process was awarded a Nobel Prize with CoQ10 at the core. Now, in 1979, the patent for Novastatin, the first cholesterol-lowering statin drug, went on the books. If you go to the U.S. government patent website, and I've done this, and you look up Novastatin and look at the history, you'll see the original patent that was filed had as one of its ingredients, can you guess? Yeah, CoQ10. Imagine that. They knew then how important CoQ10 was, and they knew that the drug would deplete it. We know that now. We know that it depletes CoQ10. All statin drugs do. Why? Because in that chemical pathway in your liver, where your body manufactures cholesterol, a vital nutrient, because your body doesn't do anything wrong, right, Tracy? It manufactures cholesterol, this vital hormone. Without this hormone, cholesterol, you can't make vitamin D3 and you can't make testosterone. Does that cover two of the biggest issues we're faced with in this country? Sure does. And they all go together. Novastatin, first patent for a statin drug, included cholesterol. They knew then. Of course, it never came to pass. When the drug was finally released to market, there was no CoQ10 in that drug. So, what does that lead you to believe? Now, this is one of those things, like I said, it's always been one of my core 4 nutrients. CoQ10 has always been. You need it every day. Do you need energy every day? Yeah. Do you need it when you sleep? Of course you do. Do you need energy when you're awake? Of course you do. Your vital organs never stop, so they constantly require energy at the cellular level. We have to stop thinking about energy as and stimulant. We got to take those words, and they shouldn't be the same. Energy is one thing, a stimulant is another. They're completely diametrically opposed. But what you need on a regular basis every single day is cellular energy. Highest serum levels, as we said earlier, are in the heart, the brain, the liver, and the lungs. Folks, who's affected by myelin out there? Who? Yeah, people with cardiovascular issues, people with respiratory issues, okay, with COPD, liver issues, type 2 diabetes, that's a liver issue. Our lungs, the brain, come on. Everybody is. And that's where the highest levels of CoQ10 in your body can be found. Don't neglect that. Dr. Carl Folkers was one of the original physicians early in the 70s that was responsible for uncovering how vital CoQ10 is as a nutrient for us. His quote, "Every life function requires biochemical energy, and CoQ10 is a major mechanism in that process. It's essential for life. I mean, we could stop there and not have to say another thing to emphasize the point that CoQ10 should be taken every day by every adult in this country. It's essential for life. So why are we deficient? Well, we know the first reason, statin drugs. Now, let me make sure you understand. We are deficient. This is one of those nutrients that is endogenous. We make it in our body. And of the 5 super antioxidants, of which CoQ10, vitamin C, vitamin E, alpha lipoic acid, and glutathione are, those are the 5. 2 of them we absolutely have to get from food, vitamin C and vitamin E. But we do make CoQ10, and we do make glutathione, and we do make alpha lipoic acid. We do synthesize it from other nutrients. But it's depleted for multiple reasons. Statins are, of course, at the top of the list. And we told you why already. But it still amazes me how many people are on statin drugs to this day. It's still one of the top selling, top producing drugs in the country. And we wonder why we have testosterone issues. And we wonder why we have D3 in the basement. Everybody that gets their blood levels tested, right? Because cholesterol is vital to the production of those nutrients. And you're stopping it right at the source. Can you get it from your diet, CoQ10? Well, look, you could. It's in some foods. But I think I remember reading that you'd have to eat about 3 or 4 pounds of peanuts if you wanted to get a therapeutic amount of CoQ10. You'd have to be eating organ meat every single day. And nobody's doing that. Okay, but one of the biggest reasons you don't want to get it from your diet is because it requires other factors, cofactors, to be processed and synthesized and developed. And those are tyrosine, you've got B vitamins, B2, B3, B6, you need folic acid. Of course, we know the problem with that over the years with folic acid and folate and tetrahydrofolate, methyl tetrahydrofolate. B12, you need C, you need pantothenic acid. Now, in other words, what I'm trying to say is you would have to eat a perfect diet to be able to get the nutrients, the cofactor nutrients to help your body produce CoQ10. Not going to happen. CoQ10 has to be taken in supplement form. And as I said, the highest food source is organ meats. Now that's interesting to me because I do a workshop called the Divine Protocol. And it's basically, the Divine Protocol was the diet that the Israelites had to consume to get through the desert. And everybody tries to guess what that is, and they always get it wrong, but it was organ meats. Because of the high concentration of the fat-soluble vitamins and nutrients that you require for life. You know what those were? In addition to CoQ10, there are, of course, some omegas, but vitamin D3, vitamin A, vitamin E, and vitamin K. All in organ meats. Of course, those animals were grazing on grass, so those nutrients were readily available. Not with what we have today. So no, you're not going to get it from your diet. Exhaustive and prolonged exercise will deplete your body of coenzyme Q10. Now, some might say they don't understand that because I thought it was an energy producer. It is. It's a cellular energy producer, yes. But exhaustive, prolonged, extreme exercise, your body can't keep up with the production. No way, no how. So it's going to deplete it even more. And we have a lot of that kind of exercise going on today, don't we? Right? With extreme exercise and people on treadmills for an hour and, doing these CrossFit things. Forget about it. If they're not supplementing with CoQ10, there's going to be an extreme deficiency take place. This is another cause of CoQ10 deficiency that most people don't really know or talk about. An overactive thyroid accelerates your metabolism and uses up your stores of CoQ10. So if you are suffering from an overactive thyroid, you're going to need to supplement with more than what would be a normal daily dose of CoQ10. And then there's the aging factor, okay, all by itself, the aging factor, of course. Look, it's an antioxidant. Free radical damage is one of the main causes of aging, premature aging especially. So that aging factor is a contributing factor to CoQ10 deficiency. Now here's that super group I was telling you about, okay? The 5 super antioxidants. And their dynamic is so unique because they in and of themselves have the ability to stop in its tracks free radical damage. If you have all 5 in your body, you're going to do great. Okay, you can't just rely on vitamin E or vitamin C, because free radical damage is coming at us from so many different angles these days. You know, how do you accelerate damage at the cellular level? Well, you do it with chemicals, right? Stress, chemical stress, physical stress, emotional stress. Every type of stress available is going to accelerate free radical damage. The one that's going to cause the most damage at the cellular level when it comes to these nutrients is both physical and chemical. And that's in the foods you eat, in the additives that are in those foods. That's all free radical damage being caused by what you ingest. So CoQ10, vitamin C, vitamin E, alpha lipoic acid, and of course our body's own natural master antioxidant, glutathione. Now, alpha lipoic acid in this group has the unique distinction of being both fat and water soluble, one of the few that is. And I learned a few years ago that there's a new member to that group, and that's astaxanthin. So those are both fat and water soluble. Everything else is one or the other. Okay? Vitamin E is fat soluble. CoQ10 is fat soluble. Vitamin C is water soluble. Alpha lipoic is both. Now, this is one of those moments, okay? I'm going to leave this on the screen because, you know, if you've seen any of my workshops, you'll know that I have a tendency to scream at commercials when they're being completely idiotic and stupid and misleading people. And, you know, I call it an moment. Well, here's an moment when it comes to CoQ10 and cholesterol, because of the 5 antioxidants, guess which one blocks oxidative damage of LDL, which is the low density lipoprotein. Now you have, let me back up a second. Let's ask this question. How many types of cholesterol are there? Most people will answer 2, the good and the bad. So, you know, we go back, I would refer back to Dr. Tracy and say, can our body make something that's bad? She's going to say, no, Joe, your body doesn't do anything wrong. So it doesn't make a bad cholesterol. Let's get that out of our heads. There isn't 2 types of cholesterol. There's one. There's one cholesterol molecule. It is transported from your liver on a low density lipoprotein. It's transported back to the liver to be excreted on a high density lipoprotein, LDL, HDL. In either one of those, low density lipoprotein, is the word cholesterol in there anywhere? No, not in the other one either. They're transport mechanisms for the cholesterol molecule. However, that low density lipoprotein can oxidize. That's why it gets that, you know, moniker of the bad cholesterol. It will oxidize more readily than HDL will. CoQ10 is the nutrient that prevents that oxidation from happening if you have ample stores of CoQ10 in your body. Reason after reason after reason. Moment. And wait a minute. But look at this. The antioxidant that stops oxidation of LDL, low density lipoprotein. And that's when it becomes oxidized, it forms plaque and it builds up and your serum levels go up and they want you on more drugs. They're going to put you on a drug that's going to destroy the nutrient that prevents this oxidation from happening. That's an Let's calm down. And I have my blue light blockers on. I had them on Saturday, but I had the clear ones. And Mikey G said, Joe, well, you didn't wear the cool ones. Why didn't you wear the cool blue light blockers? So today, G, I have the cool blue light blockers on. So the spark of life, Dr. Stephen Snodgrass. I wanted to put a couple of his quotes on here because I know you're not all going to go out and read his books. So let me pull out some of the best. Here's what he said. As a cardiologist, I believe that the discovery of CoQ10 is one of the greatest medical advances of the 20th century for treatment of heart disease. How about that? One of the greatest medical advances. But how often do you hear about it? I mean, do cardiologists today? No. Yeah, they're coming around, some of them. But I would, if a cardiologist prescribes a statin drug without prescribing CoQ10, then to me, then they're doing more damage than good, and that I could consider that malpractice. Here's another quote from Dr. Sinatra. Despite the more than 30,000 citations and studies done, they're all available in the age of information. It's all there on the internet. But look at this. In spite of that, and the large body of scientific evidence, clinical information, and therapeutic descriptions in textbooks, CoQ10 is still widely ignored by the majority of clinical cardiologists in this country. That goes to support the statement I just made that they're still giving out statins like candy, but they're not including CoQ10 with it. And we'll get to dosages in a minute. I want to talk a little bit now about the brain and Dr. Perlmutter's work in the Parkinson's protocol. And we've highlighted his protocol many times here at the Weiner Wellness Center on multiple workshops, to the point where, you know, this protocol is now, God, it's got to be 15 to 20 years old, probably 20 years old by now. But at the heart of that protocol is coenzyme Q10. It is at the center. It's the anchor of the protocol. And we've had people, I had a family member, we even brought my Aunt Mary Pat up on stage at one of the workshops to talk about the benefit that she's experienced with CoQ10 and her Parkinson's disease. But effects of CoQ10 in early Parkinson's disease, they've shown evidence of slowing the functional decline. Can you cure it? No. Can you stop it? No. Can you slow it down? They're seeing that over and over and over. And at the heart of that is the 1,200 milligrams daily of CoQ10. It's safe. Folks, it's completely safe. Is it fat soluble? Yeah. So what? So what? It's the spark of life. It's essential for life. It's safe at high levels. If you're suffering from Parkinson's or any neurological disorder, the minimum amount is 1,200 milligrams daily. Now, we took Dr. Perlmutter's protocol that included high doses of omega-3s as well. I mean, we're talking 4 to 6 grams of EPA-DHA. He also had glutathione is one of the core nutrients. However, it was recommended that it was either done through injection, compounded through cream or injection. Why? Because we know for many, many, many years, glutathione is not well absorbed as an oral supplement unless you get the proline greens, because we have a patented trademark ingredient in there called emothion, which is now a bioavailable form of glutathione. Clinical Pearl number 2. But at the heart of Dr. Perlmutter's protocol is the 1,200 milligrams of CoQ10. So about 12 years ago, we came out with a version of CoQ10 combined with DMG. 300 milligrams of CoQ, 300 of DMG. We love that formula, the Power CoQ10 600. And we started using that in our Parkinson's protocol. And guess what? It made it even better because of the ability of DMG to increase oxygen utilization. And when you increase oxygen utilization and that blood flow carrying those nutrients is enhanced, everything you combine DMG with gets better absorbed. So that Power CoQ10 600 became a powerful nutrient combination. And it's at the core of our protocols for Parkinson's and cardiovascular disease. So, I get this question all the time about CoQ10, and that is, should I take ubiquinol? Should I take ubiquinone? I thought ubiquinol was better, and ubiquinone is old. Yes and no. If you prefer a soft gel delivery method, then I do recommend ubiquinol, because in that fat delivery method, it is better absorbed. So if you like soft gels, sure, go with ubiquinol. We have ubiquinol here at the Weiner Wellness Center under the Nutritional Frontiers brand. If, however, you prefer the chewable delivery method, you've got to go with ubiquinone. Now, ubiquinone, they'll say, oh, I thought that wasn't absorbed. Well, if you're taking it in a capsule, yes, or in a soft gel, ubiquinol is better. But in a chewable format, everything changes. We found out years ago that in a chewable format, ubiquinone mixes with saliva, and then it becomes water miscible. The saliva becomes the transport mechanism to get it into the blood without going through the digestive tract, the stomach, and needing fat. Because even with a lot of CoQ10 formulations, they tell you to take it with a meal that has a high fat, or take it with some peanut butter, or take it with something. Don't take it with fruit. Take it with a nut or nut butter because of the fat content. And sure, I agree. But with a chewable form of CoQ10 and ubiquinone, you don't need it. You don't need it. The saliva is your friend. That's what enhances the absorption into the body. So here are some of Dr. Sinatra's recommendations on how much CoQ10 you should take. Daily preventative, nothing less than 100 milligrams. I remember years and years ago, we had 30 milligram dosages per capsule, or soft gel. We had 50, but the more we learn and the more we deprive ourselves and the more we destroy. Okay, 75 million people in this country are on statin drugs. And 100 milligrams is just not going to do it. You've heard me talk many times about getting back to a level playing ground, getting back to zero before you can get on that path to optimal health. You can't get on the path to optimal health while you're below zero. And 100 milligrams, if you're not taking a statin drug, might get you back to zero. I think that's just the starting point, if you ask me. But according to Dr. Sinatra, anything with the heart, angina, cardiac arrhythmia, blood pressure, and even mild gingivitis, you want at least 200. So 200 to 300 milligrams preferably. And there you have the chewable delivery method fits right into that category at 300 milligrams. If you're taking a statin, Dr. Sinatra recommended 300 to 400. I say go right to 400 minimum. If you're on a statin, you want at least 200 to compensate for what's being destroyed, and you need another 200 to start building the stores again. So 3 to 400 if you're taking a statin, or if you have mild to moderate congestive heart failure already. For severe congestive heart failure, then you need 300 to 600. So now you're looking at Power CoQ10 600, 2 of those a day minimum. 2 of those a day minimum. It's easy to do. Before, if you needed 600 milligrams of CoQ10, or if you were a Parkinson's patient, when we first had this protocol, you had to take maybe 1,200 milligram capsules or soft gels, and 600 of the 100 milligrams to get relief for chronic heart or congestive heart failure, chronic heart failure. So now you can get that in 1 chewable or 2 chewable Power CoQ10s. And of course, we've said up to, he recommends up to 1,200 for Parkinson's. We've seen some physicians are using more than 1,200 and getting results with Parkinson's patient in conjunction with omega-3s and CBD. So more is better when it comes to CoQ10. Now, folks, many people have asked me this, and I'm just going to come right out and tell you, if I was on a desert island, they said, what would be your one supplement? You can only take one. I've heard people say D3. I've heard people say omegas. I say, wait a minute. If I'm on an island, I'm going to get all the sun I can need. So I'll have my D3. I'm going to have fish at my disposal. So I'll have my omegas. But the one supplement that I would not go without is Power CoQ10's triple strength. because I get a twofer in this. I get my 300 of CoQ10. I get my 300 of DMG. So that twofer by itself, this doesn't get any better. Chew as many of them as you can. To me, folks, this is one of those supplements. It's been in my core 4 since I can remember. My original, just to give you a little history, my original core 4 supplements were a good multivitamin, a good omega-3, a good probiotic, and a good antioxidant. So that antioxidant was always CoQ10, as far as I was concerned, if it only could pick one. My core 4 nutrients have changed over the years slightly, okay? I'll tell you what they are now. My core 4 nutrients now are Power CoQ10 600, because I get my DMG and my CoQ10 in one chewable tablet. Probzyme, because I get probiotics and digestive enzymes in one chewable tablet. Okay. And then D3 and K2, which I get in the form of Super K2 Plus, because I get not only D3 and K2, but I get vitamin A as a bonus on that one. So there's 3. The 4th, that 91st essential nutrient. Yeah, a full spectrum phytocannabinoid rich hemp oil. Yep, that's the core 4 right now. But at the heart of it is and always will be Power CoQ10 600 from Nutritional Frontiers. I won't go without it, folks. I think it's something that every member of your family, we have Power CoQ10 in a 100 milligram chewable tube. Okay, safe for kids, absolutely safe for kids. You think kids are suffering free radical damage these days? Of course they are. Just look at their diet. Start everybody on CoQ10. It's safe. You know, you don't have to take 300, 600 milligrams as a kid. No, but most of the adult population out there, we're suffering from lots of free radical damage. We're suffering from lots of cardiovascular damage, and CoQ10 needs to be your friend. Now, I mean, we've talked about all the great new formulations that have come our way, but at the heart of it, that one antioxidant you should not go without is coenzyme Q10. That's who the king of nutrients is, Q, at least in our world. Are there any questions, Tracy?
Actually, hang on, I'm being blinded by sunlight.
Get out of town. Where?
Ooh, I know. You
Out there in
wouldn't
the
think it was
sticks?
coming in the sticks. It got
Yeah.
past all the trees in the sticks. Yes, actually, there was a couple of comments. One is from Pam. My husband takes a statin and a blood pressure medication. I want to get him off both. I'm not sure if that was a question.
Also, but you can't take him off those, especially the blood pressure. He has to do that in conjunction with his physician. But what you can do is get him on Power CoQ10 600. That would be number 1. And then, well, you know, this whole discussion, we talked a little bit about it as far as blood pressure goes at the round table. You know, years ago, we used to recommend a milligram of grapeseed extract per pound of body weight to regulate, keep blood pressure steady and regulated, not spiking up and down. Grapeseed extract always has been the go-to when it comes to fortifying the walls, the lining of the arteries and the capillaries. So what we did, of course, and we talked about this on Saturday, we took it a step further. What I would suggest is that a combination of Power CoQ10 600 and our CirQ Core formulation that has nitric oxide components, open up the blood vessels, open up the capillaries, let blood flow. Guess what? Blood pressure naturally comes down when it doesn't have all the restrictions in the blood vessels. Okay, so get the heart strong with CoQ10, amplify it with DMG, and then our CirQ Core product would be my next go-to. So that would be a great protocol. Those two as a 1-2 punch. Then have his physician monitor him for the next couple of months and gradually work with him to get him off of those blood pressure meds and the statins, of course.
Yeah. I mean, the statins, that's a tough conversation sometimes with physicians because they think that the statin is lowering the cholesterol. And Joe, we've said it over and over again. Cholesterol is not a bad guy. He's a sugar alcohol. He needs a good fat to bind with to go make healthy hormones and brain. I don't know why we try to kill him all the time. Poor little cholesterol. But, you had a great lecture. And, the other thing is that you can monitor yourself, right? Sure. You can take your blood pressure every morning at the same time, which is, the best way to do it. And as you see that blood pressure declining, then you have to have those conversations with your licensed medical professional that you're doing some things to help optimize your health and you would like to decrease your medications. But that's a conversation. And I think most people think you have to do one or the other, like it's all allopathic or it's all natural. And really what we're trying to get across with this entire summit is that we have to learn to work together, that people don't want to be on lifelong meds.
Right.
Nor do they want to be on lifelong supplements. So it's really about getting the body out of the abyss, getting it to a good nutrient standpoint, and then learning how to supplement your life with the right nutrients when you need them. And that comes through education, right?
Exactly. And let's go back to what causes serum levels of cholesterol to go up. We touched on it earlier. It's not because you're making too much. Okay? It's not. There's a small percentage, Tracy, of the population, less than 1%, that has a genetic predisposition to producing too much cholesterol. It's called genetic hypercholesterolemia. Wow.
Mm-hmm. Wow, that's a lot.
It is. But very small population percentage, less than 1%. If you don't have that, you don't make too much. Okay. Right. You're not getting it from Uncle Harry in your genes, and you're not getting it from the shrimp you ate. Okay. You're not getting high cholesterol from that. You're getting high cholesterol levels, serum levels. If they're up over 300, 400, it's because you have an oxidation problem, not a cholesterol problem. Because remember we said earlier, when those lipoproteins oxidize, because you have so much free radical damage and your body's trying to stop it, that just doesn't get shut off. That's an oxidation problem. If your body's low in vitamins and antioxidants, the cholesterol will turn to plaque. Your levels will go up, but it's not because you're making too much.
Right.
It's because you're not processing properly the cholesterol in your body.
Correct. And then Evelyn was asking, did she hear you mention glutathione in a cream form?
In the original Parkinson's protocol by Dr. Perlmutter, he recommended that the glutathione at 200 milligrams a day be either in a cream, compounded cream, or injectable. Okay. That was in his original protocol.
Right. And, one of the things we have to remember is sometimes the delivery methods of the right forms of ingredients were only available 5 to 10 years ago in those pathways, right? Injectable creams. And now what we have to remember is that science evolves everywhere, including the nutraceutical line. So also the studies on those nutraceuticals and delivery systems. What I found, Joe, and I know you and I have talked about this, is chewable CoQ10 versus the ubiquinol. If it's a chewable, the blood levels are the same.
Yes.
So it didn't matter how the delivery system came in, where a couple years back we were saying, oh, no, we can't do it that way. So I think we started out this morning with the commentary and in the roundtable and Dr. Orbach saying, like, science is evolving, right? And so I think that applies to both sides, not just in the allopathic or the medical, but also in this industry of nutraceuticals and supplementation. And I really think, Joe, we need to make a call out for them to do more studies on nutraceuticals now, since we know more. Since our really dumb amounts were from studies like 50, 60 years ago. I mean, RDA, sorry.
Ridiculously. I like ridiculously dumb amounts. Yeah.
Even better.
Even better.
Always taking it to the next level.
Absolutely.
Well, that was an awesome presentation. Thank you for your time. And thank you, everybody, for joining us today. Go see Joe at the Weiner Wellness Center. They are open. Stop in, have a talk with somebody there. It can help you enhance your health, make an appointment. If you want to order your products, they are still doing curbside delivery, and they are doing shipping, which is free over what, $75?
$75. Yeah,
that's
all
awesome.
Free shipping.
Yeah.
And the Power CoQ10's on sale, 30% off.
That's great. 30% off supplements and CBD. And what time are you open till today, Joe, for people?
Actually, today and Wednesday we'll be open till 7, and then Tuesday, Thursday, Friday, and Saturday till 5.
Awesome. Well, thank you so very much for your incredible lecture. And thank you, everybody, for joining us today at the Weiner Wellness Virtual Summit. We're so excited that you're here. And, we will be back tomorrow morning at 8:30. Please tune in. We have our morning commentary coming up, and we're just looking so forward to this whole week. So tomorrow on the schedule, just to give you a little teaser, we'll go over some of the topics. So Tuesday, March 9th, 8:30, we're starting with our morning commentary. 9 o'clock, we'll be doing the contagion myth with Dr. Kim Furman. She's a naturopathic doctor. We have the gut-brain connection with Candace Corcoran. She's a certified natural health professional. She is also one of our educators at Nutritional Frontiers. At 11 o'clock, I'm coming in with the lymphatic system, the key to healthy weight prevention and chronic illness. I'm going to just break down what the lymphatic system does and why it is so important that we keep it moving and healthy. And then at 12 o'clock, back by popular demand, is Dr. Judy Mikovits. She's a PhD biochemical researcher. She is doing detox solutions for vaccines. And then we're going to have a product education hour at 1 p.m. So thanks for joining us. We really appreciate you. Have a great evening. Stop in at the Weiner Wellness Center, and we'll see you tomorrow. God bless.